Dr. K. Ashok, who was awarded with the Siva, prestigious Siva Award, had this vision of reaching mental health in the two steps, have evolved the whole program in such a way that Manasa not only caters to the issues or the problems of mental health, but dedicates itself to promote mental health, prevent mental health issues too. Thus, in all the three levels, Manasa is working, has been working more than 10 years. The people who join their hands with Manasa are also contributing to this vision. And currently, we also have Kriti Ashok Memorial Fund. Since 2017, we are having this college, which is also associated with Manasa Education Foundation to train people. We have a department of psychology, which is headed by Dr. Anshul, and the faculty. So we now have a good group of resource persons with us who will develop by providing the teaching as well as training content of the curriculum. The curriculum has four theory papers and the two practicals. The idea is to give you inputs, the knowledge, the basic of the theory to understand the human beings, their behavior and the mind. And the practicals are mainly contain training you in the skills of concept, the basic skills of concept. Thus, this orientation program will help you to understand how you will proceed with your learning for the whole 1 year of your journey of Manasa Education Foundation. Now, with this few introductory words, I'm very happy to request Dr. Rajini Abai, our director, and our administrator, Professor Ramsundar Vaniga, to inaugurate this program by lighting the candle. Thank you, sir. So now, Madam is asking for the introduction of the participants. So can I request each one of you to introduce yourself by mentioning your name, your background, the place from which you have come, as well as the course which you have taken. First, I'm very happy to introduce myself. I am Dr. Sandhya Gavili, coordinator of Manasa Education Foundation and principal at Ashok Memorial College. I'm very happy to introduce my team.
He is Mr. Manjuna. He is assistant professor at the Department of Psychology. Here is Preeti. I think you must have spoken to her, who is assisting us at the office to coordinate all these programs of Manasa Education Foundation. He's Sarah Shankar, who is assisting at the office, and Renu, our technician. So can I take the introduction of yours? Some of you are already here because of the other courses in another way you have been connected with us. I'm very happy to take your introduction and then continue the program.
I am Chetan, so I'm basically a mechanical, but I worked in corporate for 14 years in software. Then right now I'm still in Hamburg, so I'm coming with my mom. So I've moved here. So I've heard of Nashville quite a lot because one of my mom's brother got dated by him. So it's very important. So, and I'm right now going through a cooperative form of society, which I'm a director, and I do a lot of other things like consulting and there's all about it. And I was introduced here by my sister, who liver transplant, and she knows Vinay out Dubai Hospital. So they actually asked me to wait. Thank you. Okay. Uh, my name is Nalenda. Basically, I'm from here. Online got up in Sagat, studying in Shimoga. I'm basically electronic engineer and have close to 30 plus experience in corporates. My last trip was with Sachin Tendulkar in this startup, which came for 6 years. So I came back here to take care of my mother. She got a place to during COVID. To take care of her, I had to leave my corporate job and settle here. So doing farming and going to few colleges and giving corporate background exposures to them because they are just getting out of academics. So they should have exposure to the corporate scene. So basically, soft skills, interpersonal skills. So I'm into that. I connected to this institution through my daughter, who is now in BA first year in psychology. So that's how I connected. And madam told me that you can refer this diploma process to the friends and relatives who are willing to take it up. Can I take it? She said, yes, of course. So this will help me. Yeah. This would help me because now that I'm here doing problem and during the life and doing colleges, students are following with getting the management exposure, like leadership. I thought this area was so like me, but rather than better. That's thank you. Ini course introduce and nam start
I'm Sri. I'm I will graduate. Previously, I worked as a teacher and worked as a teacher. And currently, I'm working as a government. So, my family was as we get high salary, combined as but I'm losing very much active to student. So, and I've seen children struggling with the studies and they struggle a lot coming with the social character. So I thought that this was definitely help me. And I want to start a new journey with this institution with my counseling career. Folks.
ನನ್ನ ಸೊಲ್ಲಿಗೆ ನಾನು ಆಧಾರ್ ನರ್ಸಿಂಗ್ ನನಗೆ ಕೌನ್ಸಿಲಿಂಗ್ ಕೌನ್ಸಿಲಿಂಗ್ ಜಾಯಿನ್ ಆಗಿದ್ದೀನಿ ಸರ್ಕಾರಿ ಮೇಡಮ್
I said, Geeta, basically I have master. So I took the class 2 years back to Shimoga. It is by this particular course, I'm very interested in this particular course because my father is also suffering some brain stroke injury the last 20 years back. Okay, Ashok has a duty here. I was just that I'm very proud to say that I'm working in this institution. I'm very connected with this from last 2 years. And I'm very, because basically I was a teacher, working as a teacher, and I'm also very connected with the students. I'm very interested in this particular course and provide regarding the education department and the students, and also the students, they can follow you all the focus around the give a solution regarding the private counseling of students. Thank you. Hi, my name is and I my son my childhood because my grandmother was Dr. K. Gopal, and he was associated with father. And also I have done my master's from JDBs. And after that, I have recorded and have worked as a learning education for almost 10 years. And now after my childhood brought a particular day, and I wanted to get back to my psychology field. And also I was thinking from where I should start. And then your mind then decided my,
mentors told me that this course might helpful, and also I have taken up course on music therapy, so both are going hand in hand for now.
Good morning, all. So my name is Saumya. I'm from Shimoga only. My mother place is from Sakleshpur. So yeah, I'm a coordinator of a Samruddhi preschool. I'm running a preschool, and I'm also the secretary of the Samruddhi Education Trust. So basically, I'm MTech computer science student, and I worked as an assistant professor before at Hyderabad, and also I worked as a professor in National College, BS Computer Science. So after my child was born, so that is also same case. I took a break. Yeah, and also since we are running a preschool, so every day I'm encountering these small problems. Whatever we are observing in small kids, the age from 2 to 6 years. Oh, that's why I thought this counseling, and also the main concern was to help with the mental health, because emotional intelligence it is also very connected with this counseling and child psychology. So I thought why this course will help me for doing the future work. So, and also that's why, and Sandhya Kaveri ma'am also guided me in choosing the perfect course. So thank you, ma'am, for that. So that's it, ma'am.
Myself, Nandini Prakash. I came from Bhadravati. Basically, I'm a homemaker. Now I got an admission in Diploma of Counseling and Guidance. Thank you.
Myself, Sangeeta Pipai. I'm from Shimoga. I have been, Sandhya Kaveri ma'am has been guided me to take this subject particularly. I was about to confused. I was just confused which subject I have to take. As I am a teacher from past 12 years, I'm teaching in St. Joseph School here. So then madam said me, you just go for this and it will be helpful for you. Thank you, ma'am.
Good morning, all. I'm Asha. Previously, I was working in Aurobindo PO College. Now I have moved to Sahadri College, and also I'm a freelancer. I guide and help the students to clear their NEET and CET classes. I got connected with this course from one of the faculty in your institute, that is Madhuri ma'am. She lives in our apartment, so she suggested me to take this, and I also felt that it will be helpful me to connect more towards students. So thank you, Vandana.
I am Rashmi. I am from Shimoga. I am graduate in BCom. I am working in PS Public School as a kindergarten teacher. I want to learn more about child behavior and psychology. That's why I took this DCSE Child Psychology.
Good morning, everyone. I'm Sri Raksha Jeevat. I've completed my master's in psychology in this college and currently working as a counselor in Podar International School. I took this course because it will help me to improve my career. So have chosen counseling and guidance. Thank you.
My name is Asha. I am basically from Davangere. So I have joined a diploma in counseling in SLD, specific learning disorders. Thank you.
Good morning, everyone. My name is Savita Madhav. I am basically from Shimoga. I've taken up diploma in counseling and NLP. That would help me in my career.
Good morning. I'm Priyanka. I'm from Shimoga, and my sister introduced me to this course, hoping this will help me professionally and personally both. Thank you.
Good morning, everyone. Myself, Fatima Shahnaz, and I'm from Mangalore. I have done my MSW under Anapa University. And Sandhya ma'am, you might have forgotten. Do you remember me? I'm also from your place, from Manchi. I have done my internship in Manasa Hospital itself in 2016. Yeah. So this was my dream actually. But later I got married and I have 3 daughters. So now I have decided to back to my dreams.
Good morning, all. My name is Ramiza. I'm from Mangalore and I did the PG on medical social work. So I was interested in counseling sector. So I chose this course. Thank you.
Thank you all. Thank you so much. This is how Manasa Education Foundation has grown, by enriching itself because of the students who walked in, joined the course, contributed to the course as well as to the community because of their own experience in the field as well as experience of this counseling. Thank you so much. So now I request our director, Dr. Rajini Madam, to address all the students.
Good morning to you all. Good morning to Dr. Sandhya and Ramchandra Balika sir. Today's is a very important day for you all, and you're all going to enter into the most important part of our system, that is the mind. Dr. Ashok Bhai had decided on this course and we have gone through. Right from 2003, Dr. Sandhya Kaveri has been with us, and as you've seen, most of you have been inducted into this course because of ma'am. So she is our pillar of strength for this course, which has carried on for more than 21 years. She has seen all the ups and downs that this course has faced and has been with it like a pillar of strength to see to it and navigate it to its banks. And I'm thankful to you all for having joined this course. A few words about how the mind can be very important are 2 small incidents which you all have heard in the last few days. You've heard of that boy named Devavrat Mahesh Rekhe, who had, chanted 2000 Shukla Yajurveda shlokas in 192 different ways. Just a 19-year-old boy in Varanasi, and has proved this feat is possible after exactly 200 years. The neuron network that is present in our brains and in the whole body can pick up so many things. We have heard in history and in our one Ekashruti Dhara, we have heard of Shankaracharya who could remember things just hearing it once, and Vivekananda who could remember things hearing it once. So though many of you have completed your education very early in life and have again joined the courses, or in the course of your life, of your career, to improve on your career, this course will not only help you to deal with people outside, it will help you in your self-actualization. You understand yourself better to know what you need to give it out to the world. The other important person, most of you are having young kids, is Katie Hind. Her investigations and her research on breast milk has come to the forefront. You'll be surprised, she was researching on the rhesus monkey, which was very close to human beings, in the stages of evolution. So this rhesus monkey breast milk, she found, had different composition of different nutrients that are present in the milk when it gave birth to a male monkey and when it gave birth to a female monkey. Imagine the discrimination at that level. So we would have stood up in protest that this should not happen with mother's breast milk. But well, the male body has got certain requirements biologically and genetically. So the mother's milk decides at that very stage as to what nutrient should go to the child early. When she accidentally found this out and told her colleagues, they said, no, it's very minor and it is just an error of the machine, which you should overlook and not go into detail. But she went into details into it, and she found that the same percentage of difference was present even in the human milk, including the foremilk and the hindmilk. The first part of the milk which the child sucks and suckles is of a different composition than the one which suckles last. So a child which gets exhausted when it finishes half the breast will not get the other part of the hind milk. Next, there is something called the salival backlash. When the child suckles at the nipple, the saliva which is secreted through the child gets into the mother's lymphatic system and sends messages to the different cells of the body to produce antibodies for the child. Can you imagine the level our cells function? The mind which every cell of our body has to protect our progeny. So the child is protected from any ailments outside by the mother's milk, which produces specific antibodies for the child's ailments which is present in the body. You get my point? Now, this sort of a backlash again was studied further, and they have proved beyond doubt that this saliva is such a powerful thing that the child has. What about those children who don't suckle at the mother's milk? They take these top feeds from outside. Well, even that milk has got many antibodies, which will help the child to grow at different stages. But we insist that a mother, invariably, if she suckles the child, the milk production is always positive and it will come. What about surrogate mothers? The mother may not be in a position to suckle the child. At times, the co-sister or the grandmother at times also. Nirmala Kesari was one pediatrician of Davangere who saw to it that even the grandmothers could suckle the child and produce the milk. Well, that body also has got the antibodies which will help the child. So that was the importance of the mother's milk which is present. And this Katie Hind, if you can Google her or see her, her papers have been published all over, and that is making the scene wherein people are being forced, getting into that mindset that they can nurture the child. The hugging of the child, the kissing of the child, and also making love to the child helps the child to develop many self-defense, protects the child and sees to it that it can face the world. The mother's milk even sees to it that the child, when it faces different challenges in life, can face those stresses later on at the teenage and at middle age and face life for the present situation. Can you imagine the cell doing all this? So the mind that the cell has is something which we need to understand through these studies of counseling. And you are going to be the main instrument to see to it that people who sit across you will get that confidence to face life and come up in life and not give up on very small things which are very trivial according to us, but for that person it may be something very great. But still, you can lead how you need to have your body language before you counsel. That also is part of the training program. I thank you all for having joined this course. And I thank all the staff who have been here on a Sunday to help us start this program. Thank you very much.
Thank you, Madam, for formally inaugurating and addressing the students by emphasizing the importance of mind, its power, and the role of counselors by developing skills of empathy. Thank you, Madam. So with this small program, we conclude the inaugural part of the program. Now the session will be followed by one very important technical session by Dr. Preeti Shanbag, who is the academic director. She will speak about the basics of counseling. So with that, your academic activity starts or initiates. So on behalf of all the students of Manasa Education Foundation of 2025-26, those who have participated here as well as through virtual mode, I thank Dr. Rajani Madam for coming over here and inaugurating the program. Thank you so much. I also thank Professor Ramchandra Baliga sir, who has arranged all the administrative work related to the program by coordinating and developing a MOU with the Manipal Skill Development Center and being here for this inaugural program. Thank you so much, sir. Thank you all for giving your wonderful self-introduction and participating in this inaugural program. The program will continue with the technical session by Dr. Preeti Shanbag. We have checked the study center for this book. Once you are complete, then if you have class training, everything will happen. The nursing home, one's hospital. We have another study center there in Mangalore, mainly Ayurveda counseling and the therapy center, which is run by Shweta, is also one of the study centers. Another study center is in Bangalore. Bharatiya Vidya Bhavan is continued to be our study center for Bangalore students. One more is at Mysore, which is coordinated by Nageshri Madam, who is running a therapy center called Skanda at Mysore. Then Dr. Lancy D'Souza is also mentor for these courses, and he is a member for our board of studies. He is also coordinating. That's how the course is run. Of course, we have a study center at Solapur also. One Madam Rekha, who is associated with the Datta Sai Psychiatric Hospital, is coordinating these programs at Maharashtra, mainly at Solapur. And now, as I'm very happy to invite and welcome Dr. Preeti Shanbhag. First of all, I request your pardon for starting the whole program little late because of the technical difficulties in going for online. So now very happy that Dr. Preeti Shanbhag, who is our academic director, is with us. Dr. Preeti Shanbhag is basically a psychiatrist, now is a chief psychiatrist for our whole Manasa group of institutions. She is the academic director also. She has done her MD in psychiatry from Davangere, and she has also done her MS in counseling and psychotherapy. Then several other courses related to hospital management, then the therapies, different therapies. Her main area of interest is community mental health and child mental health. She is the reason who has initiated our different institutions, the programs of Manasa. Our Manaspurti Child Guidance Center was her dream child. Because of her interest, Manaspurti has been started in 2015 and 16. This college, Katil Ashok Pai Memorial College, as per our Dr. Ashok Pai, her father's dream, she has started Katil Ashok Pai Memorial College with the great vision of developing education and the students to have training in different fields with the much competency and quality. So now at the college we have 5 different undergraduate programs along with the undergraduation in psychology, BA and BSc in psychology. We have MSc in psychology. We have PhD program in psychology. We also have MSc in clinical psychology and MPhil clinical psychology program. All those programs are according to the guidance and the vision of Dr. Preeti Shanbhag. So I'm very happy that Dr. Preeti Shanbhag has been associated with the Manasa Education Foundation programs in different levels, starting from developing the curriculum, the syllabus, and being in the board of studies, being in the board of examination too in all these years. So today is a very special moment for us because the program starts with her technical session on basics of counseling. She's going to teach the students of this batch regarding why counseling and how counseling, because that is the basic for us to understand the whole program and the curriculum. So on behalf of all the students, I'm very happy to welcome you, madam, and I request you to continue with the session.
How do I move it now? Shall I have it now? What do I do? What? ಹಿಂದೆ ಹೋಗೋದಂಗೆ ಬೇಡ ಅಲ್ಲ ಬಟ್ ಹಿಂದೆ ಹೋಗ್ಬಿಡಿ ಎಸ್ ರೈಟ್ ಕ್ಲಿಕ್ ಮಾಡಿದ್ರೆ ಮುಂದೆ ಹೋಗತ್ತಾ ಇಲ್ಲ ಲೆಫ್ಟ್ ಲೆಫ್ಟ್ ಕ್ಲಿಕ್ ಅಲ್ವಾ ಆಗ್ತಿಲ್ಲ okay one please go back yeah thank you a very good morning to all of you. First of all, I thank Dr. Sandhya Kaveri for giving such a kind introduction of mine. And I thank all of you for choosing Manasa to start your counseling journey with. In an effort to make it a little more interactive, I would like to know how many of you are already working in the field of counseling. If you could just put your hands up. May I know where, ma'am? Okay, and since how long have you been in the field of counseling? It's been a year. Okay. Now, why I'm asking this question is because when anybody takes up our course, they take it with a lot of different ideas of what counseling is and what they need to do in this field. So my first question to all of you would be, what was your idea when you took up the course? One more question in between, it would be, how many of you understand Kannada? Most of us, yeah, all right. So if you could let me know, any one of you, you can please get up and let me know, why is it that you took up counseling? What interested you in this? Yes, sir, you can sit and start, please. Okay, sir.
Where most of us were in stress actually. I also see, I mean, I read news and I see this journals and all. So in present situation in the world actually, after blood pressure or diabetic, the third most issues human beings are facing is what is stress. Because of that stress actually it leading to a either diabetic or blood pressure. This. So that is the reason actually.
I
Okay.
understand. So please introduce yourself.
Yeah.
Your name is?
My name is Jnanendra.
Jnanesh. Okay,
Yeah.
sir. Anybody else?
I'm also from IT background, not in IT right now. So I have seen in my family, my mother's brother went through when there was not much of a treatment in psychiatry. He went through a lot, and Mr. Ashok Pai sir had treated him. So that was part of in the family what I had seen, and as he said, there are many things like stress is the main factor today across the world. So many journals are already publishing that the tomorrow's pandemic is mental illness. And on top of it, there is a lot of taboo also, not only in India, across many of the developing countries. And I've always been interested in this field. So, and my sister being a doctor, she recommended me to take up this course. Thank you.
Nice. I think hand up.
My name is Shiv.
Okay, go ahead, sir. You can sit, sir, please. Sir, ನಿಮ್ಮ ಹೆಸರು ಹೇಳ್ಕೊಳ್ಳಿ ಸರ್.
ಎಸ್, ನಾನು ವಾಸುದೇವ್ ಘಾಟೆ ಅಂತ ಜ್ಞಾನದೀಪದಲ್ಲಿ ಟೀಚರ್ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಒಂದೇ ವರ್ಡ್ ಅಲ್ಲಿ ಹೇಳ್ತೀನಿ, ನಾನು ಮಕ್ಕಳ ಜೊತೆ ಮಾತಾಡಿದಾಗ ಮಕ್ಕಳು ಸರಿ ಆಗ್ತಾ ಇದ್ದಾರೆ. ಐ ಕಾಲ್ ಇಟ್ ಆಸ್ ಕೌನ್ಸಿಲಿಂಗ್. ಹಾಗಾಗಿ ಇಲ್ಲಿ ಹೆಚ್ಚು ಕಲಿಬಹುದು ಅಂತ ಬಂದಿದ್ದೀನಿ ಅಷ್ಟೇ.
Anyone else?
Myself, Nandini Prakash. I'm a homemaker. Actually, I took this course to understand and support my children as well as my husband. And I want to work as counselor in future.
That's nice to know.
Thank you.
Anybody else? Ma'am, I think you wanted to take the mic, right? Yeah.
ಎಲ್ಲರಿಗೂ ನಮಸ್ತೆ. ನಮಸ್ತೆ ಮ್ಯಾಮ್. ನನ್ನ ಹೆಸರು ಅರುಂಧತಿ ಅಂತ. ಐ ವಾಸ್ ವರ್ಕಿಂಗ್ ಇನ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಆಸ್ ಅ ಪ್ರೊಫೆಸರ್ in Department of MBA. I used to counsel the students of masters as well as engineering, but without any proper, professional degree. I resigned from my job there and I settled down in Shimoga because Shimoga is my native place. After coming here, I joined Bharati Vidya Bhavan, and there I am given a special responsibility of counseling students. So for that reason, I especially wanted to pursue this.
Nice.
Thank you.
Thank you, everybody, for your contribution. Now, going by what they all spoke, what two things which I could see in that is, one is people who want to counsel come from very, very different fields. Some from IT fields, some are teachers, some are homemakers. So a lot of people are interested in counseling and doing the right thing. The second is the counselees or the people you want to help are also very varied. People working in IT sectors, students, your family, and a lot of times our students tell that even to change ourselves or make some changes in our personality, our routine, the way we think, we have taken up this course. Now, apart from all these things, as Sir was rightly mentioning, the number of counselors in India is very, very less. And as mental health professionals, we see a huge need for this group of professionals to work in the mental health spectrum. To give you an example of how this situation works, if you see, and these are just numbers, believe me, ಇದ್ಯಾವುದು ಇಲ್ಲಿ ತೋರಿಸಿರುವಂತ numbers are not the right numbers probably because of the high level of stigma associated with any kind of mental distress, any kind of mental ill health, due to which about 30 to 40% of the OPDs which reach general medicine, neurology, OBG, gynec, about 30 to 40% of them are actually cases handling stress, handling tension, having mild depressions and mild anxieties, which come out in very many multiple different ways. And these patients or these clients will never end up contacting a mental health professional ever. They will go for ನಂಗೆ ತುಂಬಾ ತಲೆನೋವು ಬರ್ತಾ ಇದೆ, ತಲೆನೋವೇ ವರ್ಷದಿಂದ ಹೋಗ್ತಾ ಇಲ್ಲ, or ಸೊಂಟ ನೋವು ಬರ್ತಾ ಇದೆ in women. Okay, so they think that it might be related to their periods and they keep going to a gynecologist. But there is no actual medical reason why that back pain has to come or the headache has to come. Or in students, memory loss, lack of concentration, not being able to sleep. All of these people are probably suffering from stress or mild anxiety depressions, which we call as common mental illnesses, okay, which are a lower severity of illness with the propensity that it can increase into something worse. ಈ ಲೆವೆಲ್ನಲ್ಲಿ ಅದಕ್ಕೆ ಸರಿಯಾದ ಚಿಕಿತ್ಸೆ ಸಿಕ್ಕಿಲ್ಲ ಅಂದ್ರೆ then they can get into depression, anxiety, some of the major mental ailments. So there is a huge population of pre-morbidly ill people. ಅಂದ್ರೆ ಅವರು ಕಾಯಿಲೆ ಆಗಿದಾರಾ ಅಂತ ಕೇಳಿದ್ರೆ they are not ill. But ಅವ್ರು ಚೆನ್ನಾಗಿದಾರ ಅಂತ ಕೇಳಿದ್ರೆ they are not well either. So in normal terms as we call it, ಒಂಥರ ತ್ರಿಶಂಕು ಸ್ವರ್ಗದ ತರ, ಆ ಕಡೆನೂ ಇಲ್ಲ ಈ ಕಡೆನೂ ಇಲ್ಲ. ಇಂಥದ್ದೊಂದು ದೊಡ್ಡ population is not visible to us. And what I'm showing you, these numbers are just the tip of the iceberg. And see, the tip of the iceberg only so enormous that we cannot comprehend it. If you see, about 15% of the adult population, ಅಂದ್ರೆ ನೀವು ರ್ಯಾಂಡಮ್ ಆಗಿ ಎಲ್ಲಾದ್ರೂ ಒಂದು ಕಡೆ ಹೋಗಿ ಅಲ್ಲಿ 100 ಜನ ಇದ್ದಾರೆ ಅಂದ್ರೆ ಅದರಲ್ಲಿ ಸುಮಾರಾಗಿ 15 ಜನರಿಗೆ ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳಿಗೆ ಚಿಕಿತ್ಸೆ ಬೇಕಾಗತ್ತೆ. 15 people, which is a really huge number. There are about 20 crore people in India who need treatment for major mental illnesses. And by major mental illnesses, I mean schizophrenia, substance dependence syndromes, ಯಾವುದೇ ಬೇರೆ ಬೇರೆ ಮಾದಕ ವಸ್ತುಗಳ ವ್ಯಸನಗಳಿರ್ಬೋದು, ಅಥವಾ ಬೈಪೋಲರ್ ಡಿಸಾರ್ಡರ್ಸ್, ಮೇನಿಯಾ, ಡಿಪ್ರೆಷನ್, ಇಂಥ ಎಲ್ಲ ದೊಡ್ಡ ದೊಡ್ಡ ಕಾಯಿಲೆಗಳ ಸಂಖ್ಯೆನೆ somewhere around 20 crore out of our 1.2 or 3 billion. Lifetime prevalence of mental illness in any person's life, if you take, somewhere around 1 in 7 people will have some sort of mental distress or a mental ailment. The level of mental distress is probably very high, as Sir said. At least about 50 different studies, ತುಂಬಾ ಸಂಶೋಧನೆ ಮಾಡಿ ನೋಡಿದ್ದಾರೆ, 50-70% Indians are suffering from chronic stress ಅನ್ನೋದು ಒಂದು ರಿಪೋರ್ಟ್ ಬಂದಿದೆ, which was so shocking that people kept feeling that this is not true. They've just done some random survey, etc. But going by what I see in my OPD or I see in my practice, I feel that that might be right. So there are a lot of people suffering from what we call as chronic stress, and these are not those. These are people who are mentally ill only. Okay. Then you have suicide rates of around 20 per 10 lakh. Again, this is a number which is a tip of the iceberg. Not many people report suicides, and hence it is looking like this. It might be at least 10 or 15% more is what we think. And the worst part being the age group where suicides are committed is the highest between 18 to 35, which means that ಯಾವ ಅವರ ವಯಸ್ಸಿನಲ್ಲಿ ಅವರು ಮುಂದೆ ಜೀವನದ ಬಗ್ಗೆ ಕನಸು ಕಾಣಬೇಕು, ನಾನು ಚೆನ್ನಾಗಿರ್ಬೇಕು, ನನ್ನ ಲೈಫ್ ಸೆಟ್ಲ್ ಆಗಬೇಕು ಅಂತ ಯೋಚನೆ ಮಾಡೋ ಸಮಯದಲ್ಲಿ so many Indians are committing suicide. And the second highest group being adults above the age of 60 or 70, where they have lack of care, empty nest syndrome, ಅವ್ರ ಮಕ್ಕಳೆಲ್ಲ ದೂರ ಹೋಗಿರ್ತಾರೆ, ನೋಡ್ಕೊಳಕ್ ಯಾರು ಇರಲ್ಲ, ಬೇರೆ ಬೇರೆ ತರದ ದೈಹಿಕ ಕಾಯಿಲೆಗಳು, ಮಾನಸಿಕ ತೊಂದರೆಗಳು ಇವೆಲ್ಲಾನು ಫೇಸ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ. The second biggest group is them. So many people are thinking that life is not worth living at any point in time. Just now, so many people are thinking like that. that at given an opportunity, I will try something to kill myself. The 70%, as I mentioned already, 70% of the Indians are facing stress and stress-related issues, by which ನಾನು ಆಗ್ಲೇ ಹೇಳಿದೆ, unexplained headache, unexplained body ache, ತಲೆ ಸುತ್ತು, ನಿದ್ದೆ ಬರ್ತಾ ಇಲ್ಲ, pimples ತುಂಬಾ ಆಗ್ತಾ ಇದೆ, periods ಅಲ್ಲಿ ವ್ಯತ್ಯಾಸ ಆಗ್ತಾ ಇದೆ, ಸೊಂಟ ನೋವು ಆಗ್ತಾ ಇದೆ. All of these may have stress in the background. Along with illnesses like psoriasis, asthma, all of these are related to psychological problems which increase or exacerbate those illnesses. About 5 crore of children at this point of time do need mental health care immediately. And again, in this group, I have not included those who are in distress, who are suffering because of excessive competitiveness, who are suffering because of relationship issues, who are suffering because of not being able to keep up with their academics. ಅವ್ರನ್ನ ಸೇರಿಸದೆ ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳು ಅಂತ ಏನ್ ಹೇಳ್ತೀವಿ ಮಕ್ಕಳಲ್ಲಿ, ಲೈಕ್ ADHD, ನ್ಯೂರೋ ಡೆವಲಪ್ಮೆಂಟಲ್ ಡಿಲೇಸ್, ಆಟಿಸಮ್, ಇದ್ರ ಮಕ್ಕಳು 5 ಕೋಟಿ ಜನ ಇದ್ದಾರೆ who need help. We have about 20% of older adults, by which I mean the geriatric age group, which needs immediate mental health care. And I'm mentioning this very specifically, caretaker burden is not a part of this. ವಯಸ್ಸಾದವ್ರನ್ನ, ತುಂಬಾ ವರ್ಷದಿಂದ ಕಾಯಿಲೆಯಿಂದ ಬಳಲ್ತಾ ಇರೋರ್ನ ನೋಡ್ಕೊಳ್ಳೋದು ತುಂಬಾ ಕಷ್ಟದ ಕೆಲಸ. ಅವ್ರನ್ನ ಯಾರು ಕೇಳದೇ ಇಲ್ಲ, ಇವ್ರ ನೋವು, ಇವ್ರ ಕಷ್ಟ ಎಲ್ಲರೂ ಕೇಳ್ಕೊಂಡು ಹೋಗ್ತಾ ಇರ್ತಾರೆ. ಬಟ್ ಅವರ ಜೀವನವನ್ನ ಅವರು ಒಂದು ಬ್ರೇಕ್ ಹಾಕೊಂಡು ಎಲ್ಲೂ ಹೊರಗೆ ಹೋಗ್ದಂಗೆ 24/7 ಅವ್ರನ್ನ ನೋಡ್ಕೊಳ್ತಾ ಇರೋದು is quite a big stress. And for years together. And those people, again, that burden is not taken care of in any of these numbers. So you can imagine how many people are looking all right externally, but internally are in a state of confusion, stress, tension, with no outlet to let these emotions out. All right. And to handle such a big burden, also one more concept that the WHO gives is called DALY, Disability Adjusted Life Years ಅಂತ ಹೇಳ್ತೇವೆ. ಅಂದ್ರೆ ನಮ್ಮ ಇಡೀ ಜೀವಮಾನದಲ್ಲಿ ನಮಗೆ ಎಷ್ಟು ದಿನ ಕಾಯಿಲೆಯಿಂದ ನಾವು ಬಳಲ್ತಾ ಇದೀವೋ ಅದನ್ನೆಲ್ಲ ಒಟ್ಟು ಹಾಕಿದ್ರೆ ಒಂದು ಮನುಷ್ಯನ ಜೀವನದಲ್ಲಿ ಎಷ್ಟು ದಿನ ನಾವು ಕಾಯಿಲೆಗೆ ಕಳಿತೀವಿ ಅಂತ. So even for people who are considered normal, that is all of us, are losing at least 2.5 to 3 months in mental distress through our life, which includes all 24 hours. And this is for people who are not unwell. ಕಾಯಿಲೆ ಇದ್ದವ್ರಂತ ಅಲ್ಲ, ಚೆನ್ನಾಗಿದ್ದವರಲ್ಲೂ ಕೂಡ somewhere around 3 months of our life, we spend overthinking, feeling bad, feeling upset, feeling anxious, feeling frustrated. So much of our life is going in that. So you can imagine. And to take care of these people, as I mentioned, the numbers you know, we have about 5,000 psychiatrists, most of them settled in urban areas. We have around 4,000 clinical psychologists. Again, they are more concentrated in urban areas. Yakandre psychological help in a ಬಗ್ಗೆ ಅರಿವೇ ತುಂಬಾ ಕಡಿಮೆ. ಸೊ ಅವರು ಹಳ್ಳಿಯಲ್ಲಿ ಸೆಟ್ಲ್ ಆದ್ರೂ ಅವ್ರ ಹತ್ರ ಯಾರು ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ ಬರೋದಿಲ್ಲ. So psychologists are again in urban areas. About 3,800 psychiatric social workers who are working in the field. But again, the number is so huge and enormous that these people can only make maybe 1 iota of a difference to such a big population. Again, one more reason why mental distress cannot be defined, or 2 reasons why mental distress cannot be defined is, ಒಂದು ಕಣ್ಣಿಗೆ ಕಾಣೋದಿಲ್ಲ. ನೀವು ಜೋರಾಗಿ ಅಳ್ತಿದ್ರೆ ಅಥವಾ ನೋಡೋದಕ್ಕೆ ಬೆವರ್ಕೊಂಡು ಕೈ ಕಾಲು ನಡ್ಕ ಬರ್ಕೊಂಡು ಹಾಗೆ ಆತಂಕ ಪಡ್ತಾ ಇದ್ರೆ ಅಷ್ಟೇ ನಿಮಗೇನೋ ತೊಂದರೆ ಇದೆ ಅಂತ ಗೊತ್ತಾಗತ್ತೆ. At any given point of time, we usually have a mask on when we go out into the society, or we are showing ourselves to the society. Atkotaane barala ನಾವು. We have a certain way of dressing, certain way of showing up to the world. And when that happens, it is very difficult for people to identify that there is some problem. We might be suffering internally, but ಹೊರಗೆ ಯಾರು ಹೇಳ್ಕೊಳ್ಳೋದಿಲ್ಲ, ಅದಕ್ಕೆ ಅವರಿಗೆ ಗೊತ್ತೇ ಆಗೋದಿಲ್ಲ. So guiding them towards help is very difficult. ಬಟ್ ಆನ್ ದ ಕಾಂಟ್ರರಿ, ನನಗೆ ಜೋರ್ ಹೊಟ್ಟೆ ನೋವು ಬಂತು ಅಂದ್ರೆ ನಾನು 10 ಜನರಿಗೆ ಹೇಳ್ಕೊಳ್ತೀನಿ, ಯಾರಾದ್ರೂ ಒಬ್ರು ಒಂದು ಡಾಕ್ಟರ್ ಸಜೆಸ್ಟ್ ಮಾಡ್ತಾರೆ, ಇಲ್ಲೇ ಮನೆ ಹತ್ರ ಇದ್ದಾರೆ, ತುಂಬಾ ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ, ನಮ್ಮ ಅಜ್ಜಿಗೆ ನೋಡಿದ್ರು ಚೆನ್ನಾಗಾದ್ರು, ಹೋಗ್ ಬನ್ನಿ ಅಂತ ಹೇಳಿ ಕಳ್ಸೋ ಅಂತವ್ರು ತುಂಬಾ ಜನ ಇದ್ದಾರೆ. ಸೊ ದ ಫಸ್ಟ್ ಥಿಂಗ್ ಇಸ್ ಐಡೆಂಟಿಫಿಕೇಶನ್, ವೆರಿ ಡಿಫಿಕಲ್ಟ್. Second thing is psychiatric ailments or psychological distress is just an exacerbation or a deficit in our normal emotions. ಕರೆಕ್ಟ್ ಅಲ್ವಾ? ಅಂದ್ರೆ ಈಗ ಆತಂಕ ಯಾರಿಗಾಗಿಲ್ಲ? All of us have faced. ಹೌದಲ್ವಾ? ಬೇಜಾರು ಯಾರಿಗಾಗಿಲ್ಲ? All of us have faced. Exam stress, all of us have gone through. Feeling lack of confidence when you go and talk on stage, all of us have gone through. So ಇದು ಕಾಯಿಲೆನಾ ನಾರ್ಮಲಾ? ಎಕ್ಸಾಮಿಗೆ ಎದುರಿದೆ ನಾನು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ಬೇಕಾ? No answers to these questions, right? So nobody knows when to refer a person. ಯಾವಾಗ ಇವ್ರ ಆತಂಕ ತುಂಬಾ ಜಾಸ್ತಿ ಆಗಿದೆ, ಇವ್ರು ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ಬೇಕು ಅಥವಾ ಕೌನ್ಸಿಲರ್ ಹತ್ರ ಹೋಗ್ಬೇಕು ಅಂತ ಹೇಳೋದು ತುಂಬಾ ಕಷ್ಟ. This is one more reason why it is not identified. And in a developing country like ours, where one generation prior to us have gone through lot of hardships, ಯಾರಾದ್ರೂ ಒಬ್ರು ಹೋಗಿ ಅಲ್ಲಿ ಹೇಳಿದ್ರೆ ನನಗೆ ಬೇಜಾರಾಗ್ತಾ ಇದೆ ಅಂದ್ರೆ ನಿನಗೇನ್ ಬಂದಿದೆ ಎಲ್ಲದೂ ಕೊಟ್ಟಿದೀವಲ್ಲ, why are you feeling sad about it? They will go back to 10 generations prior. ನಮಗೆ ಊಟ ತಿಂಡಿ ಇರ್ಲಿಲ್ಲ, ನಾವು 10 ಕಿಲೋಮೀಟರ್ ಸ್ಕೂಲಿಗೆ ನಡ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದ್ವಿ, ನಮ್ಮ ಅಪ್ಪ ನನಗೆ ಹೊಡಿತಾ ಇದ್ರು, ಆದ್ರೂ ನಾನ್ ಚೆನ್ನಾಗಿದ್ದೆ, ನಿಮಗ್ ಚೆನ್ನಾಗಿರೋದಕ್ಕೆ ಏನಾಗುತ್ತೆ? And there is no answer to that you can give. For example, I was just recently seeing a meme on the internet where a boy goes and tells his granny, ನಾನು ಡಿಪ್ರೆಷನ್ ಹೋಗ್ತಾ ಇದೀನಿ ಅಂತ. Granny says, ಆಯ್ತಪ್ಪ ಬೇಗ ಹೋಗ್ಬಿಟ್ಟು ಬಂದ್ಬಿಡು, 5 ಗಂಟೆಗೆ ಮನೆಗೆ ಬಂದ್ಬಿಡು. So something like that, where identification only is so difficult. ಇದಕ್ಕೆ ಅವ್ರು ಕಳ್ಸದ ಬೇಡವಾ ಅಂತಾನೆ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ ಅವರಿಗೆ. ಸೊ ಅದು ಎರಡನೇ ಪ್ರಾಬ್ಲಮ್ ಆಗತ್ತೆ. ಮೂರನೇ ಪ್ರಾಬ್ಲಮ್, ಹೂ ಟು ಗೋ ಟು. ಈಗ ನನಗೆ ಎಕ್ಸಾಮ್ ಸ್ಟ್ರೆಸ್ ಆದ್ರೆ ನಾನು ಸೈಕಾಟ್ರಿಸ್ಟ್ ಹತ್ರ ಹೋಗ್ಲಾ, ಕ್ಲಿನಿಕಲ್ ಸೈಕಾಲಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗ್ಲಾ, ಸೋಷಿಯಲ್ ವರ್ಕರ್ ಹತ್ರ ಹೋಗ್ಲಾ, ನನ್ ಟೀಚರ್ ಹತ್ರ ಕೇಳಲಾ, ನಮ್ಮ ಅಪ್ಪಂಗೆ ಹೇಳಲಾ, ಕೌನ್ಸಿಲರ್ ಹತ್ರ ಹೋಗ್ಲಾ? ಹೋಗ್ಬೇಕು ಅಂತ ಗೊತ್ತಿದ್ರು ನಿಮ್ ಊರಲ್ಲಿ ಇದಾರಾ ಇಲ್ವಾ, ನಿಮ್ ಮನೆಯಿಂದ ಎಷ್ಟು ಹತ್ರ ಇದಾರೆ? ವಿಲ್ ಐ ಬಿ ಗಿವನ್ ದಟ್ ಓಕೆ ನನಗೆ ತಲೆ ನೋವ್ತಾ ಇದೆ ಅಂದ್ರೆ ಪಕ್ಕದಲ್ಲೇ ಶಾಪ್ ಇದೆ, ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿ ತೋರ್ಸ್ಕೊಂಬ ಅಂತ ಹೇಳ್ತೀವಿ. ನನಗೆ ಡಿಪ್ರೆಷನ್ ಆಗಿದೆ, ನಾನು ಕೌನ್ಸಿಲರ್ ಹತ್ರ ಹೋಗ್ತೀನಿ, ಯಾಕೆ ಹೋಗ್ತೀಯ ಅಂತ ಕೇಳ್ತಾರೆ. It is a stigma in the society. They feel that we can sort these problems ourselves. So all of these reasons are why people are not coming to the right professionals. Again, there is a big group of people who do not understand the difference between the three professionals. Psychiatrist yaru, clinical psychologist yaru, counselor yaru. Ee ಮೂರು ಗುಂಪಿನ ಮಧ್ಯೆ ಇರೋ ವ್ಯತ್ಯಾಸವೇ ಗೊತ್ತಿರಲ್ಲ. And to make that clear, psychiatrist is a person who would have done his medical school. 5 ವರ್ಷದ MBBS ಮಾಡಿ ಆಮೇಲೆ 3 ವರ್ಷದಲ್ಲಿ MD ಮಾಡಿ specialization in psychiatry, who can give medication for major mental illnesses and can also do counseling or psychotherapy with the right expertise. ನಾವು ಕಲಿಬೇಕು, ಕಲ್ತು ಡಿಗ್ರಿ ಮಾಡಿ ಆಮೇಲೆ ಅದನ್ನು ಮುಂದುವರ್ಸ್ಕೊಂಡು ಹೋಗ್ಬೇಕು. The second group of people are clinical psychologists who have studied psychology in their undergrad and their postgrad and probably have done their PhD in that, and then they are qualified to work in that field. Again, ಆ ಫೀಲ್ಡ್ ಅಲ್ಲಿ ನೀಶ್ ಫೀಲ್ಡ್ಸ್ ಇದೆ. ಬೇರೆ ಬೇರೆ ತರದ ಥೆರಪಿಗಳಲ್ಲೇ ಎಕ್ಸ್ಪರ್ಟೈಸ್ ನ ತಗೊಂಡು ಅಲ್ಲೇ ಕೆಲಸ ಮಾಡುವಂತವ್ರು ತುಂಬಾ ಜನ ಇದ್ದಾರೆ. Third is a group of people called psychiatric social workers who go and handle problems at the ground level. ಎಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ, ಲೈಕ್ ಸೇ ಸಬ್ಸ್ಟೆನ್ಸ್ ಡಿಪೆಂಡೆನ್ಸ್ ಇದೆ, ಡೊಮೆಸ್ಟಿಕ್ ವೈಲೆನ್ಸ್ ಇದೆ, ಸ್ಟ್ರೆಸ್ ರಿಲೇಟೆಡ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ, ಸ್ಕೂಲ್ ನಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ, ಇಂಥವನ್ನೆಲ್ಲ ಹ್ಯಾಂಡಲ್ ಮಾಡೋದಕ್ಕೆ ಸೈಕ್ಯಾಟ್ರಿಕ್ ಸೋಷಿಯಲ್ ವರ್ಕರ್ಸ್ ಇದ್ದಾರೆ. ಅಂಡ್ ಯು ಎಸ್ ಕೌನ್ಸಿಲರ್ಸ್ ವರ್ಕ್ ಆಸ್ ಅ ಬ್ರಿಡ್ಜ್ ಬಿಟ್ವೀನ್ ದ ಸೊಸೈಟಿ ಅಂಡ್ ದೀಸ್ ತ್ರೀ ಪ್ರೊಫೆಷನಲ್ಸ್. Okay, so where you are what we call as emotional first aid. ಯಾರಿಗಾದ್ರೂ ತೊಂದರೆ ಆದ್ರೆ the first person that they should contact should be you, and you will be the people who will decide that okay ಇದನ್ನ ನಾನು ಇಲ್ಲೇ ಸರಿ ಮಾಡ್ಬೋದಾ ಅಥವಾ ನಾನು ಯಾವ್ದಾದ್ರೂ ಪ್ರೊಫೆಷನಲ್ಗೆ ಕಳಿಸ್ಕೊಂಡು ಅದನ್ನ ಸರಿ ಮಾಡ್ಬೇಕಾಗತ್ತೆ. So this is the difference between the 4 groups of people who work in the same field and see the same kind of patients, which is the reason why your field would require, I feel, maximum knowledge of psychological distress, psychiatric ailment, because ನಿಮಗೆ ನೋಡೋದ್ ಮಾತ್ರ ಅಲ್ಲ, ಡಿಫ್ರೆನ್ಶಿಯೇಟ್ ಮಾಡಿ ಯಾವಾಗ ಕಳ್ಸೋದಂತಾನು ಗೊತ್ತಾಗ್ಬೇಕು. ಅಂಡ್ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡೋದ್ ಮಾತ್ರ ಅಲ್ಲ, ಕೌನ್ಸಿಲಿಂಗ್ ಹೇಗ್ ಮಾಡಬಾರದು ಅಂತಾನು ತಿಳಿದಿರ್ಬೇಕು. ಬಿಕಾಸ್ ಯು ಕ್ಯಾನ್ ಡೂ ಮೋರ್ ಹಾರ್ಮ್ ದೆನ್ ಗುಡ್. ಯು ಆರ್ ದ ಫಸ್ಟ್ ಪೀಪಲ್ ದೇ ಕಮ್ ಇನ್ ಟು ಕಾಂಟ್ಯಾಕ್ಟ್ ವಿತ್. ಸೊ ನೀವ್ ಏನ್ ಹೇಳ್ತೀರಾ ಅದ್ರ ಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಸ್ಟೆಪ್. ಸೊ ಯು ಶುಡ್ ನೋ ಹೌ ನಾಟ್ ಟು ಕೌನ್ಸಿಲ್, ವಿಚ್ ಇಸ್ ಈಕ್ವಲಿ ಇಂಪಾರ್ಟೆಂಟ್ as how you should counsel. Okay, I will probably give you an example of why counseling should not be done without the right training. This is a case which we had in the hospital. A 17-year-old girl was in PUC 2, was doing her science, a very intelligent student who was doing really well in her college. ಅವಳಿಗೆ ಒಂದು ರಿಲೇಶನ್ಶಿಪ್ ಅಲ್ಲಿ ಬ್ರೇಕಪ್ ಆಯ್ತು. ದೇರ್ ವಾಸ್ ಅ ಕ್ಲಾಸ್ಮೇಟ್ ಆಫ್ ಹರ್ಸ್ ಹೂ ವಾಸ್ ವಿತ್ ಹರ್ ಅಂಡ್ ಹೂ ದೇ ವರ್ ಡೇಟಿಂಗ್ ಫಾರ್ ಅಬೌಟ್ 1 or 2 years. And after that the classmate decided that he wanted to get physically intimate. ಈ ಹುಡುಗಿ ಬೇಡ ಅಂದ್ಲು. ಅವನಿಗೆ ಒಂದ್ ಸ್ವಲ್ಪ ಸಿಟ್ಟು ಬಂತು, ಒಂದ್ ಸ್ವಲ್ಪ ಮರ್ಯಾದೆ ಹೋದಂಗೂ ಆಯ್ತು. ಸೊ he started trolling her online. He started messaging her saying that ನನ್ನ ಫೋಟೋಸ್ ಎಲ್ಲ ಇದೆ, ನಾನು ಅದನ್ನ AI ಅಲ್ಲಿ ಮಾರ್ಫ್ ಮಾಡಿ ಹಾಕ್ಬಿಡ್ತೀನಿ, ಫೇಸ್ಬುಕ್ ಅಲ್ಲಿ ಹಾಕ್ತೀನಿ, ಇನ್ಸ್ಟಾದಲ್ಲಿ ಹಾಕ್ತೀನಿ, ನಿನ್ ಮರ್ಯಾದೆ ಕಳಿತೀನಿ, ನೀನ್ ನಂಗೆ ಕಿಸ್ ಮಾಡೋ ಫೋಟೋ ಇದೆ ಅದನ್ನ. She said that I have nothing which is very incriminating. He said that ನಾನು ಡೀಪ್ ಫೇಕ್ ಯೂಸ್ ಮಾಡ್ತೀನಿ, ಅದರಲ್ಲಿ ಚೇಂಜ್ ಮಾಡ್ಕೊಂಡ್ಬಿಡ್ತೀನಿ. So this girl got very worried and she did not want to go ahead with him, but she was kind of stuck. ಒಂಥರ ಬ್ಲಾಕ್ ಮೇಲ್ ನಡೀತಾ ಇತ್ತು, ನೀನು ನನ್ನ ಜೊತೆ ಹೊರಗೆ ಬರ್ಲಿಲ್ಲ ಅಂದ್ರೆ ನಾನು ಇದನ್ನೆಲ್ಲ ಮಾಡ್ಬಿಡ್ತೀನಿ. ಸೊ ಯು ಡಿಸೈಡ್, ಐ ವಿಲ್ ಟೆಲ್ ಯುವರ್ ಪೇರೆಂಟ್ಸ್, ಐ ವಿಲ್ ಸೆಂಡ್ ಇಟ್ ಟು ಯುವರ್ ಪೇರೆಂಟ್ಸ್. ಈಗ ಅವ್ನು ಹೇಳ್ತಾ ಇದ್ದ. ಸೊ ದಿಸ್ ಗರ್ಲ್ ಹ್ಯಾಡ್ ನೋ ಫ್ರೆಂಡ್ಸ್ ಬಿಕಾಸ್ ಅವನೇನ್ ಮಾಡ್ದ, ಅದೇ ಕ್ಲಾಸ್ ನಲ್ಲಿ ಇರೋ ಹುಡುಗ. ಸೊ ಹಿ ವಾಸ್ ಸ್ಲೈಟ್ಲಿ ಡಾಮಿನೆಂಟ್ ವೆಲ್ ಶಿ ವಾಸ್ ಅನ್ ಇಂಟ್ರೋವರ್ಟ್. ಸೊ ಹಿ ಪುಲ್ಡ್ ಆಲ್ ದ ಫ್ರೆಂಡ್ಸ್ ಟುಗೆದರ್ ವಿತ್ ಹಿಮ್, told them some stories about her. ಇವಳೇ ಹಂಗ್ ಮಾಡಿದ್ದು, I don't want to go around with her ಅಂತ ಹೇಳಿ he made sure that she also has no close friends. ಯಾಕಂದ್ರೆ ಇಬ್ರು were in the same friend group. And the girl started feeling very lonely, very upset. Obviously, nidde barta irlilla, ಓದ್ಕೊಳಕ್ ಆಗ್ತಾ ಇರಲಿಲ್ಲ, and she's in second PUC, aspiring to be a doctor. Okay. So what happened? The teacher saw. ಅವ್ರು ನೋಡಿದ್ರು, ಓ ಇವ್ ಪಾಪ ಯಾಕೋ ಡಲ್ ಇದ್ದಾಳೆ, ಓದ್ತಾ ಇಲ್ಲ, ಗ್ರೇಡ್ಸ್ ಆರ್ ಫಾಲಿಂಗ್. ಅಬೌಟ್ ಅಕ್ಟೋಬರ್ ನವೆಂಬರ್ ಅಲ್ಲಿ, ಸೊ ನೀಟಿಗೆ ಎಕ್ಸಾಮ್ಸ್ ಮಾಡ್ತಾ ಇದ್ರು, ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾರ್ಕ್ಸ್ ತಗೊಳ್ತಿರೋಳು ಕಡಿಮೆ ಮಾರ್ಕ್ಸ್ ತಗೊಳಕ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ಲು. ಯಾಕೆ ಅಂತ ಅವ್ರು ಕರೆದು ಕೇಳಿದ್ರು. She was in such a vulnerable state that she shared everything with the teacher. She said, ಹಿಂಗಾಯ್ತು, ಅವ್ನು ಹಂಗ್ ಮಾಡ್ತಾ ಇದ್ದಾನೆ, ನಾನು ನಿಮಗೆ ಹೇಳಿದೀನಿ ಅಂತ ಗೊತ್ತಾದ್ರೂ ಏನ್ ಮಾಡ್ತಾನೋ ಗೊತ್ತಿಲ್ಲ. The teacher heard that, and as I earlier told that these are not problems at all. ಈಗ ನಿನಗ್ ಬೇಕಾಗಿರೋದು ನೀನ್ ಕಾನ್ಸಂಟ್ರೇಟ್ ಮಾಡಿ ಓದ್ಬೇಕು, ಯಾಕಂದ್ರೆ ನಿಮ್ಮ ಅಪ್ಪ ಅಮ್ಮ ನಿನಗೆ ಇಷ್ಟು ದುಡ್ಡು ಕೊಟ್ಟಿಲ್ ಹಾಕಿರೋದು ಓದೋದಕ್ಕೆ, ಇಂಥ ಕೆಲಸ ಮಾಡೋದಕ್ಕೆಲ್ಲ ಅಲ್ಲ. ಅವ್ನ್ ಏನ್ ಬೇಕಾದ್ರೂ ಮಾಡ್ಲಿ, ನಿನ್ ಯಾರ ಹತ್ರನೂ ಈಗ ಫೋನ್ ಇಲ್ವಲ್ಲ, ಈಗ ಎಕ್ಸಾಮ್ ಆದ ತಕ್ಷಣ ಫೋನ್ ಇಸ್ಕೊಂಡ್ಬಿಡ್ತಾರೆ ಪೇರೆಂಟ್ಸ್. ಸೊ ಯು ಡೂ ವಾಟ್ ಯು ವಾಂಟ್, ಬಟ್ ಸ್ಟಡಿ ವೆಲ್. And he didn't stop there. He called up and told her parents that ನಿಮ್ ಮಗಳು ಹಿಂಗ್ ಮಾಡ್ತಾ ಇದ್ದಾಳೆ, ಒಂದ್ ಸ್ವಲ್ಪ ಕಣ್ಣಿಟ್ಟಿರಿ, you have to be careful about her. So this matter went to her parents. Parents called her, and as expected, they had a very emotional meltdown situation. ಅಮ್ಮ ಹತ್ರು, ನಿನಗೆ ಇಷ್ಟು ಕಷ್ಟಪಟ್ಟು ನಾವು ಕಾಲೇಜಿಗೆ ಹಾಕಿದೀವಿ, ಇಷ್ಟು ಲಕ್ಷ ಕೊಟ್ಟು ಹಾಕಿದೀವಿ, ನೀನ್ ಓದ್ತೀಯಾ ಅನ್ಕೊಂಡ್ರೆ ಇಂಥದ್ದೆಲ್ಲ ಮಾಡ್ತೀಯಾ ಅಂತ ನಮಗೆ ಗೊತ್ತಿರಲಿಲ್ಲ. ಕಂಪ್ಲೀಟ್ಲಿ ಮಿಸ್ಸಿಂಗ್ ದ ಪಾಯಿಂಟ್ that the child is in lot of pain. So their pain became worse. ಅವಳ ಹತ್ರ ಫೋನ್ ಇತ್ತು, obviously for getting notes and all that, they snatched away the phone. So this child was not only isolated now, but more depressed than before. ಅವನು ಮಾಡೋದು ಹೆದರಿಕೆ ಆಗೋದಲ್ದೆ, ಫೋನ್ ಇಲ್ಲ, ಅವ್ನು ಯಾವಾಗ ಏನ್ ಮಾಡ್ತಾನೆ ಅಂತ ಗೊತ್ತಿಲ್ಲ. ಸೊ ಆ ಭಯ, ಅಪ್ಪ ಅಮ್ಮ ಮತ್ತೆ ಟೀಚರಿಗೆ ಗೊತ್ತಾಯ್ತು, ನನ್ ಮರ್ಯಾದೆ ಹೋಯ್ತು ಅನ್ನೋ ಇನ್ನೂ ಒಂದಿಷ್ಟು ಬೇಜಾರು. ಪೇರೆಂಟ್ಸ್ ಡಿಂಟ್ ಸ್ಟಾಪ್ ದೇರ್. ದೇ ಕಾಲ್ಡ್ ಅಪ್ ಅಂಡ್ ಟೋಲ್ಡ್ ಒನ್ ಮೋರ್ ರಿಲೇಟಿವ್ ಆಫ್ ದೇರ್ಸ್. ಅವ್ರ ಮನೆಯಲ್ಲಿ ಸ್ವಲ್ಪ ಸೀನಿಯರ್ ಇರೋ ವ್ಯಕ್ತಿಗೆ ಹಿಂಗೆಲ್ಲ ಆಗ್ಬಿಡ್ತು ಅಂತ ಹೇಳಿದ್ರು. ಅವರೂ ಕರೆದು ಇನ್ನೊಂದಿಷ್ಟು ಬೈದು ಸಮಾಧಾನ ಹೇಳಿ ಕಳ್ಸಿದ್ರು. ಅಂಡ್ ಇನ್ ದಿಸ್ ಕೇಸ್ ಆಲ್ ದ ಅಡಲ್ಟ್ಸ್ ಫೆಲ್ಟ್ ದಟ್ ದೇ ಹ್ಯಾವ್ ಡನ್ ಅ ವೆರಿ ಗುಡ್ ಜಾಬ್. ನಾವ್ ಹೇಳಿದೀವಿ, ಈಗ ಅವಳು ಹೆದರಿಕೆಗೆ ಟೀಚರ್ ಥಾಟ್, ಐ ಹ್ಯಾವ್ ಟೋಲ್ಡ್ ಹರ್ and I'll be watching her, so she will study well. Parents thought, she has understood our emotional pain, so she will change and she will become better. That senior person thought, ನಾನು ಇವು ಮನೆಯಲ್ಲಿರೋರು ಎಲ್ಲರಿಗೂ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಿ ಸರಿ ಮಾಡಿದ್ದೀನಿ, ಸೊ ಇವಳಿಗೆ ಹೇಳಿದ್ದೀನಿ, ಇವಳು ಚೆನ್ನಾಗಿ ಆಗ್ತಾಳೆ. 4 days later, the girl committed suicide and was successful in it. And how we got to know this story was because the mother came for depression. And even after the mother came, mother kept crying and saying, ನಾವ್ ಏನ್ ತಪ್ಪು ಮಾಡಿದ್ವಿ ಅಂತ ಇವಳು ಈ ಸ್ಟೆಪ್ ತಗೊಂಡ್ಲು. ಈ ಜನರೇಷನ್ ಮಕ್ಕಳೇ ತುಂಬಾ ವೀಕು, ಅವ್ರಿಗೆ ಏನೂ ಸಹಿಸ್ಕೊಳಕ್ ಆಗೋದಿಲ್ಲ. While not understanding what might have gone on in that child's mind for the past 15 days, how the child was facing it. So what happened in this case was counseling gone wrong. ಎಲ್ಲರೂ ನಾವು ಮಾಡಿರೋ ಕೌನ್ಸಿಲಿಂಗ್ ಚೆನ್ನಾಗಿ ಆಗಿದೆ ಅಂತ ಅನ್ಕೊಂಡಿದ್ರು, but the result was kind of disastrous. So this is one of the reasons why we as mental health professionals have to understand that whatever we do, there has to be a scientific basis, an expertise in what you're doing for it to become successful, or at least change something in somebody's life. So what I'm trying to tell you in this example is how important you people are in the system. What you say can probably either change a person or, in the worst case scenario, kill a person. Okay, so that much of, responsibility, that much of understanding, and that much of seriousness should be there in what we do. So this is what happened in this case, I think. Yeah. Okay, so need for counseling, trained counselors, is because one, there is no counseling registry in India. And so most of the counselors who do counseling have just learned on their own and are going on. The gap is filled by a lot of people who know and feel that they know how to help. And they have helped a lot of people. It's not that ಅವ್ರು ಏನ್ ಮಾಡಿದ್ದು ಸರಿ ಹೋಗಿಲ್ಲ ಅಂತಲ್ಲ. ಬಟ್ ಎಲ್ಲಿ ಡಿಫ್ರೆನ್ಸಿಯೇಷನ್ ಕಷ್ಟ ಆಗತ್ತೋ ಅಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಬರೋ ಸಾಧ್ಯತೆ ಇದೆ. ಅಂಡ್ ದಿಸ್ ಗ್ಯಾಪ್ ಇಸ್ ಫಿಲ್ಡ್ ಬೈ ಸ್ಪಿರಿಚುವಲ್ ಲೀಡರ್ಸ್, ಸೀನಿಯರ್ಸ್ ಇನ್ ದ ಕಮ್ಯುನಿಟಿ, ಪೀಪಲ್ ಇನ್ ಪವರ್, ಪೀಪಲ್ ಹೂ ಆರ್ ಜುಡಿಷಿಯಲ್ ಹೆಡ್ಸ್, ಜಡ್ಜಸ್ ಇರ್ಬೋದು, ಲಾಯರ್ಸ್ ಇರ್ಬೋದು. ಆಲ್ ದೀಸ್ ಪೀಪಲ್ ಆರ್ ಕೌನ್ಸಿಲಿಂಗ್ ನೌ. But unfortunately, there is not much expertise in the field that they can bring onto the table. No professionalism, as everyone thinks differently. So what I want you to understand today is, you as a person and you as a counselor are two different people. You can't put the two together. ಯಾಕೆಂದ್ರೆ ನಿಮಗೆ ಬರುವಂತ ಕೌನ್ಸಿಲೀಸ್ ಯಾರಿದ್ದಾರೆ, ಅವರ ಮನಸ್ಥಿತಿ, ಅವ್ರು ಬಂದಿರುವಂತ ಸೋಷಿಯಲ್ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್, ಎಕನಾಮಿಕ್ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್, ಕಲ್ಚರಲ್ ವ್ಯಾಲ್ಯೂಸ್, ಮಾರಲ್ ವ್ಯಾಲ್ಯೂಸ್ will be very different to what your personal values are. And you cannot allow that to come in your counseling process. So me as Preeti is different from me as a psychiatrist or counselor who's working with a client. And that skill set, what you would need when you're not you, will be taught in the next few months or years or whatever. ಸೊ ಮೋರ್ ಡೈಡಾಕ್ಟಿಕ್ ದೆನ್ ಪಾರ್ಟಿಸಿಪೇಟಿವ್. ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ನಾವು ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಿದೀವಿ ಅಂದ್ರೆ ಏನ್ ಅನ್ಕೋತೀವಿ, ಪಾಠ ಹೇಳ್ದಂಗೆ ನನಗೇನ್ ಸರಿ ಅನ್ಸತ್ತೆ ಅಂತ ನಾನು ಎಲ್ಲರಿಗೂ ಹೇಳ್ತೀನಿ, ಅವರು ನಾನು ಸೀನಿಯರ್ ಇದ್ದೀನಿ ನನಗೆ ಜಾಸ್ತಿ ಗೊತ್ತು ಅಂತ ಅವ್ರು ಕೇಳ್ಕೊಂಡು ನಾನು ಹೇಳಿದ್ದನ್ನ ಒಪ್ಪಿ ಅವ್ರು ಸರಿಯಾಗಿ ಬಿಡ್ಬೇಕು. ಕೌನ್ಸಿಲಿಂಗ್ ಇಸ್ ನಾಟ್ ದಟ್. ಇಟ್ ಈಸ್ ಅ ಪಾರ್ಟಿಸಿಪೇಟಿವ್ ಪ್ರೋಸೆಸ್. Both people's mindsets are equally important. I am not a guru who's giving some knowledge to Shishya. I am a person who's trying to understand the other person, find some personalized goals for themselves. So it is not a Pata Helo session, alla. It is a participative session. Both people have to participate in the counseling means. Potential to cause more harm than good, and that is why we have to change. Why not go to elders or people whom we respect? Because we all have done that in our childhood or in our early adulthood. ಅವಾಗ ಈ ಕಾನ್ಸೆಪ್ಟ್ಗಳೇ ಇಲ್ದಿರೋದ್ರಿಂದ ನಮಗೆ ಏನಾರು ಸಹಾಯ ಬೇಕು ಅಂದ್ರೆ ನಾವು ತುಂಬಾ ಟ್ರಸ್ಟ್ ಮಾಡಿರೋ ಟೀಚರ್ ಹತ್ರ, ಅಥವಾ ನಮ್ಮ ಪೇರೆಂಟ್ಸ್ ಹತ್ರ, ನಮ್ಮ ಗ್ರ್ಯಾಂಡ್ ಪೇರೆಂಟ್ಸ್, ಸಮ್ ಕಸಿನ್ who has studied well and is working abroad or something. So all of us have taken help from such people. But in the current scenario, we would advise that they still go to counselors. ಯಾಕೆಂದ್ರೆ ಅವರ ವರ್ಲ್ಡ್ ವ್ಯೂ ಹೇಗಿರತ್ತೆ ಅಂತ ಗೊತ್ತಿರೋದಿಲ್ಲ. ಈಗ if I talk to my grandmother about the marriage problems that I have now, her answers to the situation will be based on her timeline, not on my timeline. And thanks to social media, internet, globalization, we have moved forward some 4 generations. ಹಿಂದೆಲ್ಲ ದೊಡ್ಡ ಜನರೇಷನ್ಗೂ ಚಿಕ್ಕ ಜನರೇಷನ್ಗೂ 1 generation ಗ್ಯಾಪ್ ಇರೋದು. ಈಗ ಬಿಟ್ವೀನ್ ಸಿಬ್ಲಿಂಗ್ಸ್ there is generation gap. So we are moving forward so fast. ಹಂಗಿರ್ಬೇಕಾದ್ರೆ ಯಾವುದೋ 20 ವರ್ಷದ ಹಿಂದಿನ ಸೊಲ್ಯೂಷನ್ ಇವತ್ತಿಗೆ it will not be able to match. Like say for example, just go back some 8 years. Avaga all of us were saying that ನಮ್ಮ ಮಕ್ಕಳ ಕೈಲಿ ಮೊಬೈಲ್ ಕೊಡಬಾರ್ದು. ಈಗ ಯಾರ ಮಕ್ಕಳ ಕೈಲಿ ಮೊಬೈಲ್ ಇಲ್ಲ ಹೇಳಿ? Most of our children have. Why? ಸ್ಕೂಲೇ ಹೇಳ್ತಾರೆ, ಹೋಮ್ವರ್ಕ್ ಅದರಲ್ಲೇ ಕಳಿಸ್ತಾರೆ. So you can't go back 8 years and say ನಿಮ್ ಮಗು ಕೈಯಿಂದ ಮೊಬೈಲ್ ಕಸ್ಕೊಳ್ಳಿ ಅಂದ್ರೆ ಇರೋರು ಎಲ್ಲರ ಹತ್ರನೂ ಇದೆ, ನನ್ನ ಹತ್ರ ಇಲ್ಲ ಅಂತಾನೆ ಮಗು ಡಿಪ್ರೆಷನ್ಗೋ ಸ್ಟ್ರೆಸ್ಸಿಗೂ ಹೋಗ್ಬೋದು. I'm not able to do my school work well. I'm not able to communicate well. So ತಪ್ಪು ಸರಿಯನ್ನ ಡಿಸೈಡ್ ಮಾಡೋರು ನಾವಲ್ಲ. We have to see where we are, which social scenario or milieu we are in, and be able to make decisions relevant to that milieu, which might not be possible with elders, old people, or somebody who's from the previous generation. So those things will not work in today's scenario mostly. Nobody is there, better to take help than nothing. But if there are counselors around, better to go to a counselor. Older solutions to newer problems for a younger generation usually don't work. And usually what is forced will not stick. ಯಾವ್ದನ್ನ ಪಾರ್ಟಿಸಿಪೇಟಿವ್ ಆಗಿ ನಾನು ಟ್ರೈ ಮಾಡ್ತೀನಿ ಅಂತ ಅವ್ರು ಮಾಡ್ತಾರೋ ಅದು ಮಾತ್ರ ಇನ್ ದ ಲಾಂಗ್ ಡ್ಯೂರೇಷನ್ ಸ್ಟಿಕ್ ಆನ್ ಆಗುತ್ತೆ. ಯಾವ್ದನ್ನ ನೀನಿಂಗ್ ಮಾಡ್ಲೇಬೇಕು ನಾನು ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ನೀನಿಂಗ್ ಮಾಡಿದ್ರೆ ಚೆನ್ನಾಗ್ ಆಗ್ತೀಯಾ ಹೋಗು ಅಂತ ಹೇಳಿದ್ರೆ 4 ದಿನ ಮಾಡ್ತಾರೆ, ಆಮೇಲೆ ಮಾಡಲ್ಲ. ಇಟ್ಸ್ ಲೈಕ್ ಲಿಸ್ನಿಂಗ್ ಟು ಅ ಮೋಟಿವೇಶನಲ್ ಲೆಕ್ಚರ್ ವಿಚ್ ವಿ ಆಲ್ ಡೂ ಆನ್ ಯೂಟ್ಯೂಬ್. But 10 days down the line, we are back to not going to the gym, sleeping long, eating bad. So all of that will happen. So that is again not counseling. That is what we call as guidance or motivation building. That is not counseling. Okay. Hence, the need for a group of people who have the expertise, which you will get in the next 1 year, the aptitude with which all of you have come with. Aptitude andre interest, ಆಸಕ್ತಿ ಇಟ್ಕೊಂಡು ನಾನು ಮಾಡಬೇಕು ಅಂತ. People who are impatient, people who do not like others, people who get angry when other people tell very small, silly problems, should not go for counseling. ಬೇರೆಯವರಿಗೆ ಸಮಾಧಾನದಿಂದ ಕೇಳುವಷ್ಟು ಸಮಾಧಾನ ಇರಬೇಕು, ಆಪ್ಟಿಟ್ಯೂಡ್ ಇರ್ಬೇಕು. ನಾನು ಇವರಿಗೆ ಹೆಲ್ಪ್ ಮಾಡಬೇಕು, ಸಹಾಯ ಮಾಡಬೇಕು, ನಾನ್ ಗ್ರೇಟ್ ಅಂತ ತೋರ್ಸೋದು ಹಂಗಲ್ಲ. ಆ ಆಟಿಟ್ಯೂಡ್ ಅಂಡ್ ಆಪ್ಟಿಟ್ಯೂಡ್ ಇರೋರು ವಿಲ್ ಮೇಕ್ ವೆರಿ ಗುಡ್ ಕೌನ್ಸಿಲರ್ಸ್. ಅಂಡ್ ಯು ಶುಡ್ ಫೈಂಡ್ ಯುವರ್ niche. Starting off with, you should know how to counsel everybody. But over time, you build up your expertise trying to counsel adults irbodu, couple counseling irbodu, or child counseling irbodu. ಹೀಗೆ different areas ನಲ್ಲಿ expertise build up ಮಾಡ್ಕೊಳ್ಳೋದು ಒಳ್ಳೇದು. Because in each field, there is too much to learn. So you can't say that I'm a general counselor. Over time, people will not know who to send to you. So over time, probably you should have the expertise in a certain area, which you can build up your resume. So what is counseling? Counseling is a collaborative process which involves the development of a unique, again, each word there is very important. It's a unique relationship. 2 kids coming to the same counselor will have completely different mindsets. So you can't say, ee magu idu work agide, nan innond magugu adanne ಮಾಡ್ತೀನಿ. No, every relationship is very unique. Every relationship is very confidential. You cannot discuss. Going back to the previous example, teacher hatra ಅವ್ರು ಹೇಳಿರೋದನ್ನ ಅವರು ಅವಳಿಗೆ ಕೇಳದೆ ಇರೋಬರೋರ್ಗೆಲ್ಲ ಹೇಳ್ಬಾರ್ದಾಗಿತ್ತು. Okay, and one more thing the teacher did was he spoke about this in the staff room. Okay, that this child has something like this. ನೋಡಿ ಈ ಜನರೇಷನ್ ಅವ್ರು ಹೆಂಗ್ ಮಾಡ್ತಾರೆ, ಹಿಂಗೆಲ್ಲ ಮಾಡ್ಕೊಂಡು ಆಮೇಲೆ ಫೋಟೋ ಹಾಕ್ತಾರೆ ಅಂತ ಬೇಜಾರ್ ಮಾಡ್ಕೋತಾರೆ. ಅಂತ ಇದು ಡಿಸ್ಕಷನ್ ಆಗಿತ್ತು, ವಿಚ್ ಸಮ್ ಅದರ್ ಟೀಚರ್ ಟೋಲ್ಡ್ ದಟ್ ಕಿಡ್, ವಿಚ್ ಅಪ್ಸೆಟರ್ ಈವನ್ ಮೋರ್. ನಾನು ಕಾನ್ಫಿಡೆನ್ಸ್ ಅಲ್ಲಿ ಹೇಳಿದ್ದೆ, ಕಾನ್ಫಿಡೆನ್ಸ್ ಸಹ ಬ್ರೇಕ್ ಮಾಡಿದ್ದಾರೆ ಅನ್ನೋ ಬೇಜಾರು ಆ ಮಗುಗಿತ್ತು. ಸೊ ಇಟ್ಸ್ ಅ ಯುನೀಕ್ ರಿಲೇಶನ್ಶಿಪ್, it's a confidential relationship, and it is a helping relationship. Okay, this process happens in an atmosphere of acceptance. See, I'll give you a very random example. There might be a murderer who comes to you. You should treat him with the same acceptance and same level of respect that you would give to probably a spiritual head or somebody in a very high position. Okay, you cannot say that, oh, ಇವ್ರು ಕೆಟ್ಟ ಕೆಲಸ ಮಾಡಿ ಬಂದಿದ್ದಾರೆ, ನಾನು ಇವ್ರಿಗೆ ಹಿಂಗ್ ಟ್ರೀಟ್ ಮಾಡ್ಬೋದು, ಅವ್ರು ತೀರಾ ದೊಡ್ಡ ವ್ಯಕ್ತಿ ಸಮಾಜದಲ್ಲಿ, ನಾನು ಅವ್ರಿಗೆ ಬೇರೆ ತರ ಟ್ರೀಟ್ ಮಾಡ್ಬೇಕು. ಡಸಂಟ್ ವರ್ಕ್ ಲೈಕ್ ದಟ್. So there should be, and all these things are not told orally. ನಿಮ್ಮ ಬಾಡಿ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ ನೀವು ಅವ್ರ ಜೊತೆ ಹೇಗ್ ನಡ್ಕೋತಾ ಇದ್ದೀರಾ ಅವ್ರಿಗೆ ಗೊತ್ತಾಗ್ಬಿಡತ್ತೆ. ಸೊ ಇನ್ ಯೋರ್ ಮೈಂಡ್, ಇಫ್ ಯು ಥಿಂಕ್ ದಿಸ್ ಪರ್ಸನ್ ಇಸ್ ನಾಟ್ ವರ್ತ್ ಮೈ ಟೈಮ್, ಇಟ್ ವಿಲ್ ಶೋ ಆನ್ ಯೋರ್ ಫೇಸ್ ಅಂಡ್ ಯೋರ್ ಬಾಡಿ ಲ್ಯಾಂಗ್ವೇಜ್. So you should not even think in your mind that, okay, this person needs more respect, this person needs less respect. Everybody from a 3-year-old child to a 100-year-old person, you should be having that thinking that I will accept this person no matter what. And only then will trust build. ಅವಾಗ ಅವ್ರು ನಿಮಗೆ ಹೇಳಕ್ ಶುರು ಮಾಡ್ತಾರೆ. You might have noticed when you were growing up, there were certain people who used to always go to for your problem solving. Agony ಅಂತಾರ. ಪ್ರಾಬ್ಲಮ್ ಆಯ್ತು ಅಂದ್ರೆ ಇವ್ರಿಗೆ ಹೋಗಿ ಹೇಳ್ತಾರೆ. Or in a school or a class, there'll be one girl or one boy. Anybody has a problem, usually they go gravitate there. Why? Because they have this quality. Or a teacher who can always explain, ಏನೇ ಪ್ರಾಬ್ಲಮ್ ಅಂದ್ರೆ ಈ ಟೀಚರ್ ನನ್ನ ಫೇವರೇಟ್ ಟೀಚರ್, I should go to her and that problem will be solved. This happens because unconsciously they have imbibed these qualities. Where you can develop acceptance, where you can develop ಏನ್ ಬೇಕಾದ್ರೂ ಹೇಳ್ಬೋದು ನಾನು ಅವ್ರ ಹತ್ರ ಅಂತ ಏನ್ ಬರುತ್ತೆ, that should be there when you're practicing counseling. Respect, acceptance, and trust. And one of the most common definitions that are there, it's a relationship in which one person endeavors to help another understand or solve his or her adjustment problems. Again, if you observe, nowhere it says, I will solve your problem for you. They will help the other person understand their problem, try to find different ways to help it, and see what is acceptable to the person. Again, that solution may not be acceptable to you. I see one person, ತುಂಬಾ ಆಲ್ಕೋಹಾಲ್ ಡಿಪೆಂಡೆನ್ಸ್ ಇರೋ ಗಂಡ ಇದ್ದಾನೆ, ದಿನಾ ಬಂದವರಿಗೆ ಹೊಡಿತಾರೆ, ಬಡಿತಾರೆ, ತೊಂದರೆ ಕೊಡ್ತಾರೆ, ಕಿರುಕುಳ ಕೊಡ್ತಾರೆ. ಅವ್ರು ನನ್ನ ಹತ್ರ ಡಿಪ್ರೆಷನ್ಗೆ ಅಂತ ಬಂದಿದ್ದಾರೆ, ನಾನು ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡ್ಬೇಕಾದ್ರೆ ಐ ವುಡ್ ಟ್ರೈ ಅಂಡ್ ಗಿವ್ ಅನ್ ಆಪ್ಷನ್. ಅವ್ರ ಜೊತೆಗೆ ಯಾಕಿದ್ದೀರಾ, ಅವ್ರು ನಿಮಗೇನು ಸಹಾಯ ಮಾಡ್ತಿಲ್ಲ, ಬೇರೆಗಿರಿ. ಬಟ್ ಇಫ್ ದಟ್ ಪರ್ಸನ್ ಸೇಸ್, ಇಲ್ಲ ನಂಗೆ ಅವ್ರ ಜೊತೆನೇ ಇರ್ಬೇಕು ಅಂದ್ರೆ, ನೀವ್ ಯಾಕೆ ಅವ್ರ ಜೊತೆ ಇದ್ದೀರಾ, ನಾ ಹೇಳಿದೇನು ಕೇಳ್ತಿಲ್ಲ ಅಂತ ಜಗಳ ಆಡಂಗಿಲ್ಲ. You have to try and find out ಅವ್ರ ಜೊತೆಗಿದ್ದಾಗಲೇ ಮನಸ್ಸಿಗೆ ಹೆಂಗ್ ಸಮಾಧಾನ ಇಟ್ಕೊಳಕ್ ಆಗತ್ತೆ. That's all that we can do. Okay, so you have to understand these limits also, because sometimes we as mental health professionals start having what we call as a God complex. ನನಗ್ ಗೊತ್ತು, ನಾನು ಈ ಪ್ರಾಬ್ಲಮ್ ನ ಹಿಂಗ್ ನೋಡಿದ್ರೆ, ನಾನು ತುಂಬಾ ಪೇಷಂಟ್ಸ್ ನೋಡಿ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇದೆ, ನಾನು ಹಿಂಗೆ ಸೊಲ್ಯೂಷನ್ ಹೇಳ್ಬಿಟ್ರೆ ಅವ್ರು ಅದನ್ನ ಮಾಡಿ ಚೆನ್ನಾಗಾಗ್ಬಿಡ್ತಾರೆ. But that's your solution, not that person's. So you should understand that only then will you become a successful counselor. The basic terms that we have in counseling are counseling, counselor, counselee, and the counseling theory. These 4 things are very, very important. ನಿಮ್ಮ ಹತ್ರ ಬರೋರ್ನ ಯಾರನ್ನು ನೀವು ಪೇಷಂಟ್ ಅಂತ ಕರಿಬಾರ್ದು, ಕೌನ್ಸಿಲಿ ಅಥವಾ ಕ್ಲೈಂಟ್ ಅಂತ ಕರಿಬೇಕು. This should again be put in your system, because patient ಅಂದ ತಕ್ಷಣ ಅದು ಒಂಥರ ಹಣೆ ಪಟ್ಟಿ ತರ, ಇವರಿಗೆ ಮಾನಸಿಕ ಕಾಯಿಲೆ ಆಗಿದೆ ಅಂತ. And about 90% or 60 to 80% at least of people who come to you are, as I earlier mentioned, pre-morbidly ill. ಅವ್ರಿಗೆ ಈಗ ಇನ್ನೂ ಕಾಯಿಲೆ ಇಲ್ಲ, ಬಟ್ ಕಾಯಿಲೆ ಆಗ್ಲೋ ಅಥವಾ ಚೆನ್ನಾಗಾಗ್ಲೋ ಅನ್ನೋ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿ ನಿಮ್ಮ ಹತ್ರ ಬಂದಿರ್ತಾರೆ. So the way you handle it will make sure whether they'll jump on this side of the fence or that side of the fence. So therefore, remember this. Counselor is professionally trained person, which you are all going to be qualified to help others reach their solutions. Is, again, as I told you, a very uninvolved person. Just like how a surgeon cannot operate on his own child, it would be better that you stop counseling your family members and your children. As I was telling ma'am, maybe to understand your husband and children, great. But to help solve their problems, maybe not. Because as soon as emotional attachment comes, our decisions change. Nan magu kadme marks bartide, tuition ಗೆ ಹಾಕ್ತೀನಿ. ಪಕ್ಕದ ಮನೆಯವ್ರು ಕಡಿಮೆ ಮಾರ್ಕ್ಸ್, ಅಯ್ಯೋ ಬಿಡ್ರಿ ಪಾಪ, ಇನ್ನೊಂದು 6 ತಿಂಗಳು ನೋಡಿ ಆಮೇಲೆ ಟ್ಯೂಷನ್ ಗೆ ಹಾಕ್ರಿ. Very, very common, right? We always do that. So as soon as emotions get involved, our thinking changes. So it would be better that you stay away from people who are very close to you and who are very dear to you when they come to you for help. Because as soon as you become counselors, a lot of people will come and ask, ನಮಗೆ ಸ್ವಲ್ಪ ಹೆಲ್ಪ್ ಮಾಡ್ಕೊಡಿ, ನನ್ನ ಮಗು ಹಿಂಗ್ ಮಾಡ್ತಾ ಇದೆ, ಹಂಗ್ ಮಾಡ್ತಾ ಇದೆ. So if you are emotionally involved, stay up better. Refer to your classmates or somebody who can help them out well. The counselor is equipped with skills and information to help the person and facilitates change in behavior. It does not change behavior, but facilitates. Okay. The counselee again is a troubled person. As I told you, these are not people who are mentally ill. They are mentally well, but they are in distress. ಮಾನಸಿಕವಾಗಿ ಚೆನ್ನಾಗಿದ್ದಾರೆ. ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಎನಿ ಒನ್ ಆಫ್ ಅಸ್. ನಾನು ಚೆನ್ನಾಗೇ ಕೆಲಸ ಮಾಡ್ತಾ ಇರ್ತೀನಿ, ಬಟ್ ಇನ್ ಬಿಟ್ವೀನ್ ಐ ಹ್ಯಾವ್ ಅ ಪ್ರಾಬ್ಲಮ್ ವಿತ್ ಮೈ ಕೊಲೀಗ್. ಅದನ್ನ ಹೆಂಗ್ ಸಾರ್ಟ್ ಮಾಡೋದು ಅಂತ ನಂಗೆ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ. ಸೊ ಐ ನೀಡ್ ಟು ಗೋ. ಆಸ್ ಸರ್ ವಾಸ್ ಸೇಯಿಂಗ್, ಇನ್ ದ IT ಸೆಕ್ಟರ್ HR ಮ್ಯಾನೇಜರ್ ಜೊತೆ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಿದೆ. ಐ ಆಮ್ ನಾಟ್ ಮೆಂಟಲಿ ಇಲ್, ಬಟ್ ಮೈ ಮ್ಯಾನೇಜರ್ ಇಸ್ ವೆರಿ ಟಾಕ್ಸಿಕ್ ಅಂಡ್ ಐ ಆಮ್ ನಾಟ್ ಏಬಲ್ ಟು ಡೀಲ್ ವಿತ್ ಇಟ್. ತುಂಬಾ ಕೆಲಸ ಕೊಡ್ತಾ ಇದಾರೆ, ವೀಕೆಂಡ್ ಅಲ್ಲಿ ಕೆಲಸ ಕೊಡ್ತಾ ಇದಾರೆ. ನನ್ನ ಪರ್ಸನಾಲಿಟಿ ಲೇಡ್ ಬ್ಯಾಕ್ ಇದೆ. ಸೊ ಲೇಡ್ ಬ್ಯಾಕ್ ಪರ್ಸನಾಲಿಟಿ ಅಂಡ್ ಟೂ ಮಚ್ ವರ್ಕ್ ಸೆಟ್ ಆಗ್ತಾ ಇಲ್ಲ. ನನಗೆ ಸ್ಟ್ರೆಸ್ ಆಗ್ಬೋದು. ಸ್ಕೂಲ್ ನಲ್ಲಿ 10 ಜನ ಮಕ್ಕಳಿದ್ದಾರೆ. ನಾನು ತುಂಬಾ ಇಂಟೆಲಿಜೆಂಟ್ ಇದೀನಿ, ಬಟ್ ಐ ಆಮ್ ನಾಟ್ ಅನ್ ಎಕ್ಸ್ಟ್ರೋವರ್ಟ್. ಸೊ ಟೀಚರ್ ಪ್ರಶ್ನೆ ಕೇಳಿದಾಗ ನಾನು ಫಸ್ಟ್ ಕೈ ಎತ್ತಲ್ಲ, ಬೇರೆಯವ್ರು ಎತ್ತಾರೆ. ಸೊ ಟೀಚರ್ಗೆ ಅನಿಸ್ತಾ ಇದೆ ನಾನ್ ದಡ್ಡಿ ಇದೀನಿ, ಬೇರೆಯವ್ರು ತುಂಬಾ ಬುದ್ಧಿವಂತರಿದ್ದಾರೆ. ಸ್ಟ್ರೆಸ್. ಸೊ ಆಲ್ ಆಫ್ ದೀಸ್ ಪೀಪಲ್ ವಿಲ್ ಬಿ ದ ಒನ್ಸ್ ಹೂ ಕಮ್ ಟು ಯು. ಓಕೆ, ಮೈ ಹಸ್ಬೆಂಡ್ ಇಸ್ ವೆರಿ ಶಾರ್ಟ್ ಟೆಂಪರ್ಡ್. ಐ ಆಮ್ ಅ ವೆರಿ ಕ್ವೈಟ್ ಪರ್ಸನ್. ನಾನು ಮನೆಯಲ್ಲಿ ಅಪ್ಪ ಅಮ್ಮ ನಾನ್ ಮಾತ್ರ ಇದ್ವಿ. ನನ್ ಗಂಡ ಜಾಯಿಂಟ್ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಬೆಳೆದಿರೋರು. ಸೊ ಅವ್ರು ಏನ್ ಮಾತಾಡಿದ್ರು ಕೂಗಾಡ್ತಾರೆ. ಅವ್ರು ಕೂಗಾಡಿದ್ ಕೇಳಿದ್ರೆ ನಂಗೆ ಭಯ ಆಗುತ್ತೆ. ದೀಸ್ ಆರ್ ದ ಪೀಪಲ್ ಹೂ ಕಮ್ ಟು ಯು ಫಾರ್ ಹೆಲ್ಪ್. So they are in distress, but they are not mentally ill. They are functioning adequately well in society. And if they are not this, our society ಅಲ್ಲಿ functioning hamper ಆಗಿದ್ರೆ, ಅಥವಾ ಅವರ ನಿದ್ದೆ ಊಟ hamper ಆಗಿದ್ರೆ, and their emotions are very intense and their thinking is illogical, refer to mental health professional. The others you can keep in mind. So troubled person, normal individuals, problems related to adjustment with self and the environment, educational, social, vocational, personal, interpersonal emotion and decision making places, voluntary seeking help. This is very important, and this you will know once ನೀವು ಕೌನ್ಸಿಲಿಂಗ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ಮೇಲೆ ಗೊತ್ತಾಗುತ್ತೆ. ನಿಮ್ ಫ್ರೆಂಡ್ ಹೇಳ್ತಾರೆ ನನ್ ಮಗು ತುಂಬಾ ಕೌನ್ಸಿಲಿಂಗ್ ಬೇಕು, ಆದ್ರೆ ನಾ ಕೌನ್ಸಿಲಿಂಗ್ ಅಂದ್ರೆ ನೀನೇ ಕೌನ್ಸಿಲಿಂಗ್ ತಗೋ, ನನಗೆ ಯಾಕೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಅದಕ್ಕೆ ನೀನ್ ನನ್ ಫ್ರೆಂಡ್ ಅಂತ ಹೇಳು, ಮನೆಗ್ ಬಾ, ಮತ್ತೆ ಅವ್ನ ಪ್ರಾಬ್ಲಮ್ ಸಾಲ್ವ್ ಮಾಡ್ಕೊ. ಶುಡ್ ಯು ಗೋ, ಶುಡಂಟ್ ಯು? ವೆರಿ ಕ್ಲೋಸ್ ಫ್ರೆಂಡ್ ಆಫ್ yours, 30 ವರ್ಷದಿಂದ ನಿಮ್ಗೆ ತುಂಬಾ ಹತ್ರದ ಕ್ಲೋಸ್ ಫ್ರೆಂಡ್. ಯು ಹವ್ ಸೀನ್ ದಟ್ ಚೈಲ್ಡ್ ಗ್ರೋ. You know child is in trouble. Should you go to their house in the guise of a friend and try solve their problem or no? Why not? Ha, exactly. Again, adenagate didactic agate. A. Secondly, one more thing which happens when something like this is done. Very important. Yavatto judgment alla sir, trust will be very difficult. ಯಾವತ್ತೋ ಒಂದ್ 4-5 ಸೆಷನ್ ಆದ್ಮೇಲೆ ಆ ಮಗು ಗೊತ್ತಾದ್ರೆ ದಟ್ ನೀವು ಕೌನ್ಸಿಲರ್ ಇದ್ರಿ ಹಿಂಗ್ ಬಂದ್ರಿ ಅಂದ್ರೆ ಅಲ್ಲಿಗೆ ಬ್ರೇಕ್. ದಟ್ ಚೈಲ್ಡ್ ವಿಲ್ ನೆವರ್ ಸ್ಪೀಕ್ ಟು ಯು ಕರೆಕ್ಟ್ಲಿ ಎವರ್. ಸೊ ನಾಟ್ ಓನ್ಲಿ ವಿಲ್ ದ ಕೌನ್ಸಿಲಿಂಗ್ ರಿಲೇಶನ್ಶಿಪ್ ಬ್ರೇಕ್, ಬಟ್ ಯೋರ್ ರಿಲೇಶನ್ಶಿಪ್ ವಿತ್ ದ ಚೈಲ್ಡ್ as a friend's child also will. Okay, so never do that. It's a professional thing that you're doing. So there should be a level of professionalism. Just like how if a doctor is asked, ನನ್ನ ಕ್ಲೋಸ್ ಫ್ರೆಂಡು ಮನೆಗೆ ಬಂದು ಆಪರೇಷನ್ ಮಾಡು ಅಂದ್ರೆ ನಾನು ಮಾಡಲ್ವೋ, ಹಾಗೇನೆ ನೀವು ಮಾಡೋದು ಸಹ ಒಂದು ಪ್ರೊಫೆಷನಲ್ ಸೆಟ್ಟಿಂಗ್ ಅಲ್ಲಿ ಇರಬೇಕು. ದಿಸ್ ಐ ಆಮ್ ಮೆನ್ಷನಿಂಗ್ ವೆರಿ ಕ್ಲಿಯರ್ಲಿ ಬಿಕಾಸ್ ಲಾಟ್ ಆಫ್ ರಿಕ್ವೆಸ್ಟ್ ಕಮ್. ಪಾರ್ಕಿಗೆ ಬಂದು ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡು, ಪಾರ್ಕ್ ಅಲ್ಲಿ ಆಟ ಆಡ್ತಿದ್ದಾರೆ ಬಂದು ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡು, ನಾನು ಪಕ್ಕದ ಮನೆಗೆ ಹೋಗಿರ್ತೀನಿ ನೀನ್ ಅವಾಗ ಮನೆಗೆ ಹೋಗಿ ಫ್ರೆಂಡ್ ಅಂತ ಹೇಳಿ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಿ. ದೀಸ್ ರಿಕ್ವೆಸ್ಟ್ ವಿಲ್ ಕಮ್ ಟು ಯು. Very politely but very firmly decline them and ask that whenever the child is ready, you get the child for counseling. It might be 6 months late, but believe me, all of us have that inner voice which tells us ಈಗ ನನ್ಗೆ ಆಗ್ತಾ ಇಲ್ಲ, ನನಗೇನೋ ಸಹಾಯ ಬೇಕು. ಓಕೆ, ಸೊ ಅಲ್ಲಿಗೆ ಬರೋ ತನಕ ನೀವೇನೇ ಹೇಳಿದ್ರೆ ಅದಷ್ಟು ಡಿಫ್ರೆನ್ಸ್ ಆಗಲ್ಲ. ಸೊ ಹಂಗ್ ಬಂದು ಬರೋ ತನಕ ಸ್ವಲ್ಪ ಕಾಯಿರಿ. ಅವ್ರಿಗೆ ಬೇಕು ಅಂತ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಿದ್ರೆ ಇಟ್ ವಿಲ್ ಬಿ ವೆರಿ ವೆರಿ ವ್ಯಾಲ್ಯೂಬಲ್. ಇಫ್ ಅಪ್ಪ ಅಮ್ಮ ಹೇಳಿದ್ರು ಅಂತ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಿದ್ರೆ those are sessions which you will get again, all of us get. ಅಪ್ಪ ಅಮ್ಮ ಹೇಳ್ಕೊಂಡ್ ಬಂದಿದ್ರು, ಜೋಗ್ ಫಾಲ್ಸ್ ಗೆ ಕರ್ಕೊಂಡು ಹೋಗ್ತೀನಿ ಅಂತ ಹಾಸ್ಪಿಟಲ್ ಕರ್ಕೊಂಡ್ ಬಂದ್ರು. when they see the board of the hospital they'll know okay we have come for something else. and when they come inside only, ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಆಗಿದ್ಯಪ್ಪ, ಏನಾರು ತೊಂದರೆ ಆಗ್ತಾ ಇದೆ ಅವ್ರಿಗೆ ಕೇಳಿ, ಅವರೇ ಕರ್ಕೊಂಡ್ ಬಂದಿದ್ದಾರೆ, ಅಲ್ಲೇ ಮುಗೀತು. ಕೌನ್ಸಿಲಿಂಗ್ ರಿಲೇಶನ್ಶಿಪ್ ಇಲ್ಲ. ಅಪ್ಪ ಅಮ್ಮ ಕಂಪ್ಲೇಂಟ್ ಹೇಳ್ತಾರೆ, ನಾವು ಮಾತ್ರೆ ಬರ್ಸ್ಬೇಕು, ಕಳಿಸ್ಬೇಕು. which is not necessary. If you talk, maybe a lot of problems can be solved, but until the child or the person voluntarily seeks, kindly refrain from giving advice. Gyan kododu bed. So this is something you have to know. Problems which cannot be coped up alone, those people will come and they are looking for a personally satisfying situation, which I explained earlier. ಎಲ್ಲರಿಗೂ ಏನ್ ಅನ್ವಯಿಸುತ್ತೆ ನಿನಗೆ ಅನ್ವಯಿಸುತ್ತೆ. ಎಲ್ಲರೂ 3 ಗಂಟೆಗೆ ಎದ್ದು ಓದಬೇಕು ಆಗಲ್ಲ. There are different types of sleepers, long sleepers, short sleepers, night wolves, early morning larks. So ಅವರ ಬಯೋಸರ್ಕ್ಯಾಡಿಯನ್ ರಿದಮ್ ನೋಡದೆ ನೀವು ಏನೇನೋ ಸಜೆಸ್ಟ್ ಮಾಡ್ಬಿಟ್ರೆ ಬ್ರಹ್ಮ ಮುಹೂರ್ತದಲ್ಲಿ ಎದ್ದು ಓದಿದ್ರೆ ಸುಲಭ ಆಗತ್ತೆ. 3 ಗಂಟೆಗೆ ಎದ್ದು ಕ್ಲಾಸ್ ಅಲ್ಲೆಲ್ಲ ಇಡೀ ದಿನ ನಿದ್ದೆ ಹೊಡಿತಾರೆ, ನೀನು ಮಾಡಕ್ಕಾಗಲ್ಲ. ರಾತ್ರಿ 11 ತನಕ ಮೊಬೈಲ್ ನೋಡ್ತಾರೆ. ಸೊ ಸಜೆಸ್ಟಿಂಗ್ ಒನ್ ಥಿಂಗ್ ವಿಲ್ ನಾಟ್ ವರ್ಕ್. ಯು ಶುಡ್ ಲುಕ್ ಎಟ್ ಹೌ ದೇರ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಇಸ್ ಅರೇಂಜ್. ಬೇಗ ಯಾಕೆ ಮಲ್ಗಲ್ಲ, ನಮ್ಮ ಮನೇಲಿ 11 ಗಂಟೆಗೆ ರಾತ್ರಿ ಅಡುಗೆ ರೆಡಿ ಆಗೋದು. ಸೊ ದೇ ಕಾಂಟ್ ಸ್ಲೀಪ್. If they sleep at 11, get up at 4, the chances are very high that the efficiency will reduce rather than increase. So you should know what to suggest for that specific person. It should be a very personally satisfying goal. So this is how you should help the client. The how of counseling, scientific approach very important. It should be a professional setting. It should be a one-to-one relationship. ನಿಮ್ಗೆ ಯಾರೋ ಒಂದಿಷ್ಟು ಪ್ರಾಬ್ಲಮ್ಸ್ ಹೇಳಿದ್ರೆ ಮಗುಗೆದ್ರಿ ಕೂರಿಸಿ, ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ಇಟ್ ಹ್ಯಾಪನ್ಸ್ ವಿತ್ ಚಿಲ್ಡ್ರನ್, ಅದಕ್ಕೆ ಅದನ್ನ ಹೇಳ್ತಾ ಇದೀನಿ. ಅಪ್ಪ ಅಮ್ಮನ ಪಕ್ಕದಲ್ಲಿ ಕೂರಿಸಿ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಬೇಡಿ. ದೇ ವಿಲ್ ನೆವರ್ ಬಿ, ಅದಕ್ಕೆ ಕರ್ಕೊಂಡ್ ಬಂದಿದಾರಲ್ವಾ ನಿಮ್ಮ ಹತ್ರ. ಸೊ ಪಕ್ಕದಲ್ಲಿ ಅವ್ರನ್ನ ಕೂರಿಸಿ ನೀವು ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಿದ್ರೆ ಇಲ್ಲ, ಇಷ್ಟೇ. More than that, nothing will happen. So send them out. It should be an individual relationship between the two of you, but make sure you have CC cameras on in this time and age. You should have something which can protect you also and your privacy also. But you should know that it should be a one-to-one usually. And in case of children, when they are brought by parents, talk to the child first before listening to the complaint of the parents. ಮೊದಲೇ ಪೇರೆಂಟ್ಸ್ ಸಿಕ್ಕರ್ದು ಎಲ್ಲ ಅವ್ರ ಬಗ್ಗೆ ಕಂಪ್ಲೇಂಟ್ ಕೇಳಿ ಆಮೇಲೆ ಬರೋ ಅಷ್ಟೊತ್ತಿಗೆ ಇನ್ ಯೋರ್ ಮೈಂಡ್ ದೇರ್ ಇಸ್ ಅ ಜಜ್ಮೆಂಟ್. And then it is very difficult to remove it. Child also knows you already judge madbitidira anta, so the counseling relationship is hampered. So make sure you talk to the counselee first and then talk to the rest of the family. You will get both perspectives and it will be a better, more satisfying session. So helps to understand and tries to help the client solve his or her problems, assists in interpretation of facts. This is very important. Again, it will be told to you later, micro skills ಎಲ್ಲ ಹೇಳ್ಕೊಡ್ಬೇಕಾದ್ರೆ. ನಾನು ಒಂದು ಸಿಚುವೇಶನ್ ನ ಒಂಥರ ಗ್ರಹಿಸ್ಕೊಂಡಿರ್ಬೋದು, ಬಟ್ ರಿಯಾಲಿಟಿ ಬೇರೆ ಏನೋ ಇರ್ಬೋದು. ಸೊ ಯು ಆರ್ ದೇರ್ ಟು ಪ್ರೊವೈಡ್ ಒನ್ ಆಲ್ಟರ್ನೇಟಿವ್ ವರ್ಷನ್ ಟು ಸಿ ವೆದರ್ ದಟ್ ಪರ್ಸನ್ ಕ್ಯಾನ್ ಆಕ್ಸೆಪ್ಟ್. ಲೈಕ್ ನಾನೀಗ ಒಳಗ್ ಬಂದಾಗ ಒಂದ್ 3 ಜನ ನನ್ನ ತಲೆ ತಿರುಗಿ ಸಕಡೆ ಹೋಗ್ಬಿಟ್ರು, ನನ್ನ ನೋಡಿ ಸ್ಮೈಲೇ ಮಾಡಿಲ್ಲ. ದೇ ಆರ್ ನಾಟ್ ಲುಕಿಂಗ್, ಐ ಮೀನ್ ದೇ ಆರ್ ನಾಟ್ ಥಿಂಕಿಂಗ್ ದಟ್ ಐ ಆಮ್ ಅ ನೈಸ್ ಪರ್ಸನ್. ನನ್ನ ಬಗ್ಗೆ ಸಿಟ್ಟಿರೋದ್ರಿಂದ ಅವ್ರು ಮಾತಾಡಿಲ್ಲ. ಮೇ ಬಿ ಯು ಕ್ಯಾನ್ ಕೌಂಟರ್ ವಿತ್ ಅವ್ರು ಏನೋ ತುಂಬಾ ಟೆನ್ಷನ್ ಅಲ್ಲಿ ಇದ್ದಿರ್ಬೋದು, ಅದಕ್ಕೆ ನೋಡಿದ್ರು ಗೊತ್ತಾಗ್ಲಿಲ್ವೇನೋ. This alternative perspective you will be equipped to have, which the person in distress will not be having because of high level of distress. ನಾನು ಸ್ಟೇಜ್ ಮೇಲೆ ಬಂದು ಮಾತಾಡ್ಬೇಕು, ನಂಗೆ ಬೇರೆ ಏನೂ ಯೋಚನೆಗಳಾಗ್ತಾ ಇರಲ್ಲ, ತುಂಬಾ ಹೆದರಿಕೆ ಆಗ್ತಾ ಇದೆ. ಹೆದರಬೇಡಿ, ನಿಂಗೆ ಗೊತ್ತಿರೋರೇ ಎಲ್ಲ ಜನ, ನೀನ್ ಆರಾಮಾಗಿ ಹೋದ್ರೆ ಪ್ರಾಬಬ್ಲಿ ದೇ ವಿಲ್ ಲಿಸನ್ ಟು ಯು ಬೆಟರ್ alternative version. So all these alternative versions you will be equipped to provide, and that the person will take whichever he or she wants. Method of interaction will be very important, and you have to follow certain theory. ನಾನು ಆಗ್ಲೇ ಹೇಳ್ದಂಗೆ each one should have a niche area where you know the theories, where you know, for example, child counseling ತಗೊಂಡ್ರಿ ಅಂದ್ರೆ ಚೈಲ್ಡ್ ಡೆವಲಪ್ಮೆಂಟ್, ಯಾವ್ಯಾವ ಏಜ್ ಅಲ್ಲಿ ಯಾವ್ಯಾವ ತರದ ಕಾಯಿಲೆಗಳು ಬರ್ಬೋದು, ಮಗುಗೆ ಹೇಗೆ ಮಾತಾಡಿದ್ರೆ ಓಕೆ, ಇಂಟರ್ನೆಟ್ ಅಲ್ಲಿ ಏನೇನ್ ಬರ್ತಿದೆ ಅದು ಅಷ್ಟ್ರದ್ದು ನಿಮಗೆ ಮೇಲಿಂದ ಕೆಳಗೆ ತನಕ you should have knowledge of that, because your children are moving much more faster than you are, and half of the time we will not know anything that they are talking about. Again, going by the language of children who are now maybe young adults or teenagers, if you sit with them and listen to them talk, probably you will get only 40% of what they're saying. ಅವ್ರು ಏನ್ ಮಾತಾಡ್ತಿದಾರೆ ಅನ್ನೋದೇ ಗೊತ್ತಾಗ್ತಾ ಇರಲ್ಲ. So they have moved on so fast and so much ahead. So if you are working in that field, you should be keeping up with them. ನೀವು ಅವ್ರಕ್ಕಿಂತ ಒಂದ್ ಹೆಜ್ಜೆ ಮುಂದಿದ್ರೆ ಮಾತ್ರ you can be able to help them. So you should learn, and this is for probably people who are working in the educational setup. Very important to know the in and out of what is happening on internet. ಈ ಬ್ಲೂ ವೇಲ್ ಫೆನಾಮಿನಾ ಇರ್ಬೋದು. ರೀಸೆಂಟ್ಲಿ ಈಗ 4467 or something is there, one group which trolls people enough to kill them. Recently I had one child who spoke to me about doxing. Doxing ಅಂದ್ರೆ ಏನಂತ ಗೊತ್ತಾ ನಿಮ್ಗೆ? ಇಡೀ ಕಾನ್ವರ್ಸೇಷನ್ ಅಲ್ಲಿ 25 ನಿಮಿಷ ಡಾಕ್ಸಿಂಗ್ ಅಂತದ್ದು. ಇಟ್ಸ್ 6th standard child from ಭದ್ರಾವತಿ, ನಾಟ್ ಫ್ರಮ್ ಬೆಂಗಳೂರು ಮೈಸೂರು. ಡಾಕ್ಸಿಂಗ್ ಅಂತ 20 ನಿಮಿಷ. ನಾನು ಸುಮ್ಮನೆ ತಲೆ ಅಲ್ಲಾಡ್ಸೆ, ನಂಗೆ ಡಾಕ್ಸಿಂಗ್ ಏನ್ ಗೊತ್ತಿರಲಿಲ್ಲ. ಮಗು ಹೊರಗೆ ಹೋದ್ಮೇಲೆ ನಾನು ಇಂಟರ್ನೆಟ್ ಮೇಲೆ ಹಾಕಿ ನೋಡಿದೆ ಡಾಕ್ಸಿಂಗ್ ಏನು ಅಂತ. So this is how fast they are moving ahead. So if you do not know, they will never come to you. ಇವ್ರಿಗೆ ನನ್ನ ಪ್ರಾಬ್ಲಮೇ ಅರ್ಥ ಆಗಲ್ಲ, ನಾ ಏನ್ ಮಾತಾಡ್ತಿದ್ದೀನಿ ಅಂತಾನೆ ಗೊತ್ತಿರಲ್ಲ. So these are things you should know in every aspect. Relationship counseling ಇರ್ಬೋದು, child counseling ಇರ್ಬೋದು, you should know in depth of what is happening. The how item. This I've already mentioned, I think, most of them. Again, defining limitations of the goal is very important. One of the things, whenever we aspire for, we have to aspire for the best possible solution, but sometimes it might not be the only possible solution. So ಅದಕ್ಕಿಂತ ಒಂದು ಲೆವೆಲ್ ಕಡಿಮೆ ಇರೋ ಸೊಲ್ಯೂಷನ್ಗೆ ಅವ್ರು ಹೂ ಅನ್ಬೇಕಾಗ್ಬೋದು. ಲೈಕ್ ಸೇ ಅ ಚೈಲ್ಡ್ ಹಸ್ ಕಮ್ ಹೂಸ್ ಆಲ್ರೆಡಿ ಟೇಕಿಂಗ್ ಮೇ ಬಿ 50-60%. ನನ್ನ ಕ್ಲಾಸ್ನಲ್ಲಿ ಫಸ್ಟ್ ಬರಬೇಕು, ಅದಕ್ಕೆ ನಂಗೆ ಹೆಲ್ಪ್ ಮಾಡಿ ಅಂದ್ರೆ, maybe you should talk over a period of time, try and find out why this child is getting 60, not 95. And if you feel that there are very genuine reasons why and there is lack of time, maybe you should help the child understand that 60 in the 75-80 is a good enough option. 99 ಆಗ್ಬೇಕಂತಿಲ್ಲ, because that will put you in more stress. There is less time and you might feel bad for getting 80 at least, which is an improvement from 60. So it is not always the best answer that you're trying for, but sometimes you should know limitations, goals, because again this will happen. 3 ತಿಂಗಳಲ್ಲಿ ಆಗ್ಬೇಕು, ಈಗ 3 ತಿಂಗಳಲ್ಲಿ ಮದುವೆ ಇದೆ, ಈಗ ಆತಂಕ ಸಡನ್ ಆಗಿ ಇಳಿಸ್ಕೊಟ್ಬಿಡಿ, ಒಂದೇ ವಾರ ಮಾತ್ರ ತಗೋತೀನಿ. Not possible. We might want to do it, ಬಟ್ ಹ್ಯೂಮನ್ಲಿ ನಾಟ್ ಪಾಸಿಬಲ್ ಇರೋದನ್ನ ನೀಟಾಗಿ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿದ್ರೆ ದೇ ವಿಲ್ ಬಿ ಏಬಲ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಬೆಟರ್. Privacy, confidentiality, understanding, trust and safety, all of this I have explained already. Qualitative is what you give. ಈಗ how many number of sessions of counseling will not count. Some counseling, again, this is a very important question. ಕೆಲವು ಪ್ರಾಬ್ಲಮ್ಸ್ ಒಂದು ಸೆಷನ್ ಅಲ್ಲಿ ಸಾಲ್ವ್ ಆಗ್ಬೋದು ಸರ್. ಇನ್ನು ಕೆಲವು ಪ್ರಾಬ್ಲಮ್ಸ್ ಗೆ ಇಟ್ ಮೈಟ್ ಟೇಕ್ 6, 8, 10, 12 months. Like say for example, I have come with a relationship problem. It might be solved in one day. But if I come with a problem wherein I am scared or underconfident in social situations, it might take a long time. So the quality of the relationship is probably more important than the quantity, as we may say. So it has to be qualitative, and it needs that level of involvement to be qualitative. Again, this is a very ಏನಂತಾರೆ vague term. ಯಾಕೆಂದ್ರೆ ಕ್ವಾಲಿಟಿ ಚೆನ್ನಾಗಿದೆ ಅಂತ ಹೆಂಗ್ ಗೊತ್ತಾಗುತ್ತೆ ನಿಮ್ಗೆ? ಈಗ ನಾನೊಂದು ಕ್ರೋಸಿನ್ ತಗೊಂಡ್ರೆ 104ರಿಂದ 98 ಬರೋದು ಕಣ್ಣಿಗೆ ಕಾಣುತ್ತೆ ಟೆಂಪರೇಚರ್. But in a qualitative counseling session, the session should be, which is again a very abstract thing. You will know once you start counseling, this has gone well and this has not gone well. A session ಆದ್ಮೇಲೆ ಗೊತ್ತಾಗ್ಬಿಡುತ್ತೆ. So you should have that, comfort that you have done something good. The client should, appreciate the session or understand that something good has happened in my life, or that some change has been initiated. Client should keep coming back for counseling sessions and try and see whether that person's problems have got solved, kind of familially, socially, personally, ella kade, not only that specific problem. Idu ನೀವು ನೋಡ್ತಾ ಗೊತ್ತಾಗುತ್ತೆ. There is no way you can assess it. Quantitative is assessing based on numbers. Qualitative is what you feel internally, which probably over time we all get to. Okay, goals of counseling: providing social, psychological support. These are all exam questions. So therefore, providing psychological support, problem solving and decision making, improving personal effectiveness. As I already told you, ನನ್ನನ್ನು ನಾನು ಇಂಪ್ರೂವ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಹೇಗೆ ಅಂತ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೂ ಎಷ್ಟೋ ಜನ ಬರ್ತಾರೆ. So how can I make myself better? How can I have better goals? How can I plan well for my future? Who should I marry? ಈಗ ಹೊಸದಾಗಿ ಬರ್ತಾ ಇರೋದು ನಾವು ನೋಡ್ತಾ ಇದೀವಿ. Who should I marry? My goals are different from my partner's goals. How should I handle this? All these are questions which come up right now. Insight and understanding to improve self-actualization, which is our final goal. Sthita prajnavasthe athwa going beyond all our needs, which is quite difficult, but it is a very, very important goal in counseling. Achievement of positive health. You should know that now, as earlier we were discussing, WHO health in a definition alli bari physical health ಮಾತ್ರ ಅಲ್ಲ, mental, emotional and spiritual health ಮೂರನ್ನು ಸೇರಿಸಿದ್ದಾರೆ. And healthy person means bari physical health ಅಲ್ಲ, emo. But again, problem is mental, physical, emotional and spiritual health na ಮಾಪ್ ಮಾಡೋದಕ್ಕೆ ನಮ್ಮ ಹತ್ರ ಸ್ಕೇಲ್ ಇಲ್ಲ. We won't know whether we are spiritually healthy. ಅಂದ್ರೆ 3 ಗಂಟೆ ಪೂಜೆ ಮಾಡಿದ್ರೆ ನಾನು spiritually healthy ನಾ? ಒಂದ್ಸಲ ದೇವ್ರಿಗೆ ಕೈ ಮುಗಿದ್ರೆ healthy ನಾ? If I'm an atheist, am I spiritually healthy? Very difficult to assess. But these are very important areas because now we know something called mind-body connection. ಈಗ ಏನ್ ಹೇಳ್ತಾ ಇದಾರೆ ಅಂದ್ರೆ, ದೈಹಿಕವಾಗಿ ಯಾವುದೇ ಕಾಯಿಲೆ ಆದ್ರೂ ಅದಕ್ಕೆ ಎಲ್ಲೋ ಒಂದು ಕಡೆ there is an etiology which is psychological. Any illness, it might be diabetes, it might be hypertension, it might be cardiac disease. All of these diseases have an etiology in the brain. ಎರಡು ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಇಬ್ರು ಇರ್ತಾರೆ, ಅಣ್ಣ ತಮ್ಮ, ಒಬ್ರಿಗೆ ಹೈಪರ್ಟೆನ್ಷನ್ ಇರುತ್ತೆ, ಒಬ್ರಿಗೆ ಇರಲ್ಲ. ಯಾಕೆ? ಅಪ್ಪಂಗಿತ್ತು, ಅಜ್ಜಂಗಿತ್ತು, ಬಟ್ ಒಬ್ರಿಗೆ ಬಂದೇ ಇಲ್ಲ. ಹೆಂಗೆ? They feel that there is a psychological etiology behind it. So therefore, all these illnesses also, and now we are in a time, 1900s ಅಲ್ಲಿ ಹೇಗಿತ್ತು ಅಂದ್ರೆ, diseases coming from external agents, tuberculosis, leprosy, ನಮ್ದು ಯಾವುದೇ ವೈರಲ್ ಇಲ್ನೆಸ್, ಇನ್ಫ್ಲೂಯೆನ್ಸಾ ಎಪಿಡೆಮಿಕ್, ಪ್ಲೇಗು. ಸೊ ಹೊರಗಿಂದ ಬರುತ್ತೆ. ಸೊ ನಾವು ಆ ವಿಷಯವನ್ನ ತೆಗೆದು ನಿರ್ಮೂಲ ಮಾಡ್ಬಿಡಬಹುದು. But this century of diseases, as you rightly pointed out, the pandemic is going to be mental ill health anta, which doesn't mean schizophrenia, mania, everything. It means all chronic lifestyle diseases, all the people suffering from them will need counseling. Once they improve that only, ನೀವು ನೋಡಿರ್ಬೋದು, ಹೈಪರ್ ಟೆನ್ಷನ್ಗೆ 1 ಮಾತ್ರೆ ಹಾಕಿದ್ರೆ ಒಬ್ರು ಸರಿ ಹೋಗ್ತಾರೆ, 10 ಮಾತ್ರೆ ಹಾಕಿದ್ರು ಕಂಟ್ರೋಲಿಗೆ ಬರಲ್ಲ. ಯಾಕೆ? ಬಿಕಾಸ್ ದಟ್ ಪರ್ಸನ್ ಇಸ್ ಅ ಟೈಪ್ ಎ ಪರ್ಸನಾಲಿಟಿ. ಬೆಳಗಿಂದ ಸಂಜೆ ಕಾರ್ಪೊರೇಟ್ ಸೆಕ್ಟರ್ ಅಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇರ್ತಾರೆ, ಆಲ್ ದ ಟೈಮ್ ಡಿಸಿಷನ್ ಮೇಕಿಂಗ್, ಸ್ಟ್ರೆಸ್ಡ್. ಸೊ ನೀವು 10 ಮಾತ್ರ ಹಾಕಿದ್ರು ಹೈಪರ್ ಟೆನ್ಷನ್ ಕಡಿಮೆ. ಆನ್ ದ ಅದರ್ ಹ್ಯಾಂಡ್, ಇಫ್ ಯು ಟೀಚಿಂಗ್ ಸ್ಟ್ರೆಸ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್, ಮೇ ಬಿ ವಿಲ್ ಫಂಕ್ಷನ್ ಬೆಟರ್ ಅಂಡ್ ಹಿಸ್ ಮೆಡಿಕೇಶನ್ ಲೆವೆಲ್. ಸೊ ನೌ what we are thinking is all these chronic diseases, chronic lifestyle ailments would require psychological help, which you will be equipped with. As I told you, sir, that is our final goal, where we go beyond multiple need states. Maslow pyramid anta ಹೇಳ್ತೇವೆ. ಕೆಳಗೆ ಬೇಸಿಕ್ ನೀಡ್ಸ್, ಊಟ, ತಿಂಡಿ, ನಿದ್ದೆ. ಅದ್ರ ನೆಕ್ಸ್ಟ್ ನೀಡ್ಸ್ ಇರೋದು ಸೇಫ್ಟಿ, ಸೆಕ್ಯೂರಿಟಿ. ನನ್ಗೊಂದ್ ಮನೆ ಇದೆಯಾ, ಕಳ್ಳ ಬಂದು ಓದ್ಕೊಂಡು ಹೋಗಲ್ವಲ್ಲ. ನೆಕ್ಸ್ಟ್ ನೀಡ್ಸ್ ಆರ್ ಇಮೋಷನಲ್ ನೀಡ್ಸ್. ನನ್ಗೆ ಯಾರು ಪ್ರೀತಿ ಮಾಡ್ತಾರ, ನನ್ ಜೊತೆ ಚೆನ್ನಾಗಿದಾರ. ಫೈನಲಿ ದ ಲಾಸ್ಟ್ ಸ್ಟೇಜ್ ದಟ್ ಯು ಗೋ ಟು ಇಸ್ ನಾನು ಈ ಎಲ್ಲಾ ನೀಡ್ಸ್ ನ ಹೊರತುಪಟ್ಟು ಅದಕ್ಕಿಂತ ಮೇಲೆ ಏನಾದ್ರೂ ಅಚೀವ್ ಮಾಡಕ್ಕೆ ಹೋಗ್ತೀನಿ, ನನ್ನ ಪರ್ಸನಲ್ ಲೈಫ್ ಆರ್ ಪಾಸಿಟಿವ್ ಹೆಲ್ತ್, ಆಲ್ಟ್ರೂಯಿಸ್ಟಿಕ್ ಟೈಪ್ ಆಫ್ ಗೋಲ್ಸ್. ನಾನು ಬೇರೆಯವರಿಗೆ ಸಹಾಯ ಮಾಡಕ್ ಹೋಗ್ತಾ ಇದೀನಿ. ಐ ಆಮ್ ಅ ಪರ್ಸನ್ ಹೂ ಡಸಂಟ್ ಥಿಂಕ್ ಅಬೌಟ್ ಮೈ ಸೆಲ್ಫ್ ಬಟ್ ಥಿಂಕ್ಸ್ ಪ್ರಾಬಬ್ಲಿ ಮೋರ್ ಅಬೌಟ್ ದ ವರ್ಲ್ಡ್. ಆ ಲೆವೆಲ್ಗೆ ರೀಚ್ ಆಗೋದು ಸೆಲ್ಫ್ ಆಕ್ಚುಲೈಸೇಷನ್. ಫೈನಲ್ ಗೋಲ್ ಇಟ್ಸ್ ಅ ಯೂಟೋಪಿಯನ್ ಗೋಲ್. ಫೈನಲ್ ಗೋಲ್ ಎಲ್ಲರದು ಅದೇ ಇರುತ್ತೆ, ಬಟ್ ಅದ್ರ ಬೇರೆ ಬೇರೆ ಲೆವೆಲ್ಸ್ ಅಲ್ಲಿ ನಮ್ ಲಿಮಿಟೇಷನ್ ಪ್ರಕಾರ ನಾವು ಗೋಲ್ಸ್ ನ ಹಾಕೋಬೇಕು. ಸೆಲ್ಫ್ ಹಾ ಸರ್, ಹೌದು, ಸಮಥಿಂಗ್ ಸಿಮಿಲರ್ ಟು ದಟ್ ಐ ಹವ್ ಗಾಟ್. ಅಂದ್ರೆ ವಾಟ್ ಮ್ಯಾಸ್ಲೋ ಸೇಸ್ ಇಸ್ ಅಂಟಿಲ್ ಒನ್ ನೀಡ್ ಇಸ್ ಫುಲ್ಫಿಲ್ಡ್ ಯು ಕ್ಯಾನ್ ನೆವರ್ ಗೋ ಟು ದ ನೆಕ್ಸ್ಟ್ ಒನ್. Like say you are fasting, but if you are hungry, the fast will not work because you can't think of anything else. You are doing it for some spiritual reason, but all the time you are thinking of food. It will never work out well. So one need is met andre matra you can move on to the next need. Like saying that find your professional achievement when you have not had 3 square meals a day seems like a moot point. So you should cross that level, go to the next. Cross that level, go to the next. Only then a person will be able to self-actualize. Otherwise, it's difficult. It is good in theory, but difficult to self-actualize in practice if these needs are not met. In this century, and with the counselees that you will see probably, especially in urban areas, this is a valid goal. A lot of people are doing it. Our emotional needs meet agide, safety needs meet agide, financial needs meet agide. Therefore, they are more altruistic in nature. ನಾನು ಹೋಗಿ ಅಲ್ಲಿ ಎನ್ವೈರನ್ಮೆಂಟ್ ವರ್ಕ್ ಮಾಡ್ತೀನಿ, ನಾನು ಹೋಗಿ ಇನ್ನೊಂದಕ್ಕೆ ಆಕ್ಟಿವಿಸಮ್ ಮಾಡ್ತೀನಿ. ದಿಸ್ ಕಮ್ಸ್ ಆಫ್ಟರ್ ಆಲ್ ದೀಸ್ ನೀಡ್ಸ್ ಆರ್ ಮೆಟ್. ಅದರ್ವೈಸ್ ಇಟ್ಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಅಚೀವ್. ಸೊ ಜಸ್ಟ್ ಅ ಫ್ಯೂ ಬೆನಿಫಿಟ್ಸ್ ಆಫ್ ಕೌನ್ಸಿಲಿಂಗ್ ಇಸ್ ಲೆಸ್ ಆಂಗ್ಸೈಟಿ, greater self-confidence, better relationships, regaining your emotional balance, which can get lost very, very easily in today's stressful scenario. Increase assertiveness to the extent that just the number of likes on your Facebook or your Insta post can change your emotional balance. ನೀವು ತುಂಬಾ ಇಷ್ಟಪಟ್ಟು ಹಾಕಿರ್ತೀರಾ, ಎಷ್ಟೋ ಜನ ಐ ಹ್ಯಾವ್ ಸೀನ್ ವಿಲ್ ಗೋ ಥ್ರೂ ಟು ಸಿ ಈಗ 300 ಲೈಕ್ ಬಂದಿದೆ ಅಂದ್ರೆ ಯಾರು ಲೈಕ್ ಮಾಡಿರೋದಂತಾನು ನೋಡ್ತಾರೆ. ಅಂಡ್ ದೇ ವಿಲ್ ಪಾಯಿಂಟ್ ಔಟ್ ಟು ದಟ್ ಒನ್ ಪರ್ಸನ್ ಹೂ ಶುಡ್ ಹ್ಯಾವ್ ಲೈಕ್ ಇಟ್ ಬಟ್ ಡಿಡ್ ನಾಟ್, ಅಂಡ್ ದೇ ಆರ್ ಡೂಯಿಂಗ್ ಇಟ್ ಟು ಸ್ಪೈಟ್ ಮೀ. ಇದು ಬರುತ್ತೆ, ನೀವೆಲ್ಲರೂ ನೋಡಿದೀರಾ. ಸಮಟೈಮ್ಸ್ ವಿ ಹ್ಯಾವ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ಡ್ ಇಟ್ ಆಲ್ಸೋ. ಇಟ್ಸ್ ಅ ಪರ್ಸನಲ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಆಲ್ಸೋ. ಸೊ ಹಂಗಿದ್ದಾಗ ಎಸ್ it will increase, sir, very much, because we have more virtual friends than real life friends in today's scenario. ಅದಕ್ಕೆ ಸರ್, ಅದಕ್ಕೆ ನಾನು ಹೇಳ್ತಿರೋದು ಅದು ನಾರ್ಮಲ್ ಬಿಹೇವಿಯರ್. ಟ್ರೂ ಸರ್, ಬಟ್ ಇಫ್ ಇಟ್ ಇಸ್ ಡಿಸ್ಟ್ರೆಸಿಂಗ್ ಯು, ದ ಡಿಸ್ಟ್ರೆಸ್ ನೀಡ್ಸ್ ಟು ಬಿ ಸಾಲ್ವ್ಡ್ ಅಲ್ಲ ಸರ್. ಈಗ ನೀವು ದಟ್ಸ್ ವೇರ್ ಐ ಆಮ್ ಸೇಯಿಂಗ್. ಸಿ, ಬೇರೆಯವರು ನಮ್ಮನ್ನ ನೋಡಿ ಖುಷಿ ಪಡ್ಬೇಕು ಅನ್ನೋದಕ್ಕೆ ನಾವು ನೀಟಾಗಿ ಡ್ರೆಸ್ ಮಾಡ್ಕೊಳ್ಳೋದು, ಈ ಫಂಕ್ಷನ್ಗೆ ಹೋಗೋದು, ಅದೆಲ್ಲ ಮಾಡೋದು ಅದಕ್ಕೇನೆ. ಬಟ್ ಅವ್ರು ನಮ್ಮನ್ನ ನೋಡಿಲ್ಲ ಅಂತ ನೆಕ್ಸ್ಟ್ 3 ದಿನ ನಾನು ಮನೇಲಿ ಅಡುಗೆ ಮಾಡಿಲ್ಲ ಅಂದ್ರೆ ಐ ನೀಡ್ ಹಂಗೆ. ದಟ್ ಮೇಕ್ಸ್ ಅ ಡಿಫರೆನ್ಸ್. ಸೊ making that, because most of us are on social media all the time. So who we are as a self is more defined by social media than ourselves. That is what is happening right now, and it is causing so much stress. We have children who are influencers who are in such tremendous stress, which is the reason why if you have read the papers, Australia dalli social media ban madidare. ಈಗ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ 18 ವರ್ಷದ ಕಡಿಮೆ ಇರೋರು ವಿಡಿಯೋಸ್ ನ ಅಪ್ಲೋಡ್ ಮಾಡಕ್ಕೆ ಆಗಲ್ಲ. ಇಟ್ ಇಸ್ ಸೋ ಸ್ಟ್ರೆಸ್ಫುಲ್. ಐ ಹ್ಯಾವ್ an 8-year-old who puts her music videos on YouTube. ಓ ಮೈ ಗಾಡ್, ಅದನ್ನ ತೆಗಿಯಕ್ಕೆ ಹೇಳಿದಾರೆ ಅಂತ ಆ ಮಗು 3 ದಿನ ಊಟ ಮಾಡಿಲ್ಲ. ಅದು ಅದ್ರಲ್ಲಿ ಮಾತ್ರ ಅಪ್ಲೋಡ್ ಮಾಡಿತ್ತಂತೆ, ಹಾರ್ಡ್ ಡಿಸ್ಕ್ ಅಲ್ಲಿ ಸ್ಟೋರ್ ಮಾಡಿರ್ಲಿಲ್ವಂತೆ ಅವಳ ವಿಡಿಯೋಸ್ ನ. ಸೊ ಶಿ ಇಸ್ ನಾಟ್ ಏಬಲ್ ಟು ಟೇಕ್, ಅಂದ್ರೆ ದೇ ಅನೌನ್ಸ್ಡ್ ಇಟ್ ಒನ್ ಡೇ ಅಂಡ್ ನೆಕ್ಸ್ಟ್ ಡೇ ದೇ ಕಟ್ ಇಟ್ ಆಫ್. ಆ ಚಾನಲ್ ಗೆ ಓಪನಿಂಗ್ ಸಿಗ್ಲಿಲ್ಲ, ಮತ್ತೆ ಅದ್ರಲ್ಲಿ ಅಪ್ಲೋಡ್ ಮಾಡಿರೋ ವಿಡಿಯೋಸ್ ಇವ್ರಿಗೆ ಸಿಗ್ತಾನೂ ಇಲ್ಲ. ದ ಚೈಲ್ಡ್ ಗಾಟ್ ಸೋ ಡಿಸ್ಟ್ರೆಸ್, ಸ್ಟಾಪ್ ಸ್ಲೀಪಿಂಗ್, ಸ್ಟಾಪ್ ಈಟಿಂಗ್, ಕೆಪ್ಟ್ ಟಾಕಿಂಗ್ ದ ಸೇಮ್ ಥಿಂಗ್ ಅಗೇನ್ ಅಂಡ್ ಅಗೇನ್, ಸೋ ಮಚ್ ಸೊ ದಟ್ ದ ಪೇರೆಂಟ್ ಗಾಟ್ ಹರ್ಟ್. ಈ ತರ ಅಷ್ಟು ಆ ಲೆವೆಲ್ಗೆ ಸ್ಟ್ರೆಸ್ ಇದೆ, ವಿಚ್ none of us can comprehend at this age, but for them that is only one of the big things. ಸ್ಕೂಲ್ಗೆ ಹೋಗಲ್ಲ, ಅದನ್ನ ಹುಡುಕ್ಬೇಕು, ಅಪ್ಪಂಗ್ ಹುಡುಕ್ಸೋದು, ಯಾರ್ದೋ ಕಸಿನಿಗೆ ಫೋನ್ ಮಾಡಿ ನೀನ್ ಕಂಪ್ಯೂಟರ್ ಇಂಜಿನಿಯರ್ ಅಲ್ಲ, ನೀನ್ ಹುಡುಕ್ಕೊಡು, ಅದ್ರಲ್ಲಿ ಇರೋ ತೆಕ್ಕೊಡು, ನಾನು ಹಾಕೋಬೇಕು. ದಿಸ್ ವೆಂಟ್ ಆನ್ 3 days 4 days. Mother kept thinking it will come down, didn't come down, and then finally got it to come. So when it becomes too much, or it is disturbing your routine or your emotions and not giving you that balance, then maybe you should talk. Increased assertiveness, stress relief, ability to set boundaries, and trauma resolution. All of this are benefits of counseling. Process of counseling, ನೀವು ಏನೇನ್ ಮಾಡಬೇಕು ಅಂತ ಬಂದಾಗ, when a counselee comes to you, one is help articulate the problem. ಎಷ್ಟೋ ಜನರಿಗೆ ಪ್ರಾಬ್ಲಮ್ ಏನಂತಾನೆ ಗೊತ್ತಿರಲ್ಲ. ಏನೋ ಆಗ್ತಾ ಇದೆ ನನಗೆ, ಹೆಂಗೋ ಆಗ್ತಾ ಇದೆ ನನಗೆ, ಏನನ್ನದೇ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ. These are things that they will tell you and you are confused. ಒಂದ್ 20 ನಿಮಿಷ ಮಾತಾಡಿರ್ತಾರೆ, ಕೊನೆಗೂ ನಿಮಗೆ ಏನಂತ ಗೊತ್ತೇ ಆಗಲ್ಲ ಅವ್ರಿಗೆ ಆಗ್ತಾ ಇರೋದು. So you should know how to break it down. Slowly ask them questions where they'll explain better. ನನ್ಗೆ ಹೆಂಗೋ ಆಗ್ತಾ ಇದೆ, ಹೆಂಗೋ ಅಂದ್ರೆ ಏನು, ಅದನ್ನ ಚೂರು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ, ಎಲ್ಲಿ ಆಗ್ತಾ ಇದೆ ಇದು, ಮನ್ಸಲ್ಲಿ ಆಗ್ತಿದ್ಯಾ, ಹೊಟ್ಟೆಲ್ ಆಗ್ತಿದ್ಯಾ, ಕೈ ನಡುಕ್ತಾ ಇದೆಯಾ, then they'll be able to probably tell you better, and then the problem will come out. So this is articulation of the problem. Forming goals, as I told you, ಅವರು a lot of times they will take you for the agony aunt and not the counselor. ಅವ್ರಿಗೆ ಪ್ರಾಬ್ಲಮ್ ಆದಾಗ ಬರ್ತಾರೆ, 1 ಗಂಟೆ ಬರೀ ಅವರೇ ಮಾತಾಡ್ತಾರೆ, ಆಮೇಲೆ ಹೋಗ್ತಾರೆ. ಅವ್ರು ಫುಲ್ ಆರಾಮಾಗಿರ್ತಾರೆ, ನಿಮಗೆ ಏನ್ ಮಾಡಿದಿರ ಅಂತ ನಿಮ್ಗೆ ಗೊತ್ತಿರಲ್ಲ. ಯು ವಿಲ್ ಬಿ ಕನ್ಫ್ಯೂಸ್ಡ್. ಡಿಡ್ ಐ ಹೆಲ್ಪ್, ಡಿಡ್ ಐ ನಾಟ್ ಹೆಲ್ಪ್, ಶುಡ್ ಐ ಸ್ಟಾಪ್, ಶುಡ್ ಐ ಕಾಲ್ ಹರ್ ನೆಕ್ಸ್ಟ್ ಟೈಮ್, ಯು ವಿಲ್ ನಾಟ್ ನೋ. So you are not a person where they can vent and go, though that is a part of counseling. But you should know when to stop, when to form goals and tell them, okay, I understood your problem enough. Like for example, this happens in marital problems. 20 ವರ್ಷ ಜಗಳ ಆಡ್ಕೊಂಡು ಬಂದಿರ್ತಾರೆ. 20 ವರ್ಷದ ಎವ್ರಿ ಡೇ ಆಗಿರೋ ಜಗಳವನ್ನ ನಿಮಗೆ ವಿವರಿಸ್ತಾರೆ. ಅಂದ್ರೆ ನೆಕ್ಸ್ಟ್ ನೀವು 4 ವರ್ಷ ಜಗಳ ಕೇಳೋದ್ರಲ್ಲಿ ಆಮೇಲೆ ಗೋಲ್ ಫಾರ್ಮುಲೇಟ್. So this will happen. So you should stop them in between. You tell them that I understand that there is a problem. I understand that this is going on since 20. Let's see what you want out of this. Why have you come to me? Let's formulate some goal. And maybe that will reach you to a better, more useful solution than this. Trust and confidentiality, very, very important. Even if you are telling or belag yen tindi tindidu anta partner ge helak munchenu kelkobeku. Can I talk about this to your relatives? Especially when they are talking about self-harm. ನನಗೆ ಜೀವನನೇ ಬೇಡ ಅನ್ಸ್ತಾ ಇದೆ, ಸಾಯ್ಬೇಕು ಅನ್ಸ್ತಾ ಇದೆ, ಯು ಆರ್ ಸ್ಕೇರ್ಡ್ ದಟ್ ದೇ ಮೈಟ್ ಗೋ ಅಂಡ್ ಡೂ ಸಮಥಿಂಗ್. ಯು ಆಸ್ಕ್ ದೆಮ್, ಯಾರಿಗೂ ಹೇಳ್ಬೇಡಿ, ಇದು ಯಾರಿಗೂ ಹೇಳಲ್ಲ ಅಂದ್ರೆ ಮಾತ್ರ ನಾನು ನಿಮಗೆ ಹೇಳ್ತೀನಿ. ವಾಟ್ ವಿಲ್ ಯು ಡೂ? ಹೌ ವಿಲ್ ಯು ಹೆಲ್ಪ್ ದಿಸ್ ಕ್ಲೈಂಟ್? ಲಾಟ್ ಆಫ್ ದೆಮ್ ವಿಲ್ ಕಮ್ ಅಂಡ್ ಟೆಲ್, ಎಸ್ಪೆಷಲಿ ಕಿಡ್ಸ್ ಆರ್ ವಿಮೆನ್ ಇನ್ ಡಿಸ್ಟ್ರೆಸ್ ವಿಲ್ ಕಮ್ ಅಂಡ್ ಟೆಲ್ ಯು. ಎಷ್ಟೋ ಸಲ ಅನ್ಕೊಂಡ್ಬಿಟ್ಟಿದ್ದೀನಿ, ಅವ್ರು ಹೋದ ತಕ್ಷಣ ಕುಯ್ಕೊಂಡ್ಬಿಡೋಣ ಅಂತ, ಅವ್ರು ಹೋದ ತಕ್ಷಣ ಏನಾಕೊಂಡ್ಬಿಡೋಣ ಅಂತ. ಸೊ ವಾಟ್ ವಿಲ್ ಯು ಡೂ? Patient will tell, if you are telling this to somebody else, then I will never come to you for help. You are scared that if she doesn't come again, then she's not getting what little help you are giving her. ಮತ್ತೆ ನಿಜವಾಗ್ಲೂ ಹಂಗ್ ಮಾಡ್ಕೊಂಡ್ಬಿಟ್ರೆ ಅಂತಾನು ಭಯ. ಹೇಳಕ್ ಹೋದ್ರೆ ಟ್ರಸ್ಟ್ ಅಂಡ್ ಕಾನ್ಫಿಡೆನ್ಶಿಯಾಲಿಟಿ. So how will you handle this situation? What would you do? Maybe people who are working in the field, how would you handle it? If a child comes and tells you, don't tell the parent, what would you do? You can sit and answer, please. Others, you have to tell. Good. And the child says, no, I still don't want to tell. Then? ಅವ್ರು ಒಂದ್ಸಲ ಸಣ್ಣ ಕುಯ್ಕೊಂಡು ಬಂದ್ಬಿಟ್ಟಿರ್ತಾರೆ, ನೀವು ನೋಡಿರ್ತೀರಾ, ಒಂದು ಗಾಯ ಆಗಿದೆ, or they've tried to do something. ಅಪ್ಪನ್ BP ಮಾತ್ರ ನೆನ್ನೆ 3 ನುಂಗ್ಬಿಟ್ಟೆ. These are all flags to tell you something is going wrong somewhere. How would you handle it? Usually, what she said is the first option. You should tell that I have to tell this because this is one place where confidentiality gets breached. But again, excuse me, client is very important. You should understand, ಈಗ ಅವ್ರು ನಿಮ್ಮ ಹತ್ರ ಬರ್ಲಿಲ್ಲ ಅಂದ್ರೆ ಅವ್ರಿಗೆ ಜಾಸ್ತಿ ಡೇಂಜರಾ ಅಥವಾ ನೀವ್ ಹೇಳಿದ್ರೆ ಜಾಸ್ತಿ ಡೇಂಜರಾ. ಸೊ ಸ್ಲೋಲಿ ಸಿಟ್ ಅಂಡ್ ನ್ಯಾವಿಗೇಟ್. ಯಾರು ದೊಡ್ಡವ್ರಿಗೆ ಹೇಳ್ಬೋದು, ನಿಮ್ ಕಸಿನ್ ಇದಾರಾ, ನಿಮ್ ರಿಲೇಟಿವ್ ಇದಾರಾ, ನಿಮ್ ಟೀಚರ್ ಇದಾರಾ, somewhere who I can tell so that they keep you safe, because our goal is to keep you safe. So the easiest way to handle this is, one, you should make the counselee understand that you care about their safety. You understand that this feeling can go and you can live a happy life. So adinna avrige convince ಮಾಡಬೇಕು. And is there anybody who is close to them who can give this help? Usually ಯಾರು ಹೇಳ್ತಾರೆ, ನನ್ನ ಕಸಿನ್ ಸಿಸ್ಟರ್ ಒಬ್ಳಿದಾಳೆ, ಅವಳಿಗೆ ಎಲ್ಲ ಹೇಳ್ಕೊಳ್ತೀನಿ, ಅಥವಾ ಪಕ್ಕದ ಮನೆ ಫ್ರೆಂಡ್ ಇದ್ದಾರೆ, ಒಬ್ರು ಆಂಟಿ ಇದ್ದಾರೆ. So then you ask permission whether you can talk to those people. And if the child says yes, then you speak. But if the child says no only and goes, and you feel that the suicide attempt is near lethal. Suicide attempts na ನಾವು ಡಿಫೈನ್ ಮಾಡ್ತೀವಿ, ಲೆಸ್ ಲೀಥಲ್, ಮೋರ್ ಲೀಥಲ್, ಮ್ಯಾಕ್ಸ್ ಲೀಥಲ್. ಅಂದ್ರೆ ಇನ್ ದ ಸೆನ್ಸ್ ದಟ್ ನಾನು ಸುಯಿಸೈಡ್ ಮಾಡಿ ಸಾಯ್ಬೇಕು ಅಂತ ಒಂದು ನಿದ್ದೆ ಗುಳಿಗೆ ತಗೊಂಡೆ ಅಂದ್ರೆ ಪ್ರಾಬಬ್ಲಿ ಇಟ್ಸ್ ನಾಟ್ ಅ ವೆರಿ ಲೀಥಲ್ ಸೀರಿಯಸ್ ಸುಯಿಸೈಡ್ ಅಟೆಂಪ್ಟ್. ಇಟ್ ಇಸ್ ಜಸ್ಟ್ ತುಂಬಾ ಇಂಪಲ್ಸಿವ್ ಆಗಿ, ನನ್ನ ಬಾಯ್ ಫ್ರೆಂಡ್ ಜಗಳ ಆಡ್ದ, ನನಗೆ ಸಾಯ್ಬೇಕು ಅನ್ಸ್ತು, ಒಂದು ನಿದ್ದೆ ಮಾತ್ರ ತಗೊಂಡೆ. ಎವ್ರಿ ಒನ್ ವಿತ್ ಸಮ್ ಅಮೌಂಟ್ ಆಫ್ ಕಾಮನ್ ಸೆನ್ಸ್ ವಿಲ್ ನೋ ದಟ್ ಒನ್ ನಿದ್ದೆ ಮಾತ್ರ ವೋಂಟ್ ಕಿಲ್. ಸೊ ಯು ಕ್ಯಾನ್ ಅಸೆಸ್. ಬಟ್ ಇಫ್ ದೇ ಸೇ, ಮನೇಲಿ ಯಾರು ಇಲ್ದಾಗ ಪ್ಲಾನ್ ಮಾಡಿ ಇಟ್ಕೊಂಡಿದೀನಿ, ನಾನ್ ದಾರ ತಂದು ಮನೇಲಿ ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟಿದೀನಿ ನೇಣು ಹಾಕೊಳಕ್ಕೆ ಅಂತ, ಯಾವಾಗ ಅವ್ರು ಹೋಗ್ತಾರೆ ಅಂತ ಗೊತ್ತು, ಆ ಟೈಮ್ ನಲ್ಲಿ ನಾನು ಟ್ರೈ ಮಾಡಿ, ದಿಸ್ ಇಸ್ ಕೈಂಡ್ ಆಫ್ ಅ ಸೀರಿಯಸ್ ಥಾಟ್. ಸೊ ಯು ಶುಡ್ ನೋ ಹೌ ಟು ಡಿಫ್ರೆನ್ಶಿಯೇಟ್, ಅಂಡ್ ಇಫ್ ಯು ಫೀಲ್ ಇಟ್ ಇಸ್ ಸೀರಿಯಸ್ ಇನಫ್, ಪ್ಲೀಸ್ ಬ್ರೀಚ್ ಕಾನ್ಫಿಡೆನ್ಸ್. Okay, once the child gets better, then maybe you will understand, or that child will understand why you did it and from where you were coming. But at that time, it is better to breach that confidence. Okay, very difficult discussion or situation. But all of you, if you are counseling or in the field of mental health care, you will face these situations. So therefore, I'm mentioning. Then exploring the past and present functioning. ಎಷ್ಟೋ ಜನ ಬರ್ತಾರೆ telling that ನನಗೆ ಚುರುಕಾಗ್ಬೇಕು, ನನ್ನ ಮಗಳು ಚೂರು ಚುರುಕಾಗ್ತಾ ಇಲ್ಲ, ಎಷ್ಟು ದಿನದಿಂದ ಹುಟ್ಟದಾಗಿಂದನೂ ಚುರುಕೆ ಇಲ್ಲ ಅವಳು. She has always been lazy. So if the past functioning and the current functioning are not different, andre your goals will be different. You can make her mildly better maybe. But if the person was very active and now has become lazy, then you have to start looking for reasons why and helping out with those reasons. This is the difference. Okay. Catharsis, diagnosing, catharsis. Catharsis is letting out, telling whatever comes to your mind. As I told you, venting session. So first ಒಂದು ಎರಡು ಸೆಷನ್ ಅವ್ರಿಗೆ ಮಾತಾಡಕ್ ಬಿಡಿ. ಬಟ್ ಎರಡನೇ ಸೆಷನ್ ಒಳಗೆ ನಿಮಗೊಂದು ಐಡಿಯಾ ಬಂದಿರ್ಬೇಕು, ನಾನು ಯಾವ ಡೈರೆಕ್ಷನ್ ಅಲ್ಲಿ ಇದನ್ನ ತಗೊಂಡು ಹೋಗ್ಬೇಕು ಅಂತ. ದೆನ್ ಯು ಸ್ಟಾರ್ಟ್ ಪುಟಿಂಗ್ ಇಟ್ ಇನ್ ಟು ಪ್ರಾಕ್ಟೀಸ್. Reinforcing positive behavior. They might have done one very small thing. Instead of saying that you didn't reach your goal, do better. Reinforce that positive goal. ನಾನು ಓದ್ಬೇಕು ಅನ್ಕೊಂಡಿದ್ದೆ, ಮೊಬೈಲಿಗೆ ಅಡಿಕ್ಷನ್ ಇದ್ದೆ, ಆದ್ರೆ ಓದಕ್ ಆಗ್ತಾ ಇಲ್ಲ. ಆದ್ರೆ ಈ ಒಂದು ವಾರದಲ್ಲಿ ಒಂದು ದಿನ ಕುತ್ಕೊಂಡು ಓದಿದ್ದೀನಿ ಮೇಡಮ್ ಮೊಬೈಲ್ ಬಿಟ್ಟು ಅಂದ್ರೆ, ಒಂದೇ ದಿನವಾ ಇಸ್ ನಾಟ್ ಅ ಗುಡ್ ಆನ್ಸರ್. ಒಂದ್ ದಿನಾನಾದ್ರೂ ಮಾಡಿದ್ಯಾ, ಈ ವಾರ 2 ಸಲ ಮಾಡಕ್ಕಾಗತ್ತಾ ನೋಡೋಣ, is a better answer for that. So it's better to have positive reinforcement than putting down whatever effort they have put, which means that next time they'll not tell that effort also. And so your counseling will go wrong. Confront inconsistency. ಒಂದೊಂದ್ಸಲ ಒಂದೊಂದ್ ತರ ಹೇಳ್ತಾರೆ. ಒಂದ್ಸಲ ಹೇಳ್ತಾರೆ ನನ್ನ ಅಪ್ಪ ನನ್ನ ಬೆಸ್ಟ್ ಫ್ರೆಂಡು, ಅಮ್ಮನ್ ನೋಡಿದ್ರೆ ಆಗಲ್ಲ. ಇನ್ನೊಂದ್ಸಲ ನನ್ನ ಗಂಡ ನನ್ನ ಬೆಸ್ಟ್ ಫ್ರೆಂಡು, ನಮ್ಮ ಅಮ್ಮ ತುಂಬಾ ವ್ಯತ್ಯಾಸ ಮಾಡ್ತಾ ಇದಾರೆ ನನ್ನ ಲೈಫಲ್ಲಿ. So they might have inconsistencies. So confront them, find out who it is that they trust and what they want. So you will end up with a better solution after counseling. Motivation is just a part of counseling, sir. Won't help. Motivation, unfortunately, doesn't have sustaining power. Now, will power anta yen ಹೇಳ್ತೀವಿ, that is only stretchable to a certain extent. It's like a rubber band. ಅದೇ ಸರ್, motivation is only a part of the deal. You can motivate. ನೀವು ಚೆನ್ನಾಗ್ ಆಗ್ತೀರಾ, ಹೆದರ್ಬೇಡಿ, I will teach you how to make some changes which can lead you there ಅಂತ. But ಬರೀ motivation won't help. Consistency will help. Positive reinforcement will help. Coming back to you when they have failed in doing that. Most commonly happens with weight loss. ನನಗೆ ಬಾಡಿ ಇಮೇಜ್ ಇಶ್ಯೂಸ್ ಇದೆ, ನಾನು ತುಂಬಾ ದಪ್ಪ ಇದ್ದೀನಿ, ತುಂಬಾ ಗಿಡ್ಡ ಇದ್ದೀನಿ, ಚೆನ್ನಾಗಿಲ್ಲ, ನನಗೆ ಬೇಕಾಗಿರೋ ಬಟ್ಟೆ ಹಾಕೊಳಕ್ ಆಗ್ತಾ ಇಲ್ಲ. So I am very upset. So a goal of your counseling would be some amount of weight loss also. ಕರೆಕ್ಟ್ ಅಲ್ವಾ? ಅವ್ರಿಗೆ ನಂಗೆ ಈ ಸೈಜ್ ಅಲ್ಲಿ ಫಿಟ್ ಆಗ್ಬೇಕಂತಾನೆ ಬರ್ಬೋದು, ಸ್ಟ್ರೆಸ್ ಆಗ್ತಾ ಇದೆ, ಬೇಜಾರಾಗ್ತಾ ಇದೆ ಅಂತ. ಸೊ ದೆನ್ ಮೋಟಿವೇಶನ್ ಟು ಹೆಲ್ಪ್ ಎಕ್ಸರ್ಸೈಸ್. ಬರೀ ಕೌನ್ಸಿಲಿಂಗ್ ಇಸ್ ನಾಟ್ ಗೋನ್ ಟು ಸಾಲ್ವ್ ಎನಿಥಿಂಗ್. ನೀವು ಚೆನ್ನಾಗಿ ಕಾಣ್ತಿದ್ದೀರಾ ಅಂತ ಬಾಡಿ ಇಮೇಜ್ ಇಶ್ಯೂಸ್ ಅಲ್ಲಿ ಹೇಳಿ ಕಳಿಸ್ಬೋದು, ಬಟ್ ವಾಟ್ ಎಲ್ಸ್? We can try and tell them that you have other qualities which are very good, which are not there in others. So be happy with them. You can tell them. But if the person's goal is that I need to fit into a size something dress, then weight loss becomes one part of your counseling. ಈಗ weight loss ಮಾಡೋದಕ್ಕೆ ನೀವು ಹೇಳಿ ಕಳಿಸಿರ್ತೀರಾ, ಇಷ್ಟು ವಾಕ್ ಮಾಡಿ, ಇಷ್ಟು ಊಟದಲ್ಲಿ ಡಯಟ್ ಮಾಡಿ ಅಂತ. They might not do. 4 ದಿನ ಫುಲ್ ಎಂಥೂಸಿಯಾಸಮ್ ಅಲ್ಲಿ ಮಾಡ್ತಾರೆ. We all know that gym memberships are taken only at the beginning of the year. ಯಾಕೆ ಅಂದ್ರೆ ನ್ಯೂ ಇಯರ್ ರೆಸಲ್ಯೂಷನ್, ನಾನು ಈ ವರ್ಷ 10 kg ಇಳಿಬೇಕು, 4ನೇ ದಿನಕ್ಕೆ ಹೊಚ್ಕೊಂಡು ಮಲ್ಕೊಂಡಿರ್ತೀವಿ. None of us go. And all those gym membership go for a toss. So they make maximum money in the month of January, apparently. So this is how we are. So only motivation won't help. Your job is motivate, maintain consistency, see inconsistencies, confront them, and make them come back to their goal. Motivation is one part, starting. Yes. So you should motivate, sir. Again, this is a very good example that you're asking. How I would handle this case is, ಆ ಮಗುಗೆ ಯಾಕೆ ಫೇಲ್ ಆಗ್ತಿದೆ ಅಂತ ಕಂಡುಹಿಡಿಯೋದು ನನ್ನ ಫಸ್ಟ್ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ. ಇಸ್ ಇಟ್ ಬಿಕಾಸ್ ಮನೆಯಲ್ಲಿ ಓದ್ದವರೇ ಇಲ್ಲ ಅದಕ್ಕೆ ಓದ್ಸಕ್ ಕಷ್ಟ ಆಗ್ತಿದೆಯೋ, ಅಥವಾ ನಾನು ಮೊಬೈಲ್ ಜೊತೆಗೆ ತುಂಬಾ ಟೈಮ್ ಸ್ಪೆಂಡ್ ಮಾಡಿ ಓದಕ್ ಆಗ್ತಿಲ್ವೋ, ಅಥವಾ ನನ್ನ IQ-ನೇ ಕಡಿಮೆ ಇದೆಯೋ? All the three have different solutions. If nobody literate is there, I might suggest that you join tuition. If I am using much time with the mobile, I might suggest alternative activities to that. And if my IQ is less, I cannot motivate him until I will make you get 100%. So we should tell them, yes, ಈಗಿಂತ ಬೆಟರ್ ಮಾಡೋಣ, ಎಲ್ಲೆಲ್ಲಿ ವೀಕ್ನೆಸ್ ಇದೆ ಅಂತ ನೋಡಿ ಯಾವ್ಯಾವ್ದನ್ನ ಕರೆಕ್ಟ್ ಮಾಡಕ್ಕಾಗತ್ತೆ, we can help you out. And that will definitely get it better. ಹಂಗೆ. So motivate, but only motivation without groundwork is not going to. Yes. I know, sir. That happens. We see this every day. But until the child understands the reason behind why he or she is failing, how can you help, sir, in counseling? So your counseling process will be first understanding the problem which you have, motivating the child by which you say, let's see, we will find out. This is where God complex should not come. ಆಯ್ತು ನೀನ್ ಏನ್ ಚಿಂತೆ ಮಾಡ್ಬೇಡ, ನೀನ್ ಸಾಯರ್ ಏನ್ ಬೇಕಾಗಿಲ್ಲ, ನಾನು ಎಲ್ಲ ಸರಿ ಮಾಡಿ ಕೊಡ್ತೀನಿ ಅಂದ್ರೆ ಯು ಡೋಂಟ್ ನೋ ನಿಮ್ಗೆ ಏನ್ ಸರಿ ಮಾಡ್ಬೇಕು. ಯು ಆರ್ ಇನ್ ಬಿಗ್ ಟ್ರಬಲ್. ಇಫ್ ದ ಚೈಲ್ಡ್ ಗೆಟ್ಸ್ 10 marks, then come and blame you. ಅರ್ಥ ಆಯ್ತಲ್ಲ? So you should know. Second thing is we'll try and find out why you are not doing well. Third thing is the diagnosis. You'll have to diagnose why it is not doing well. Fourth is explain to the child. We have found out this. Do you think it is correct what I have found out? Child will say yes or no. Based on that yes or no, then you decide, okay, ಇದು ನಿಂಗೂ ಅರ್ಥ ಆಗಿದೆಯಲ್ಲ, like in your case. Then when we talk, we see the IQ, say suppose IQ ಕಡಿಮೆ ಇದೆ. ಅವಾಗ ನಾನು ಅವ್ರ ಮಗು ಕೇಳ್ತೀನಿ, ನಿಂಗೆ ಚಿಕ್ಕ ವಯಸ್ಸಿಂದನೂ ಮ್ಯಾಥ್ಸ್ ಸೈನ್ಸ್ ಸ್ವಲ್ಪ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ. ಹೌದು, ಹೊಸ ಭಾಷೆ ಕಲಿಯೋದು ಕಷ್ಟ, ಮ್ಯಾಥ್ಸ್ ಕಷ್ಟ, ಸೈನ್ಸ್ ಕಷ್ಟ. ಸೊ ಅದನ್ನ ಹೆಂಗ್ ಸರಿ ಮಾಡ್ಕೊಳ್ಳೋದು? ವಿ ಮೇಕ್ ದ ಚೈಲ್ಡ್ ರೀಡ್, ರೈಟ್. ಗೊತ್ತಾಗತ್ತೆ ಒಂದು ಅಂದಾಜಿನಲ್ಲಿ 9ನೇ ಕ್ಲಾಸಿಗೆ ಬಂದಿದೆ ಅಥವಾ 10ನೇ ಕ್ಲಾಸಿಗೆ ಬಂದಿದೆ, ಈ ವರ್ಷದ ಎಂಡಿಗೆ ಬೋರ್ಡ್ ಎಕ್ಸಾಮ್ ಇದೆ, ಬಟ್ ಕೂಡೋದು ಕಳಿಯೋದು ಬರ್ತಾ ಇರಲ್ಲ. ಸೊ ದೆನ್ ವಿ ಹ್ಯಾವ್ ಟು ಮೇಕ್ ದ ಚೈಲ್ಡ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದಟ್ ಓಕೆ, ಈಗ ನೀನ್ 4 ತಿಂಗಳು ಹಿಂದೆ ಬಂದಿದ್ಯಾ, ನಾನು ಇಷ್ಟು ಮಾಡಿ ಕೊಡ್ತೀನಿ, ಇಷ್ಟು ನಿನಗೆ ಹೆಂಗ್ ಹೇಳ್ಕೊಡೋದು ಹೇಳ್ತೀನಿ, ಯಾವ ತರ ನೀನ್ ಓದ್ಬೇಕು ಹೇಳ್ತೀಯ. ನಾನು ಈಗ್ಲೇ ಐ ಕಾಂಟ್ ಪ್ರಾಮಿಸ್ ಯು ದ ಸ್ಟಾರ್ಸ್. 4 months ಬಿಫೋರ್ ಬೋರ್ಡ್ ಎಕ್ಸಾಮ್ ಯು ಕಮ್, ಯು ಡೋಂಟ್ ನೋ ಅಡಿಷನ್ ಸಬ್ಟ್ರಾಕ್ಷನ್. ಸೊ ಹೌ ಕ್ಯಾನ್ ಐ ಹೆಲ್ಪ್ ಯು ಕ್ಲಾಸ್ 10? ಸೊ ಲೆಟ್ಸ್ ಸಿ ಇಫ್ ಯು ಕ್ಯಾನ್ ಇಂಪ್ರೂವ್. 1 round ಕೊಟ್ಟು ನೋಡು. But if you are not doing well, don't feel bad. There is one more supplementary. We can give more time. And if the child is okay with it, go ahead. Child might say, no, nange ಈಗಲೇ ಸರಿ ಹೋಗ್ಬೇಕು, ನಂಗೆ ನೀವು ಬೇಡವೇ ಬೇಡ. Completely okay, because you have given the right picture. It's again the counselor's choice. You can't put that choice. ನಾನು ಮಾಡೇ ಕೊಡ್ತೀನಿ ನೀವು ಕೂರಿ ಅಂದ್ರೆ, they will take you to task. They will come back and tell. Like we had one case like this, where this child had gone to a teacher and told, ನನಗೆ ತುಂಬಾ ಕಷ್ಟ ಆಗ್ತಾ ಇದೆ ಅಪ್ಪ ಅಮ್ಮ, ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರು ನನ್ನ ಹತ್ರ ಬಾ ಅಂತ. Next 6 months the child went to the teacher to ask money. Child didn't know what to do. Teacher didn't know what. ನಂಗೆ ಬ್ಯಾಗ್ ಕೊಡಿಸ್ಬೇಕು ಅಂತ ಆಸೆ ಆಗ್ತಾ ಇದೆ, ನಂಗೆ ಬ್ಯಾಗಿಗೆ ಚೂರು ದುಡ್ಡು ಕೊಡ್ತೀರಾ, ನನಗೆ ಹೊರಗೆ ಸಿನಿಮಾ ನೋಡಕ್ ನಮ್ಮ ಅಪ್ಪ ದುಡ್ಡು ಕೊಡ್ತಾ ಇಲ್ಲ, ಸ್ವಲ್ಪ ದುಡ್ಡು ಕೊಡ್ತಾರೆ. Teacher was in trouble. They didn't know how to handle this situation. So such things happen. So never promise the world. Be as honest and as understanding as you can. They take that help, great. Don't take that help. Allow it to be. Tell the child that it would be great if you take help. Find a place. They'll usually go and come back. ನೀವು ಕರೆಕ್ಟ್ ಆಗಿ ಹೇಳ್ತಿದ್ದೀರಾ ಅಂತ ಗೊತ್ತಾದ್ರೆ ಫಸ್ಟ್ ಎಕ್ಸೆಪ್ಟ್ ಮಾಡಲ್ಲ. ನನ್ನ ಐಕ್ಯೂ ಕಡಿಮೆ ಹೆಂಗೆ, ನಾನ್ ಚೆನ್ನಾಗಿ, ಪೇರೆಂಟ್ಸ್ ಮೇನ್ಲಿ, ಮಗು ಅಲ್ಲ. ನನ್ ಮಗು ಇಷ್ಟೇನ ತನಕ ಚೆನ್ನಾಗಿ ಓದ್ತಾ ಇತ್ತು, ಈಗಲೇ ಸರಿ ಇಲ್ಲ, ಟೀಚರ್ ಸರಿ ಇಲ್ಲ, ಮಾರ್ಕಿಂಗ್ ಸರಿ ಇಲ್ಲ. They will tell. They'll go back 2 months down the line. They'll realize what you have said is right. Come back. That is a better way. Then everybody will be open. Counseling will be more successful. ಇಲ್ಲ ಅಂದ್ರೆ this is a major problem with parents. I think she can reiterate. ಅವ್ರ ಕೌನ್ಸಿಲರ್ಸ್ ಅಂತ ಸ್ಕೂಲ್ ನಲ್ಲಿ ಮಾಡಿರ್ತಾರೆ, ಮಗುಗ್ ತೊಂದರೆ ಇದೆ ಅಂತ ಕೌನ್ಸಿಲರ್ ಪೇರೆಂಟಿಗೆ ಹೇಳಿದ್ರೆ ಕೌನ್ಸಿಲರ್ ಮೇಲೆ ಉಲ್ಟಾ ಮಾಡ್ತಾರೆ. ಯು ಆರ್ ಸಿಂಪ್ಲಿ ನೇಮಿಂಗ್ ಅವರ್ ಚೈಲ್ಡ್, ಲೇಬ್ಲಿಂಗ್ ಅವರ್ ಚೈಲ್ಡ್. ಚೆನ್ನಾಗಿರೋ ಮಗು, ನಿಮ್ ಟೀಚರ್ಸ್ ಚೆನ್ನಾಗಿಲ್ದಿದ್ರು ನನ್ ಮಗು ಮೇಲೆ ಹಾಕ್ತಾ ಇದೀರಾ, ನೀವು ಕರೆಕ್ಟ್ ಆಗಿ ಪಾಠನೇ ಹೇಳ್ಕೊಡ್ತಾ ಇಲ್ಲ, ಮಗುಗ್ ಹೆಂಗ್ ಬರತ್ತೆ, ಹಿಂಗೆಲ್ಲ ಮಾತಾಡ್ತಾರೆ. ಬಟ್ ಇಫ್ ಯು ಆರ್ ಕನ್ಸಿಸ್ಟೆಂಟ್ ಅಂಡ್ ಇಫ್ ಯು ಆರ್ ಕರೆಕ್ಟ್, 2 months ಡೌನ್ ದ ಲೈನ್ ಅವ್ರಿಗೂ ಗೊತ್ತಿರುತ್ತೆ ಒಳಗೆ ಹಂಗಾಗಿದೆ ಅಂತ. ಕಮ್ ಬ್ಯಾಕ್. Yes, it should be, sir. If the IQ is less or if there is a problem you cannot solve, please escalate. It would be better. ಯಾಕಂದ್ರೆ IQ ಟೆಸ್ಟಿಂಗ್ ಎಲ್ಲ ನೀವು ಮಾಡಕ್ ಆಗಲ್ಲ. It should be done by a clinical psychologist. ಅವ್ರು ಮಾಡಿ you can refer. Go to the clinical psychologist, get your IQ done and come. Then I'll know better why you're failing. So the psychologist will see learning disability ಇದೆಯಾ, IQ ಕಡಿಮೆ ಇದೆಯಾ ನೋಡಿ ಅವ್ರು ಹೇಳಿ ಕಳಿಸ್ತಾರೆ. Then you take it ahead. ಏನು ಇಲ್ಲ ನಾರ್ಮಲ್ ಇದೆ ಅಂದ್ರೆ ನೀವು ಹ್ಯಾಂಡಲ್ ಮಾಡಿ, ಇಲ್ಲ ತೊಂದರೆ ತುಂಬಾ ಇದೆ ಅಂದ್ರೆ ಎಸ್ಕಲೇಟ್ ಮಾಡಿ ಸೈಕಾಟ್ರಿಸ್ಟ್. That would be a better option. And more important, challenge in the irrational assumption, finding unconscious motives a lot of times. Unconscious motives. ನಂಗೆ ತುಂಬಾ ಬೇಜಾರಾಗತ್ತೆ, ನನ್ ಗಂಡ ನನಗ್ ಬೈತಾರೆ, ನನ್ ಗಂಡ ನನಗ್ ಹೊಡಿತಾರೆ ಅಂತ ಹೇಳ್ತಾ ಇರ್ತಾರೆ. ಆಯ್ತು, ನೀವ್ ಇದನ್ನ ಸರಿ ಮಾಡ್ಕೊಳ್ಳಿ, ಅವ್ರನ್ನ ಕರ್ಕೊಂಡ್ ಬನ್ನಿ. ಇಲ್ಲ ಅವ್ರು ಬರೋದೇ ಇಲ್ಲ, ಅವ್ರು ಕೇಳದೇ ಇಲ್ಲ ಅಂತ ಹೇಳ್ತಾರೆ. There might be an unconscious motive. That person is getting lot of relief talking to you, feeling very nice. ಅವ್ರ ಕರ್ಕರೆಗಳನ್ನೆಲ್ಲ ನಿಮ್ ತಲೆ ಮೇಲೆ, it's basically a gossip session. Husband will be willing to come, this person will not be agreeing to get. ಹಿಂಗೂ ಎಷ್ಟೋ ಸಲ ಇರುತ್ತೆ. There will be unconscious motive. ಅವ್ರಿಗೂ ಅರ್ಥ ಆಗಿರಲ್ಲ. ಬಟ್ ನಾನ್ ಕೌನ್ಸಿಲರ್ ಹತ್ರ ಹೋಗಿ ಬಂದ್ರೆ ಚೆನ್ನಾಗಾಯ್ತು, next 1 week I can fight very well and come back to tell about that fight. This will be the unconscious motive. So you have to slowly understand those and then start working on them. Encourage responsibility taking. A lot of times they will have multiple complaints on others. and they will take you along with it. ವೇವ್ ತರ ಅದು. ಹೇಳಿ 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 ಅವ್ರ ಅಪ್ಪ ಅಮ್ಮ ಗಂಡ ಮಕ್ಕಳನ್ನ ನೋಡಿಲ್ದಿದ್ರು ನಿಮಗೆ ಅವ್ರ ಬಗ್ಗೆ ಹೇಟ್ರೇಡ್ ಬಂದ್ಬಿಡತ್ತೆ. I hate that person. Her husband is such a bad. You not even met him. You don't know who he is, but you'll already start hating him. ಅಷ್ಟು ಚೆನ್ನಾಗಿ ಕತೆ ಹೇಳ್ತಾರೆ. But until you listen to the other end of the story, do not make judgments. And encourage responsibility taking. If that person tells nan ganda counseling ಗೆ ಬರಲ್ಲ ಅಂದ್ರೆ, no point listening to her story for hours on end. Ask, what is your take on this and how do you want me to help you? Your husband is not coming. You are coming for counseling. What is it that you want me to do? ನನಗೆ ಹೇಳಿದ್ರೆ ಸಮಾಧಾನ ಆಗತ್ತೆ, ಹೇಳ್ಕೊಂಡು ಹೋಗ್ತೀನಿ ಅಂದ್ರೆ ಅಷ್ಟೇ ಸಾಕು, ನೀವು ಸಾಲ್ವ್ ಮಾಡೋದೇ ಬೇಡ. ಅವ್ರ ಗಂಟೆ ಬರ್ತಾರೆ, ಪೇ ಮಾಡ್ತಾರೆ, 1 ಗಂಟೆ ಹೇಳ್ತಾರೆ, ಹೋಗ್ತಾರೆ. ಶಿ is happy, you are happy. But if they say, help me solve this problem, then encourage responsibility taking. What are you going to do to make this better? Because otherwise it will only be complaint venting session. There'll be no end or beginning to it. ಹೋಗ್ತಾ ಹೋಗತ್ತೆ. ನಾನು ಆಮೇಲೆ after 5 years they'll go to your colleague and say, ನಾನು ಇವ್ರ ಹತ್ರ 5 ವರ್ಷದಿಂದ ಕೌನ್ಸಿಲಿಂಗ್ ಆಗ್ತಾ ಇದೆ, ಏನು ಸರಿನೇ ಹೋಗಿಲ್ಲ ಅಂತ. ಸರಿಯಾಗಿ ಹೋಗಿಲ್ಲ ಅಂದ್ರೆ no responsibility taking. And then that will continue for 5 years with you. Go to the next person. So this should not happen. You should encourage responsibility taking. Narrow down alternatives. ಇದು ಈ ಮೂರಲ್ಲಿ ಯಾವುದು ಅಂತ ಚಾಯ್ಸ್ ಮಾಡಿ. Multiple choices, again very difficult to decide for the patient. See which is the most logical option. Constructive feedback, as I told you, if they have done something good, tell nice. If they have done something not so good, try and see how you can make it better. Rather than saying that you've done something really bad, you are not a good person. Idu beda. Again, this happens a lot. We had a case where that person had masturbated and went and told in the confession box. He happened to be of the Christian faith. Confession box ali priest ಗೆ ಹೋಗಿ ನಾನು ಹಿಂಗ್ ಮಾಡ್ಬಿಟ್ಟೆ, ಇದು ಸಿನ್ ಅನ್ಸತ್ತೆ ಅಂತ ಏನೋ ಹೇಳಿದಾಗ, priest came down very heavily on him. You're doing a really bad thing. God will be very upset with you. ಹಿಂದಿನ ಕಾಲದಲ್ಲಾದ್ರೆ ಅದಕ್ಕೆ ಲ್ಯಾಶಸ್ ಬೀಳೋದು, ಈಗ ನೀನ್ ಇಷ್ಟು ಸಲ ಓದ್ಬೇಕು, ನೀನ್ ಹಿಂಗ್ ಮಾಡಿರೋದ್ರಿಂದ ಈ ತರ ತೊಂದ್ರೆ. This boy was a healthy 20-year-old with access to a phone where he can see very explicit content. Could not stop masturbating, but could not take away the guilt that it is a sin. Again, attempted suicide, but luckily wasn't successful, was brought to the hospital before that. So something like that can happen. So therefore, constructive feedback is very important. Facilitating independence is important, and know when to end. If it is going nowhere, you should know, or you have reached a solution, then you should know it should end. A lot of times we have counter transference. ಎಷ್ಟೋ ಜನ ಬಂದಿಲ್ಲ, ನಿಮ್ಮ ಹತ್ರ ಕೌನ್ಸಿಲಿಂಗ್ ತಗೊಂಡ್ಮೇಲೆ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಆಗ್ಬಿಟ್ವಿ, ನನ್ನ ಲೈಫೇ ಚೇಂಜ್ ಆಯ್ತು, and we feel nice listening to it, and so we continue. That also should not be happening. Okay, you should know whether you like the counseling session, that person likes the counseling session. This is the end. This was the goal. We'll terminate now. Maybe if you have another problem, then come back. Do not use me as an agony aunt and come every week and just pour out your problems and go. There should be a beginning, there should be an end, and then terminate. This also is equally important. Systematic problem solving model, as I told you, sir. What is the problem? What have you tried to make the problem better? Like in your case, ನಿಮ್ ಪ್ರಾಬ್ಲಮ್ ಫೇಲ್ ಆಗ್ತಾ ಇದೆಯಾ, ನೀನ್ ಫೇಲ್ ಆಗದ್ ಸರಿ ಮಾಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ನಿನ್ ಕೈಲಿ ಏನೇನ್ ಮಾಡ್ಕೊಂಡಿದ್ಯಾ, ವಾಟ್ ಆಲ್ ಹ್ಯಾವ್ ಯು ಡನ್, ವಾಟ್ ಎಲ್ಸ್ ಡು ಯು ಥಿಂಕ್ ಯು ಕ್ಯಾನ್ ಡೂ ಟು ಮೇಕ್ ಇಟ್ ಬೆಟರ್? ಟ್ಯೂಷನಿಗೆ ಹೋಗ್ಲಾ, ಅಥವಾ ಸೀನಿಯರ್ ಹತ್ರ ಹೆಲ್ಪ್ ತಗೊಳ್ಳ, ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ವಿಡಿಯೋ ನೋಡಿ ಕಲೀಲಾ, ವಾಟ್ ಕ್ಯಾನ್ ಐ ಡೂ? ವಾಟ್ ಇಸ್ ಯೋರ್ ನೆಕ್ಸ್ಟ್ ಸ್ಟೆಪ್? ದೆನ್ ಡಯಾಗ್ನೋಸಿಸ್ ಅಂಡ್ ಅಸೆಸ್ಮೆಂಟ್ ಬೇಸ್ಡ್ ಆನ್ ದ DSM ICD ಬೇಸಿಸ್ ಮೇಲೆ ಡಯಾಗ್ನೋಸ್ ಮಾಡಿ ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ. ದೆನ್ ಟೆಸ್ಟಿಂಗ್ ಮಾಡಿಸಿ. May or may not be part of individual counseling, the testing, but if it is necessary, send the child for testing, get the answer, and then maybe formulate your course. This would be a better way. Common problem areas, I think I've explained most of it. People who come to you might have emotional problems, hostility, fear, anxiety, jealousy, adjustment issues, interpersonal issues, career issues, educational issues. What would I take? Like now I'm explaining most symptoms or most examples of child because I see a lot of child cases. Nanu YouTuber agbeku anta magu helta ide. Parents are feeling that this is not a good occupation. How will you solve this? They'll comment ella 10th class admele yaak odak hogbeku, I will become a YouTuber. I will make day in my life videos and make sure that likes are more, and YouTube pays me. Nanaka education yaak beku. I will invest in cryptocurrency. Parents won't know what cryptocurrencies ಏನಂತಾನೆ ಗೊತ್ತಿಲ್ಲ, ಏನೋ ಹೇಳ್ತಾ ಇದ್ದಾನೆ, ಕಾಲೇಜ್ ಮುಗಿಸ್ಕೊಂಡು ಮಾಡು ಅಂದ್ರೆ ಈಗಲೇ ನಾನು ಅದ್ರಲ್ಲಿ ದುಡಿತಾ ಇದ್ದೀನಿ, ಅಲ್ಲಿ ತನಕ ಯಾಕೆ ಕಾಯ್ಬೇಕು ಕೇಳ್ತಾನೆ. So such things will come. So you should be more aware of what is happening in that world so that you can counsel or know or tell them better. Social skill development, as I told you, social phobia ಇರ್ಬೋದು, ಅಥವಾ ನಾನು ಜನರ ಮಧ್ಯ ಹೇಗೆ assertive ಆಗಿ ಹೇಳಬೇಕು ಅನ್ನೋದು. In corporate scenarios, how to manage stress well, how to maintain your balance if people around you are toxic. So all of these situations, what do I do when I'm on the bench? Do nothing, do something. I've not been given any project. What do I do? All of these are problems which you need to report. Sexual problems, again, very sensitive issues. They will tell you only if they feel you are comfortable to talk to. ಮೇಲ್ ಫೀಮೇಲ್ ಹಿಂಗ್ ಏನೂ ಇಲ್ಲ. ನೀವ್ ಯಾವ ಕಂಫರ್ಟ್ ಲೆವೆಲ್ ಕೊಡ್ತೀರೋ ಅವರು ಓಪನ್ ಅಪ್ ಆಗ್ತಾರೆ. Okay, so that level of trust and acceptance you should give with both your verbal and non-verbal cues, which will be taught to you in micro skills of counseling. What you should do, how you should sit, ನಿಮ್ ಹುಬ್ಬು ಗಂಟಾಗಿರ್ಬೇಕಾ, ನೀವ್ ಎಷ್ಟು ಸ್ಮೈಲ್ ಮಾಡಬೇಕು, when you are smiling, do your eyes crinkle or not? All of this will affect what the counselor will tell you. That's small things but very important things. ನೀವು ಕೈ ಕಟ್ಕೊಂಡು ಕೂತಿದ್ದೀರಾ, ಆರಾಮಾಗಿ ಕೂತಿದ್ದೀರಾ, or like say you're talking to the counselee, a phone comes, ಆಯ್ತಾಯ್ತು 5 ನಿಮಿಷದಲ್ಲಿ ಮಾಡ್ತೀನಿ ಅಂದ್ರೆ counselee knows 5 ನಿಮಿಷದಲ್ಲಿ ನಾನು ಬಾಯಿ ಮುಚ್ಚಬೇಕು ಅಂತ. So they will stop there only, they'll not tell their problem. They'll think, oh, it's not so important for this counselor, so I will not tell. So all these small things make a huge difference to what your counseling session. That is the quality, what you can bring. Theories you will learn, so I will not go into more detail. These are the basic theories. There are multiple third wave theories which have come. All of them are very important. These are the basics which you will be learning in your self-instruction material and over the next few days. Scope of counseling in all these places. You are a group of people who can function anywhere. Psychiatrist ಗೆ ಒಂದು ಕ್ಲಿನಿಕ್ ಬೇಕು, ಕ್ಲಿನಿಕಲ್ ಸೈಕಾಲಜಿಸ್ಟ್ ಗೆ ಅವ್ರದೇ ಆದಂತಹ ಒಂದು ಸೆಟಪ್ ಬೇಕು, ಅಥವಾ ಜನರಲ್ ಹಾಸ್ಪಿಟಲ್ ಬೇಕು. ನೀವು ಎಲ್ಲಿ ಬೇಕಾದ್ರೂ ಕೆಲಸ ಮಾಡಬಹುದು. You can work in clinical setup, you can work in educational institute, work in medical. ಸಿಂಪಲ್ ಆಗಿ ಹೇಳ್ತೀನಿ, ಕ್ಲಿನಿಕಲ್ ಸೆಟಪ್ ಅಲ್ಲಿ ಸರ್ಜರಿ ಆಗಕ್ ಮುಂಚೆ ಕೌನ್ಸಿಲಿಂಗ್ ಬೇಕು. ಅದ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಏನಾಗುತ್ತೆ, ಸೈಡ್ ಎಫೆಕ್ಟ್ ಏನಿದೆ, ನಾನು ಸತ್ತೇ ಹೋಗ್ಬಿಡ್ತೀನ, ನನಗೆ ಆತಂಕ ಜಾಸ್ತಿ, ನಮ್ ರಿಲೇಟಿವ್ ಮಾಡಿಸ್ಕೊಂಡ್ರು ಅವ್ರು ಸತ್ತು ಹೋಗ್ಬಿಟ್ರು, ಅವ್ರು ಸರಿನೇ ಆಗಿಲ್ಲ, ಕೌನ್ಸಿಲಿಂಗ್ ಇಸ್ ರಿಕ್ವೈರ್ಡ್. ಪೋಸ್ಟ್ ಸರ್ಜರಿ, ನಾನು ಎಷ್ಟು ದಿನದಲ್ಲಿ ವೇಟ್ ಬೇರ್ ಮಾಡಬೇಕು, ಎಷ್ಟು ದಿನದಲ್ಲಿ ನಡಿಬೇಕು, ಸಚ್ ಅ ಸಿಂಪಲ್ ಥಿಂಗ್ ಬಟ್ ರಿಕ್ವೈರ್ಸ್ ಕೌನ್ಸಿಲಿಂಗ್. ಸೊ ಯು ಕ್ಯಾನ್ ವರ್ಕ್ ಇನ್ ದಟ್ ಫೀಲ್ಡ್. ಎಜುಕೇಶನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸ್, ಕೆರಿಯರ್ ಚಾಯ್ಸ್ ಮಾಡೋದು ಹೆಂಗೆ, ಮಕ್ಳಿಗೆ ಪ್ರಾಬ್ಲಮ್ಸ್ ಆದ್ರೆ ಹೆಂಗೆ, ರಿಲೇಶನ್ಶಿಪ್ ಇಶ್ಯೂಸ್ ಇದ್ರೆ ಹೆಂಗೆ, ಆಲ್ ಆಫ್ ದೀಸ್ ಯು ಕ್ಯಾನ್ ಹ್ಯಾಂಡಲ್. Medical colleges, medical setups where students or teachers might be in stress, where you might have to work and help. Organizational, as you already know, in corporate setup, a lot of stress, lot of substance dependence, lot of absenteeism, all of which is because of psychological distress. Menstrual leave in problems nadita idega. So all of those are problems that there you can handle. Correctional facilities like juvenile justice home, remand homes, prisons, okay, all destitute homes, beggars homes, ಅಲ್ಲೆಲ್ಲ ವರ್ಕ್ ಮಾಡಬಹುದು, so that you can help them reach their psychological balance. Family courts, very important, relationship issues na sort ಮಾಡೋದಕ್ಕೆ. In the community, raising awareness, telling them what mental illness is, and probably having your own social media profile, talking about problems so that more people reach out to you. Social media also has its benefits. So the more people talk, more people reach out to you, and so probably you can make a difference in their life. And rehabilitation setup, where ಸೈಕ್ಯಾಟ್ರಿಕ್ ಇಲ್ನೆಸ್ ಇರೋರು ಚೆನ್ನಾಗ್ ಆಗೋದಕ್ಕೆ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಮಾಡಿಸ್ಕೋತಾ ಇರ್ತಾರೆ. ಆರ್ ಸ್ಟ್ರೋಕ್ ಆದವರು ಅಥವಾ ಯಾವುದೇ ನ್ಯೂರೋ ಮಸ್ಕ್ಯುಲರ್ ಡೆಫಿಸಿಟ್ಸ್ ಇರೋರು ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಹೋದಾಗ ಫಿಸಿಯೋಥೆರಪಿ ಅಂಡ್ ಆಲ್ ಇಸ್ ವೆರಿ ಟಫ್ ಟು ಡು. ಕಾಲಿರಲ್ಲ, ಬಟ್ ಅವ್ರಿಗೆ ನೀವ್ ಹೇಳಿದಂಗೆ ಸರ್ ಅವಾಗ ಮೋಟಿವೇಶನ್ ಬೇಕಾಗತ್ತೆ, ನಿಮ್ಗೆ ಮಾಡಕ್ಕಾಗತ್ತೆ, ಮಾಡಿ, ಯಾಕೆ ಆಗ್ತಾ ಇಲ್ಲ ನೋಡೋಣ, ನಾನ್ ನಿಂತೀನಿ, ನಾನ್ ಮಾಡ್ಬೇಕು. ಸೊ ದಿಸ್ ಹೆಲ್ಪ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಇನ್ ದೋಸ್ ಪ್ಲೇಸಸ್. ಸೊ ಆಲ್ ದೀಸ್ ಏರಿಯಾಸ್ ಯು ಕ್ಯಾನ್ ವರ್ಕ್ ಇನ್, ಅಪಾರ್ಟ್ ಫ್ರಮ್ ಇಂಬೈಬಿಂಗ್ ಕೌನ್ಸಿಲಿಂಗ್ ಇನ್ ಟು ಯೋರ್ ಡೇ ಟು ಡೇ ಸ್ಕಿಲ್ ಸೆಟ್. ಸೊ ಮನೇಲೆ ಎಷ್ಟೋ ಪ್ರಾಬ್ಲಮ್ಸ್ ಎಷ್ಟೋ ಬೇಗ ಸಾಲ್ವ್ ಆಗುತ್ತೆ. ರಾದರ್ ದ್ಯಾನ್ ಈಗ ಸೇ ಅ ಟೀನೇಜ್ ಕಿಡ್, ನೀವು ಬನ್ನಿ ಊಟ ಮಾಡಕ್ಕೆ, ನಾನು ಆಮೇಲೆ ಮಾಡ್ತೀನಿ, ನಿಮ್ ಜೊತೆ ಮಾಡಲ್ಲ, ಇಷ್ಟೇ ಸಾಕು ಟ್ರಿಗರ್ ಆಗಕ್ಕೆ, ಸಿಟ್ ಬರೋದಕ್ಕೆ ಅಲ್ವಾ, ಅವ್ರಿಗೆ ಹೊಡೆದೇ ಬಿಡೋಣ ಅಂತ ಅನ್ಸುತ್ತೆ. ಬಟ್ ಇಫ್ ಯು ನೋ ದಟ್ ದಿಸ್ ಇಸ್ ನಾರ್ಮಲ್ ಟೀನೇಜ್ ಬಿಹೇವಿಯರ್, ನಾನಲ್ಲ, ಇಫ್ ದ ವರ್ಲ್ಡ್ಸ್ ಗ್ರೇಟೆಸ್ಟ್ ಮದರ್ ಅರ್ತ್ ವುಡ್ ಹ್ಯಾವ್ ಕಮ್ ಅಂಡ್ ಸೆಡ್ ದಿಸ್ ಆಲ್ಸೋ, ದ ಟೀನ್ ವುಡ್ ಹ್ಯಾವ್ ರಿಪ್ಲೈಡ್ ದ ಸೇಮ್ ವೇ. ಯು ಆರ್ ಇನ್ ಅ ಬೆಟರ್ ಪ್ಲೇಸ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ನೀವು ನೋಡಿ ಎಷ್ಟು ಸಲ ಹೇಳಿದ್ರು ಬರಲ್ಲ ಅಂತ ನೀವು ಅವ್ರ ಅಪ್ಪಂಗೆ ಕಂಪ್ಲೇಂಟ್ ಮಾಡಿ, ಅಪ್ಪ ಹೋಗಿ ಬೈದು ಹೊಡೆದು, ಊಟ ವಿಲ್ ಬಿಕಮ್ ಲೈಕ್ ಒನ್ ಬಿಗ್ ಡ್ರಾಮಾ. Nobody will eat happily, not the child, not you, not your husband. So this need not happen. If you understand yourself better, understand the opposite person better, lot of problems in our personal life also can be solved because of learning. Other related fields which you would have known but wouldn't have named are one, psychotherapy. Psychotherapy, as I told you, is done by clinical psychologists. You cannot do therapy. It requires a regular 2-year program to learn that, and you get niche in some few subjects. You can't do everything. Guidance, as we told, didactic ಆಗಿ ನಂಗೆ ಬಂದು ಕೇಳ್ತಾರೆ, ನೀನ್ ಮೆಡಿಸಿನ್ ಆದ್ಮೇಲೆ ಸೈಕ್ಯಾಟ್ರಿ ತಗೊಳ್ಳೋ ಬೇಡ, ಐ ವಿಲ್ ಗೈಡ್ ರಿಗಾರ್ಡಿಂಗ್ ವಾಟ್ ಆರ್ ದ ಪಾಸಿಟಿವ್ ಅಂಡ್ ನೆಗೆಟಿವ್ ಆಸ್ಪೆಕ್ಟ್ಸ್. ಅದ್ರಲ್ಲಿ ಪಾರ್ಟಿಸಿಪೇಟಿವ್ ಇಲ್ಲ, ನಂಗೆ ಏನ್ ಗೊತ್ತು ನಾನು ಅದು ನಿಮಗೆ ಹೇಳ್ಬಿಟ್ಬಿಡ್ತೀನಿ, ನೀವು ಬೇಕಾಗಿರೋದನ್ನ ತಗೊಳ್ಳೋದು, ಇಲ್ದಿರೋದನ್ನ ಬಿಡೋದು. ದಟ್ ಇಸ್ ಗೈಡೆನ್ಸ್. ಕ್ಲಿನಿಕಲ್ ಸೈಕಾಲಜಿ ಆರ್ ಪೀಪಲ್ ಹೂ ಡೂ ಸೈಕೋಥೆರಪಿ. Psychiatrists are people who do their MBBS, diagnose and treat major mental illnesses. Social work is the conditions which are linking these two are addressed in that. Types of counseling, individual ಮಾಡಬಹುದು, ಗ್ರೂಪ್ ಅಲ್ಲಿ ಮಾಡಬಹುದು. ಗ್ರೂಪ್ ಅಲ್ಲಿ ಕೌನ್ಸಿಲಿಂಗ್ ನೀವು ಯಾರಾದ್ರೂ ಕೇಳಿದೀರಾ? ಎಲ್ಲಿ ಮಾಡ್ತಾರೆ? ವೇರ್ ಇಸ್ ಇಟ್ ವೆರಿ ಎಫೆಕ್ಟಿವ್? Okay, then. Yes. Most importantly, where people do not want to be targeted. Substance dependence. ಅರ್ಥ ಆಗ್ತಿದೆಯಲ್ಲ, ನೀನ್ ಕುಡಿತಿದ್ಯಾ ಅಂತ ಹೇಳಿದ್ರೆ ಅವ್ರಿಗೆ ಏನೋ ಒಂಥರ ಗಿಲ್ಟೋ ಅಥವಾ ಏನೋ ಒಂಥರ ಕಾನ್ಶಿಯಸ್ ಆಗತ್ತೆ. 10 ಜನರಿಗೆ ಕೂರಿಸಿ ಕುಡಿಯೋದನ್ನ ಹೆಂಗೆ ತಪ್ಪಿಸ್ಬೇಕು ಅಥವಾ ಕುಡಿಯೋದ್ರಿಂದ ಆಗುವ ನಷ್ಟಗಳೇನು ಹೇಳಿದ್ರೆ ಎಕ್ಸೆಪ್ಟ್ ಮಾಡೋದು ಈಸಿ. ಆಲ್ಕೋಹಾಲಿಕ್ ಅನಾನಿಮಸ್ ಯು ವರ್ಡ್, ಸೊ ದಟ್ ಈಸ್ ಅ ಗ್ರೂಪ್ ಥೆರಪಿ ಸೆಷನ್ ವಿಚ್ ಇಸ್ ನಾಟ್ ಅಂದ್ರೆ ನಾಟ್ ಅ ಮೆಡಿಕಲಿ ಪ್ರೂವನ್ ಸೆಷನ್, ಬಟ್ ಇಟ್ಸ್ ಅ ವೆರಿ ಸಕ್ಸಸ್ಫುಲ್ ಒನ್, ಸೊ ವಿ ಹ್ಯಾವ್ ಟು ಆಕ್ಸೆಪ್ಟ್ ಇಟ್. ಅದೊಂದು ವೆನ್ ಯು ಆರ್ ಹ್ಯಾಂಡ್ಲಿಂಗ್ ಪೇರೆಂಟ್ಸ್ ಅಂಡ್ ಚಿಲ್ಡ್ರನ್ ಅಂತ ಟೈಮ್ನಲ್ಲೂ ಒಬ್ರಿಗೆ ಕದಿ ನೀನ್ ಚೆನ್ನಾಗಿ ಓದ್ತಿಲ್ಲ ನೀನೀಗ ಹೇಳ್ಕೊಡ್ತೀನಿ ಅನ್ನೋದಕ್ಕಿಂತ ಯಾರ್ಯಾರಿಗೆ ಚೆನ್ನಾಗಿ ಓದ್ತಿಲ್ಲೋ ನಾನ್ 4 ಟಿಪ್ಸ್ ಕೊಡ್ತೀನಿ ಇನ್ ಜನರಲ್ ಆಗಿ ಹೇಳಿದ್ರೆ ಅವ್ರು ಹೇಳ್ಕೊತಾರೆ. ಸೊ ಸಚ್ ಪ್ಲೇಸಸ್ ಗ್ರೂಪ್ ಕೌನ್ಸಿಲಿಂಗ್ ಸೆಷನ್ಸ್ ಆರ್ ಮೋರ್ ಹೆಲ್ಪ್ಫುಲ್, ವೇರ್ ದೇ ವಿಲ್ ಫೀಲ್ ದಟ್ ಐ ಆಮ್ ನಾಟ್ ದ ಓನ್ಲಿ ಒನ್, so many are there, so I will take that help and feel better. Such places group therapy sessions work very well. Couple counseling where relationship problems are there, and sometimes when problems with children exist, a lot of times they stem from the way couple interact with each other, so their couple counseling is advanced. Family counseling, a lot of times we do, because in the Indian scenario, one person is not that one person. Our ಸುತ್ತಮುತ್ತ ಇರೋರು ಅವ್ರು ಚೆನ್ನಾಗಿರೋದಕ್ಕೆ ಅಷ್ಟೇ ಇಂಪಾರ್ಟೆಂಟ್ ಇರ್ತಾರೆ. Say a person has got married and is not able to adjust in the husband's house, you will have to call a family session. ಬರೀ ಹುಡುಗಿಗೆ ಹೇಳಿ ಕಳಿಸಿದ್ರೆ ಸಾಲಲ್ಲ, ಅಪ್ಪ ಅಮ್ಮ ಅತ್ತೆ ಮಾವ ಗಂಡ, ಸೊ ದಟ್ ನನ್ ಕಷ್ಟ ಆಗ್ತಿದೆ ಅಂತ ಅವಳ ಅಪ್ಪ ಅಮ್ಮಂಗೆ ಫೋನ್ ಮಾಡಿದಾಗ ಅವ್ರು ಏನ್ ಹೇಳ್ಬೇಕು, or how they can help her. If she tells it to her in-laws, how they should react, how the husband should support her. If all of this is done only, then she will be successful in handling the situation. So at that time, family counseling sessions might be essential. And a lot of times, all of these are essential in one client. Elladu bekagatte. So that also is a possibility. A good counselor helps in setting goals, generation of responses, knows the worldview of what is happening, knows how to maintain confidentiality, again, knows his or her limitations, has interpersonal influence on the client, human dignity. We respect that counselor ಅನ್ನೋ ತರ ಅವರಿಗೆ ಫೀಲಿಂಗ್ ಬರಬೇಕು. ಅಪಾರ್ಟ್ ಫ್ರಮ್ ಬೀಯಿಂಗ್ ವೆರಿ like and sharing their most intimate problems with you ಜೊತೆಗೆ they should also know that we respect and trust this person. So that feeling that you should get. Human dignity should be there, a general theory and a listening mindset. As I told you, human dignity very important, especially when you're working in correctional places. Prison ನಲ್ಲಿ ಕೌನ್ಸಿಲಿಂಗ್ ಮಾಡಕ್ ಹೋಗಿರ್ತಾರೆ, ಅಲ್ಲಿ ಮಾಡಿರೋರು ಎಲ್ಲರೂ ತಪ್ಪು ಕೆಲಸ ಮಾಡೇ ಒಳಗ್ ಬಂದಿರೋರು. But you cannot judge them. If they say, I am missing my child, you should understand from the point of view of a father missing his child. Not, ನೀನ್ ಬೇರೆ ಯಾರನ್ನೋ ಕೊಲೆ ಮಾಡಿದ್ಯಾ ಆದ್ರೆ ನಿನ್ ಮಗು ಮಿಸ್ ಆಗ್ತಿದ್ಯಾ. This cannot be your attitude at all. So no judgment, and you should have dignity of other people's lives and their emotions. That only will help. Has to listen, identify, understand, clarify, accept and summarize, respond and act whenever necessary, as in the case of a suicidal threat. Basic difference between psychotherapy and counseling. Psychotherapy, or what clinical psychologists do, is for the psychiatrically ill population. Manasika kaile ide anta already gurtagide, ಅವರಿಗೆ ಸಹಾಯ ಮಾಡೋದಕ್ಕೆ psychotherapy. Counseling is for other normal population who have distress. Psychotherapy takes a fairly long time. ಮಾನಸಿಕ ಕಾಯಿಲೆಗಳನ್ನು ಸರಿ ಮಾಡ್ಕೊಳ್ಳೋದಲ್ಲದೆ ಅವರ ವ್ಯಕ್ತಿತ್ವವನ್ನು ಸುಧಾರಿಸ್ಕೋಬೇಕು ಅಂದ್ರೆ ಅದಕ್ಕೆ ಸಮಯ ಜಾಸ್ತಿ ಬೇಕಾಗುತ್ತೆ. ಕೌನ್ಸಿಲಿಂಗ್ ಇಸ್ ಲೈಕ್ ಇಮೋಷನಲ್ ಫಸ್ಟ್ ಏಡ್. ಲೈಕ್ ಈಗ ಸುಸೈಡ್ ಹೆಲ್ಪ್ ಲೈನ್ಸ್ ಅಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಿರಲ್ವಾ, ಫೋನ್ ಎತ್ತೀರಾ ಅವ್ರು ನಂಗೆ ಸುಸೈಡ್ ಮಾಡ್ಕೋಬೇಕು ಅಂತ, ವಿತ್ ಇನ್ ದ ನೆಕ್ಸ್ಟ್ 5 minutes you should diffuse that situation. After that, probably that person will never see your face. But those 5 minutes are like first aid for that person. He will not commit suicide, so you have done a successful thing. So it's an emotional first aid. Psychotherapy aims at changing the personality. Counseling aims to solve the problem at hand. When the next problem comes, another session. You're not aiming to change them fully. You're aiming to solve the problems. Okay. Psychotherapy needs a trained therapist in that particular area of psychology, like behavior therapy, cognitive behavior therapy, anta ಬೇರೆ therapies ನಲ್ಲಿ train ಆದವರು ಬೇಕು. Counseling needs a trained counselor who might be eclectic. Eclectic ಅಂದ್ರೆ ಎಲ್ಲಾದ್ನೂ ಹ್ಯಾಂಡಲ್ ಮಾಡಕ್ ನಿಮಗೆ ಫಸ್ಟ್ ಬರಬೇಕು, ಆಮೇಲೆ ನಿಮ್ಮ ಎಕ್ಸ್ಪರ್ಟೈಸ್. ಲೈಕ್ ಐ ಟೋಲ್ಡ್ ಯು, ಈಗ ಒಂದು ಕ್ಲೈಂಟಿಗೆ ಮನೆಯಲ್ಲಿ ಗಂಡನ ಜೊತೆ ಜಗಳ ಇದೆ, ನಿನ್ ಕಪಲು ಮಾಡಕ್ ಬರ್ಬೇಕು, ಇಂಡಿವಿಜುವಲ್ ಮಾಡಕ್ ಬರ್ಬೇಕು, ಆ ಮಗು ಜೊತೆ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂದ್ರೆ ಮಗುದು ಮಾಡಕ್ ಬರ್ಬೇಕು, ಎಲ್ಲರನ್ನೂ ಕೂರಿಸಿ ಮಾತಾಡಕ್ಕೂ ಬರ್ಬೇಕು. Family counseling also is essential, but your expertise is in one way. That is better. Psychotherapy area of work is confined to professional settings like hospitals. Counseling, the area of work is broader, as I've already explained. So these are basics of counseling. I think I've understood why counseling is essential, because you are a very important part of the mental health professional scenario. So please take your role as a counselor very seriously in your life. Learn to differentiate that you as a counselor and you as a person are very different people. And the how of counseling becomes very important, because if you have to be, self-satisfied, and the person who's sitting across to you has to be satisfied with your counseling sessions, depth of knowledge is very important. And why I'm stressing on this is a blended mode course. So you will not be doing counseling on an everyday basis that you will get expertise. So if you are planning to practice as a counselor, I would advise that you do internships. Madi madine baradidu. It's like a doctor. We practice. We are not perfect. Every patient is different. On every patient, we are practicing. So we should have that responsibility that what I do might change a person's life. And if you take that responsibility seriously, I think this is one place where, or one profession where there is zero boredom, because every day is new, fresh, and a new challenge. There is scope to learn, because as the society changes, there are new things which come up, which you would have not seen in the past. So always learning is a must. And you can never say, I've learned everything and I can be. Anta job e alla. And third thing is the personal satisfaction that it gives when you have done something good. A client praise ಮಾಡ್ತಾರೋ illo. But when you know that this was your goal and you have met your goal and the client is successful and happy without you, I think that gives so much personal satisfaction that you will never stop working in that. Burnout rates are very high for counselors, all mental health professionals. But still, people who are in that probably wouldn't do anything else, because the personal level of satisfaction is that high. So welcome again to the field of counseling. I hope all of you become very proficient, efficient, and satisfied counselors. And please do take care of your mental health also when you're on this journey. Thank you. Yes. Yeah. Which one, sir? Ah. All of them, sir. You can't place responsibility on one person. Even if one person had listened, maybe it would have been prevented. All could have. Village to raise a child. True. But the village should know counseling. ಇಲ್ಲಾಂದ್ರೆ ಆಗಲ್ಲ. Yes. But even if there is one person, it's a lifeline, ಅಲ್ಲ sir. ಎಲ್ಲರೂ ಇರಬೇಕು ಅನ್ನೋದು ನಮ್ಮ ಆಸೆನೆ. But at least one person idre, that will act like a lifeline. See, if you are drowning in the water, you wouldn't want 100 swimmers to come and save you. One swimmer is enough. That is most important, and that could be you. Yes. Therefore, sir, increase your tribe, enroll in bigger numbers to our course, and I think that will be possible. No, it is true, sir. Educational institutions ge sikta illa, sir. A lot of places don't have counselors even if they need one. I think according to the NEP element, that every educational institution should have a counselor anta ide. There are a lot of places, sir. You can do it in our setup. We'll give you a lot of resources. You can go and apply. So they have to. ಎಲ್ಲಿ ನಿಮ್ಮ ಊರ್ ಹತ್ರನೇ ಎಲ್ಲಿ ಮಾಡ್ಬೋದು ಅಂತಾನು ರಿಸೋರ್ಸಸ್ ಕೊಡ್ತೀವಿ. So that you at least a minimum of 1 month would be required, so that you see every kind. ಹಂಗೆ ಸೊ ಅಷ್ಟು ನಂಬರ್ ಆಫ್ ಅವರ್ಸ್ ಪ್ರಿಸ್ಕ್ರೈಬ್ ಮಾಡಿದ್ದಾರೆ. ಅದ್ರ ಪ್ರಕಾರ ನಿಮ್ ಹತ್ರ ಎಲ್ಲಿ ಅಂದ್ರೆ ವಿ ಶುಡ್ ಆಲ್ಸೋ ನೋ ದಟ್ ಪರ್ಸನ್ ಅಂಡ್ ದಟ್ ಪರ್ಸನ್ ಇಸ್ ಡೂಯಿಂಗ್ ಗುಡ್ ವರ್ಕ್ ಅಂದ್ರೆ ದೆನ್ ವಿ ಕ್ಯಾನ್ ರೆಫರ್ ದೆಮ್ ಟು. ಹಂಗ ಒಂದ್ ಲಿಸ್ಟ್ ಇದೆ ಮೇಡಮ್ ಹತ್ರ. ಐ ಥಿಂಕ್ ಶಿ ವಿಲ್ ಬಿ ಗಿವಿಂಗ್ ಇಟ್. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. ಎನಿ ಕ್ವೆಶನ್ಸ್ ಆರ್ ದರ್ ಐ ಕ್ಯಾನ್ ಟೇಕ್.
We will discuss that, madam. Discuss that, sir. Yes. Thank you so much, madam. I think it was like a signpost to understand where you have to travel, how to travel, what you will get during your traveling, or the journey of your learning for the next few months, 10 to 11 months, when you are with our Manasa Education Foundation for these courses. So thank you, madam. I felt that this is a real foundation for your learning, because you explained what is counseling, what are the theories and what is the knowledge required, what is the aptitude which should be strengthened, what are the skills required, with a lot of case examples too. So it was, definitely I feel that this is a framework which has given to the students, with which they will be able to develop themselves and commit themselves. Do you need a break of 5 minutes? Yes, please. Sorry for not giving big break. ನಾನು ಹ್ಯಾಂಡ್ ಮೈಕ್ ಅಲ್ಲಿ ಮಾತಾಡ್ಬೇಕಾಗ್ತದ ಅಂತ ಆಗತ್ತಾ? ಅಲ್ಲೇ ನಿಲ್ಬೇಕು. Orientation session. So the main idea is to discuss about the calendar of events of the academic year, as well as to discuss the tasks and the assignments, which are going to be very important part of the whole program. So each one of you belong to one or the other courses among our 5 different courses. They are all diploma courses and they are of 1 year duration. Now you must have received your study material. They are called self-instructional material. That itself means that they are for you to study and understand. So the orientation classes and the classes which we conduct or the assignments which you are doing are all like the supportive task for the self-instructional materials. So they are like guidelines. We do not go for exorbitant classes. ಈಗ ಡಿಟೇಲ್ ಆಗಿ ಪ್ರತಿ ಟಾಪಿಕ್ ಕ್ಲಾಸ್ ಅಲ್ಲಿ ಇರಲ್ಲ. ದೇ ಆರ್ ಲೈಕ್ ಗೈಡ್ಲೈನ್ಸ್. ಎಲ್ಲ ಕ್ಲಾಸ್ಗಳು ನಿಮಗೆ ಒಂಥರ ಗೈಡ್ಲೈನ್ ತರ ಇರುತ್ತೆ. ಬಿಕಾಸ್ ಆಲ್ ದ ಥಿಂಗ್ಸ್ ಆರ್ ಕವರ್ಡ್ ಇನ್ ದಿಸ್ ಸೆಲ್ಫ್ ಇನ್ಸ್ಟ್ರಕ್ಷನಲ್ ಮೆಟೀರಿಯಲ್. Each program have 4 theory papers and 2 practicals. So the study materials which you have received today are with 3 books. We have issued 3 books, each book containing 2 papers. The first book, that is regarding the common papers. They cover the 2 common papers, the first 2 papers. One is understanding human behavior and the second one is basics of counseling. All the 5 programs, 5 diploma programs have these 2 as the common paper. Okay. Then the next book which you must have received are according to your specialization. For example, if it is counseling and guidance, you must have received a book called Distortion of Cognition, Emotion and the Behavior as your 3rd paper, and Areas of Counseling as your 4th paper. If your course is Child and School Counseling, Foundation of Child Development is your 3rd paper, and Challenges of Childhood and Counseling is your 4th paper. If your course is Corporate Counseling, then Organizational Behavior is your 3rd paper. Organizational Challenges, HRM and Legal Issues is your 4th paper. If your course is NLP, that is Neuro-Linguistic Program, then Introduction to NLP is your 3rd paper. Then Advanced Concept and Techniques of NLP is your 4th paper. Then the Specific Learning Disability. If your course is Specific Learning Disability, Introduction to SLD and Classification of SLD is your 3rd paper. And Functional Assessment and Remediation is your 4th paper. Again, coming to your practicals. This book is for your practicals. This contains 2 papers of your practicals, because most of the things which you will be doing, administering, demonstrating, practicing, so the contents are less, but it contains 2 papers. Okay. So this is how the study materials which you must have received by now. Those who have not received, those who are online, will receive it by post or the courier. So we start that process from tomorrow onwards. Now let us start discussing about the tasks which you and we will be doing throughout the academic year. Sir? No, sir, definitely no. It was just an introduction. Next slide. This calendar of events is also published in our website. You must have gone through this. So the whole calendar is divided into several parts where you will have some classes of online, you will have few classes of offline, then you will do some practice, that is your practical tasks, then you will submit the assignment as a part of your internal assessment. You will also write a small test which is called internal assessment test. Then there will be a lot of workshops and training programs in between, either online or offline, which you will be participating. Some are very compulsory, some are not compulsory, but which will help you to enrich yourself, improve yourself, learn newer things, etc. Finally, the last part is your assessment, that is the examination. So this is how the calendar is divided. So our calendar, for the administration purpose, it starts from September, where we start our admission process. So it was started in September, then now the month is December, where we concluded our admission and we are starting the academic activities. So the whole academic year is considered as November to November. Okay, so from November onwards, the academic year started and it will be concluded with your results in hand in November. Okay, ಹೆದರ್ಕೋಬೇಡಿ, ರಿಸಲ್ಟ್ ಬರುತ್ತೆ ಅಂತ ಹೇಳೋದನ್ನ ಈಗ್ಲೇನೆ, ಬಟ್ ರಿಸಲ್ಟ್ ನಿಮ್ ಕೈಗೆ ಬರುವಲ್ಲಿಗೆ ನಿಮ್ಮ ಅಕಾಡೆಮಿಕ್ ಇಯರ್ ಕಂಪ್ಲೀಟ್ ಆಗುತ್ತೆ. ನಮ್ಮ ಜವಾಬ್ದಾರಿ ಕೂಡ ಮುಖ್ಯವಾಗಿ ಕನ್ಕ್ಲೂಡ್ ಆಗುವಂತದ್ದು when we give you the result of your examination. So the next one. Now we are with the sixth point, that is our orientation. Examination. Yes. Evaluation, sir. Evaluation. ಎಲ್ಲ ಇರತ್ತೆ, ಹೇಳ್ತೀನಿ. Yes. Theory, sir. Study centers ಗಳಲ್ಲಿ arrange ಮಾಡಿರ್ತೀವಿ, but offline only. It is a physical examination. Next, yes. So from next week and onwards, your online classes start. Each weekend for about 12 days. Okay, that is 6 weekends you will have your online classes. These dates are already announced in the website. You can just check there, and we will also share this PPT in the group so that you will have this. You need not note down. So in the online classes, all the basics to understand the whole of your study material, the resource person will help you. They are like classes. So each class is of 3 hours duration. Each day is of 3 hours duration. Okay, 3 ಗಂಟೆದು class ಇರುತ್ತೆ. It is completely online. So one of the resource person for one topic will address on that day. ಪ್ರತಿ ವಾರಕ್ಕೆ ಒಂದು ಟಾಪಿಕ್ ಮಾತ್ರ, ಲೈಕ್ ಒಂದು ದಿನಕ್ಕೆ ಒಂದು ಟಾಪಿಕ್ ಮಾತ್ರ. For example, your first topic for your study, the next Saturday will be on first paper. That is, actually, it is understanding human behavior. That paper covers all the basics of psychology. Okay, it is like introduction to psychology. So that is the first class, 21st ಇದೆ. And it will be followed with another class on the next day. That will be on basics of counseling. Okay, so hige each session will be with one topic and one resource person. Resource person is a person who is a teacher. Nimma teacher irtare. Okay, so the person who is an academician or the practitioner will teach you such topics. Yes, Kelly sir, please. Yeah, you will have recording session, but there is one thing, you will lose marks. Alla. So try to attend the class because it will fetch you few marks for your internal assessment. Attendance also carries marks. ಪ್ರತಿಯೊಂದು ಮಾರ್ಕ್ಸ್ ಒಂದಿಗೆ ಸರ್ ಇನ್ಮೇಲೆ ನಿಮಗೆ ಆಸೆ ತೋರಿಸಿನೇ ನಾವೆಲ್ಲ ಕೆಲಸ ಮಾಡಿಸ್ಕೊಳ್ಳೋದು. Yes. I will tell you. Just glance this. So with February 1st, all the classes will be concluded, the online theory classes. It will be followed by next. Point number 8, next slide. This is offline class, practical class. 2 days, the complete 2 days. Only once you will attend the practical class. It is for the whole day. Saturday ಇಡೀ ದಿನ ಇರುತ್ತೆ, Sunday ಇಡೀ ದಿನ ಇರುತ್ತೆ, 2 ದಿನದ ಒಂದು ಕ್ಲಾಸ್ ಇರುತ್ತೆ. That will be in different places. It will be conducted in Shimoga, once in Bangalore, once in February. So any one of them you can attend. Same class, same content, same topic, and most probably same resource person in all the 3 places. Anywhere you can attend. Next slide. Post practical class, your practical training will start. For this, you have to do it in any one of the setup. Like either you have to come to Manasa, or you can do it elsewhere, which is recognized center where they can train you. Okay, it can be a psychiatric setup or a counseling setup, but it is better if it is already chosen by us as a recognized center to train our students. Okay, so there you can do. Most of the times after the classes, you all will feel that it is better in Manasa, and most of the times all the students come here only, but it will be in batches. Batches of 10 will come for 3 days, complete your practicals and go back. That's how it is. So what is the benefit? What do you do there? I will tell you later. Batch wise. Yes, each batch maximum of 10, minimum of 5 will come. Yes, I can do that. I will do that. But most of the times during your practical class, you become friends to each other, make your own batch, select the date and come. That is how it happens, sir. Yes. Those who are not chosen, we will tell them, ee batchig banni anta helti. Yes, there will be some special workshops conducted, which may not be very compulsory, but we encourage students to attend. Along with you, others will also attend those workshops, like from outside some people, or our MSc students, or our alumni. They also attend such workshops. Next. So by July, all your assignment work will be over and you will be submitting in April, and it will be evaluated and displayed to you in the month of July. Now, the announcement of examination will happen in August. Then the hall ticket will be dispatched. Finally, exam orientation will be conducted through online. And finally, it is the examination. Theory followed by practicals. By October, you will get your results, and the marks card you will receive in the month of November. Earlier. Next. ಇನ್ನೊಂದು ಕಳಿಸ್ತೀವಿ, ಶೇರ್ ಮಾಡ್ತೀವಿ ಮೇಡಮ್, ಗ್ರೂಪ್ ಅಲ್ಲಿ PPT ಹಾಕ್ತೀವಿ. ಸರ್ ಅದು ಬರುತ್ತೆ. ಎಸ್ that is already published in the YouTube also. ಹಾಗಾಗಿ ಇಡೀ ಕ್ಲಾಸು ನಿಮಗೆ ಯೂಟ್ಯೂಬ್ ಅಲ್ಲಿ ಸಿಗತ್ತೆ. So little bit detail regarding the curriculum and the course pattern. As I told, you have 4 theory papers and 2 practicals. Each paper is of 100 marks. In the 100 marks, 40 is for your internal assessment and 60 for the final examination. Till last year, it was 20 for internal assessment and 80 for the examination. Sir is here, that is why I am telling. He did 1 course already. This is his 2nd course. So last year it was 20/80. Now it is 40/60. with the new Board of Studies regulation. Now it is 40, 60. For 40 marks, we included 10 marks for your class attendance per paper and 10 marks for your internal test, which we will be conducting during your offline class. Then 20 marks for the written assignments. What are these written assignments? I'll explain you later. So the total marks for theory papers is 100, 60 marks for the final examination. Hope it's clear. So 400 marks are for your theory papers. Now the practical marks. 100 marks per paper. There are 2 practical papers, so 100 marks per paper. In that, 20 for internal assessment, wherein you will come and do your practicals and submit the report on that. It will be evaluated. 20 marks per paper will be evaluated for your practical exposure and submission of the report of the same. Then the 20 plus 20 is for your internship. Okay. So till last year, there was no marks allotment for the internship because it was not inside the curriculum. After the post-examination, the students were doing their internship before getting their certificate. Now the new BOS has incorporated internship inside the curriculum and the marks is allotted and internship will also be evaluated at the end through Viva was. Okay. So it has become a part of your practicals now, internship. It is made mandatory, compulsory, because now it is called as a skill course and is recognized by the skill program. So internship is mandatory and compulsory within the curriculum. So this change you please understand. So 20 marks for the internship for each paper. So 15 days of internship will fetch you 40 marks, 20 for one paper, 20 for another paper. Okay. 3 days of practical exposure will fetch you and the submission of the report will fetch you 20 plus 20 marks. 20 for one paper, 20 for another paper. What will you do in that practical exposure? I'll explain you later. Now, next slide. As I explained, the course is a very special mode. So I cannot declare it as a distance education, but actually it is a distance education blended mode one. So it is a very special mode because it completely relies upon the 2 modes. One is self-study, another one is orientation or the training. So self-study is through your study of these books and the extra books also you can refer. Will guide you how to refer, what to refer. But mainly you will rely upon these notes. The second part, orientation and the training part, where we conduct classes and orient you. Class galanna ಮಾಡ್ತೀವಿ and training ಕೊಡ್ತೀವಿ. That is the second part. So this is called as blended mode. Some are online, some are offline. Next. So the self-study material is developed by the Board of Studies, which contained the academicians and the practitioners who are experts in the field. All academicians teaching at the university level, especially the subject of psychology and social work were in the board, and a few practitioners who were practicing psychiatry, mental health counseling, or social counseling, the therapy, holistic therapy, were there in the board. So they have developed this curriculum. Of course, it has been developed earlier. It was developed in 2003, revised each year. Once in 3 years, the curriculum used to be updated with the new contents, adding and deleting the old ones, unrelated ones, etc. And now it is the new one, very fresh one. You are the first batch to have this new curriculum from MSDC BOS. So congratulations. Yes. So attendance for the contact program is compulsory. Internal assessment of 40 marks is kept for the attendance. That is 10 marks per paper. Then a test of 40 marks will be held on the last day of the contact program. Then it will consist, that test, internal assessment test, will contain MCQs as well as one essay type question. Marks is also announced. There are two types of contact program. One is online, another one is offline. Contact program 1 is for theory topics. It is online. Your attendance is compulsory. Only any queries regarding the theory, practical assignment, date changes, and exams will be answered during the contact programs, online or offline, by the coordinator. That's me. Yes. So virtual mode, we generally share you the Google Meet link, either on the previous day or on the day itself. In the morning, you will find the Google Meet link in your WhatsApp group. You can just click it and join the class. Generally, our class starts at 10. By 1:45, you will be able to log in. Okay. Soon after 1:45, you will be able to log in, and the session generally starts in time. 2 o'clock it starts, and 5 o'clock it is completed. In between, there will generally, the resource person will give one small break. We suggest not to log out, because again login would be difficult, but keep yourself online. You can take the break. So 3 hours of session with the small break in between will start from next Saturday onwards. Yes. Contact program 2 is offline. The dates are already announced. Okay. So Bangalore, it will happen in February, that's 7th and 8th. And Mangalore, 14th and 15th. February 14th, Mariallala. Maritiri adre makkalige helitiri, avaru mariyalla. Then Shimoga, 21st and 22nd. These will be on the topics of your practical paper. We'll discuss with you about the case history taking, micro skills of counseling, and you have 9 psychological tests, paper pencil tests in your syllabus, and you will be trained in those 9 tests during your practical class. So please do not miss that. Now itself you can block the dates wherever you are attending. So all these dates are very, very compulsory. So make sure that you attend practical class at least in one place. You try to attend. If at all you have any difficulty in attending at one place, you have the chance to attend in another place. So one of the 3 places, please attend. ಇದೆಲ್ಲ ಮಿಸ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಪ್ರಾಕ್ಟಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಕಷ್ಟ ಆಗುತ್ತೆ, ಪ್ರಾಕ್ಟಿಕಲ್ ಟ್ರೈನಿಂಗ್ ಕಷ್ಟ ಆಗುತ್ತೆ. ಸೊ ದೇ ಆರ್ ದ ವೆರಿ ಬೇಸಿಕ್. ದಟ್ ಈಸ್ ವೈ ದ ಪ್ರಾಕ್ಟಿಕಲ್ಸ್ ಆರ್ ಮೇಡ್ ಆಫ್ಲೈನ್. So please attend that. ಈಗ್ಲೇನೆ ಬ್ಲಾಕ್ ಮಾಡಿ ಇಟ್ಕೊಳ್ಳಿ. Those dates are compulsory. If you are traveling from far place or outside the outside the state, please make sure that you are able to come to the practicals. So we have our library. Most of the contents are made available, like old question papers, then the reference books, some of the e-materials, recorded classes, PPTs will be made available through our website. So you can keep log into our website to get the materials or to get updated information, etc. Then the next slide. We will conduct specialization classes later after these online classes, either online or recorded classes. We will send to the specialized topics like specific learning disability. If any extra class is required, we will plan that and we will send it through recorded mode, or sometimes we conduct online. We also arrange through our psychology department some workshops, as I mentioned. So the dates will be announced. Few topics which we generally conduct the workshops are on mentioned here. Most of our correspondence will happen through email, and the WhatsApp communication. Sometimes like hall ticket dispatch, etc. will happen through post. So whenever you're changing your address, please, without forgetting, communicate to our office, either through your WhatsApp message and preferably through the email. meffmh@gmail.com is our email ID. So you please communicate through email so that it will be recorded and changed in our office data. For your contacts for any purpose, like any of the administrative things, official notifications, or the communication, etc., you can contact any one of us. Generally, for office purpose, you can contact Preeti, who is in charge of this program, who was here already and who took your registration. Lata madam will also be there at the office. And 9448288483 is our college office number, and the other one is exclusively for MEF. Then in our headquarters office, that is Manasa office, you find Jyoti madam and Pushpa madam. They are with the last number of 89. Then Sridevi madam, of course, now she is little busy because she has taken up her MPhil in clinical psychology. She was working as associate coordinator for these courses. That's why I mentioned her name. Few queries you can also ask her, few clarification you can also get from her. But for this academic year, she has joined our MPhil clinical psychology program. Then from library, we have our Ganesh with us. He could not come today. He is looking after the library and all the technical stuffs. Then you can call between 10 to 5:30. Of course, not very much keen on this. You can also text us or call us later too. You cannot borrow, sir. You can sit and study here. Yes, borrowing is not there for the distance program. Yes, sir. Your practical will start, your practical exposure will start after attending the offline class. That's a contact classes. So this is very compulsory to get exposure in dealing with the clients. They are your real practice. So you will talk to the real clients, take the information, put it in a specific format, submit the report, and all these things will be done under the supervision. And you will also discuss the case with the supervisor, qualified supervisor, that means a counselor or a psychologist at our hospital. And you will write the report and prepare the report, and that will be submitted. That's a very important part of your internal assessment of your practicals. At the same time, that is very much required to understand the skills, the attitudes, the mode of practicing counseling, etc. So please do not miss that. This is compulsory to write your examination also. Without this, you will not be permitted to write your examination. So plan yourself to get this exposure either at Manasa or elsewhere. So can be done elsewhere also, but when you're doing it elsewhere, you should see to it that it is a recognized center. That means it has enough cases for counseling with which they will be able to help you out. In the whole curriculum, in the whole program of this practicals, you will submit 16 reports, 16. So that much of caseload should be there in your practical training place. So if at all you're doing outside, you have to plan in such a way that that particular center gives you enough number of cases to learn. And there is a qualified person. Who is a qualified person? Either a psychiatrist or a psychologist or a counselor who can train you up, who knows how to train you up, and who has enough competency and knowledge to train you up. So you can rely elsewhere also. If you're coming here, already all our psychologists, counselors know how to train you and with what they have to train, all those things, and they know the curriculum. There will be a supervisor. There will be enough cases also. Caseload is very high at Manasa. We have our 100-bedded psychiatric hospital. We have a child guidance center, and we have a rehab center. In all these places, we will make you to get the cases and submit your report, whatever is expected or required. Okay. Yes. In Mangalore, is it? You can approach either Manaswini, Dr. Ravish Tunga's hospital, or Anirveda. Anirveda is our official study center, so you can go there. And now not in Kankanadi, now it is in Malikata, near Malikata. Yes, not in Malikata. That also addressed. I will give you the new address. Near Mangala Devi it is now. Mangala Devi. Internship also you can do there. If you're not coming here, you can do there. Yes. So this is about the practical training. So in the place where you do your practical, you can continue doing your internship also, or you can plan those 15 days some other time. For internship, we have two options, offline and online. Online internship is also accepted. Some organizations provide online internship. We are also planning for online option 2. We'll communicate that. If at all you have time and you have interest to come for offline, I suggest that you do offline internship. It's always better because you will be your learning level is more intense when it is offline, because you will be talking to the real patients and you will discuss with your supervisor then and there itself. So it is real intense learning if you do it offline. If you have difficulty, like if you have difficulty in getting leaves or going to a place is difficult, then you take the online one. Okay. So there are two choices. So your dates for the practical will be selected. But when you're coming to Manasa for your practical training, it is not on Sundays. Because you need the guide, no? They will have holidays on their Sundays. And the case load is also little lesser during Sundays. So we give the first 3 days of the week or the last 3 days of the week. So when you are choosing your dates for the practicals, you choose in such a way that you stay here for 3 days. The first 3 days or the next 3 days. Monday, Tuesday, Wednesday, or Thursday, Friday, Saturday. Okay. Bangalore, you can choose Pandana Nursing Home. They are aware about our courses and they give permission for our students. But when you are going elsewhere, like other institutions, they may ask you to pay the fee for their training. That you only have to bear. They may ask you to get a letter from us that we will provide you. Once you write to us, we will provide you the letter with which you can contact such places. Okay. But prefer coming here because this is your institution now. In the theory assignments, you will be writing down the essays. That means answers to the questions, but essay type of answers. We will circulate the questions soon, select the question, write the answers. But while writing, there are some conditions. One, select one topic from one unit. Generally, we provide 2 questions from each unit. What are these units? Units like chapters. Patagalu. Prati chapter idda hage. Each paper contains 4 units. Prati paper alli 4 units ide. Andre 4 chapters ide. So, you have to select one topic from one unit. So, per paper, you will be writing down 4 essays. 4 essay ಒಂದು paper ಇಂದ ಆಗುತ್ತೆ. For example, the first paper, Understanding Human Behavior, contains 4 units. ಅಲ್ಲಿಂದ ನೀವು 1 unit ಇಂದ 1, 2ನೇದು, 3ನೇದು, 4ನೇದು ಹೀಗೆ ಬರೀಬೇಕು. Okay. So each paper, from each theory paper, you will be writing down 4 essays, considering 1 essay from 1 unit. The purpose is to make you to study all the units. Okay, because each unit is very important. As this is a very, very small, brief notes, try to understand that it is a condensed form of the knowledge of psychology and counseling. So each unit is very significant and very important, not only from the point of view of your examination, but to become a counselor. Without this much information, you cannot become a counselor at all. Therefore, give importance for each unit of your study material. So the questions will be circulated. From that, you can select and write. While writing down, the second point, while writing down, make it more presentable. You can make it more good by attaching the pictures or the graphs, etc., according to your creativity and your interest. But writing minimum content is required. We expect minimum of 900 to 1000 words per answer. Okay. In ಸಣ್ಣ tips ಏನಂದ್ರೆ try writing down by your hand, not typewritten. Okay. Because for two reasons. One, our valuers also feel that it is good to value the written essays. ಇಲ್ಲಾಂದ್ರೆ ಡೌನ್ಲೋಡ್ ಮಾಡ್ಕೊಂಡ್ರು ಕಟ್ ಅಂಡ್ ಪೇಸ್ಟ್ ಮಾಡ್ಕೊಂಡ್ರು ಏನೇನೋ ಡೌಟ್ ಬಂದ್ಬಿಡತ್ತೆ ನಮ್ಮ ವ್ಯಾಲ್ಯೂಯರ್ಸ್ಗೆ. ಹಾಗಾಗಿ ರೈಟ್ ಡೌನ್. ಇನ್ನೊಂದು, ಆಫ್ಟರ್ ಆಲ್ ದಿಸ್ ಯು ವಿಲ್ ಅಟೆಂಡ್ 3 hours of examination. I know there was small gap now to write the exam, so you will pick up speed to write your examination, because examination handwritten only. Therefore, please write by hand. You should mention the reference at the end of unit or end of the paper. For example, understanding human behavior. All the 4 units covered. All the 4 essays are completed. Put the references which you did for preparing your answers. One guttide illi. Okay. Refer your study material. In chance you are not able to refer other books, there are references at the end of each paper. Mention that. 2, 3. ಅವರಿಗೆ ನೀವು ರೆಫರ್ ಮಾಡಿದಿರಿ ಅಂತ ಅನ್ಕೊಂಡು ಚಂದ ಮಾರ್ಕ್ಸ್ ಕೊಡ್ತಾರೆ. ಅದು ಗುಟ್ಟು. Yes. So, mention bibliography or the reference at the end of the essays of each paper. Okay. So, this is how you prepare your assignments. Book and the author, both. Book and the author name, both. Mention the book name or the article name. Mention the author name also. Yes. So, after writing all these essays, put it to one book form. So, there is no restriction that you have to write down in a white sheet or the rule sheet, something like that. According to your convenience, you can write them in the paper or on the long book, as you wish. There's no specific guideline or the restriction for all these things. But what we recommend, put all the essays of 4 papers, 16 essays together, spiral bound it and send it by post. Okay. Please do not send separate. One paper aitu kalasbidana, innon paper, no. Send all together because we send them for the valuation later. While spiral binding, you will get one front sheet to attach. That is to enter your details like the name, then the course name, and the evaluator will enter the evaluated marks in that sheet only. So attach that. We will circulate that through the WhatsApp group and the website. You can just download it, get it printed, then attach it to your book. That is your assignment book. Next, yes. Do not put your personal opinions for any essays. It should be referred and written down. You can make it an essay form like introduction, then the content, then the conclusion, but your personal opinion should not be entered. Yes, SIM means self-instructional material. Notebooks, your books. The corrections are done by the experts in the board of examination. Okay. So please be careful while writing down. You only should write down. ಮಕ್ಳ ಹತ್ರ ಬರ್ಸೋದು, ಫ್ರೆಂಡ್ ಹತ್ರ ಬರ್ಸೋದು ದಯವಿಟ್ಟು ಮಾಡಬೇಡಿ. ಹ್ಯಾಂಡ್ ರೈಟಿಂಗ್ ವೇರಿ ಮಾಡ್ಕೊಳ್ಳೋದೆಲ್ಲ ಮಾಡಬೇಡಿ. ಒಂದ್ ಸ್ವಲ್ಪ ನೀವು ಬರದ್ರಿ, ಆಮೇಲೆ ಟೈಮ್ ಆಯ್ತು, ಗಂಡನ ಹತ್ರ, ಹೆಂಡತಿ ಹತ್ರ, ಮಕ್ಳ ಹತ್ರ, ಪಕ್ಕದ ಮನೆಯವ್ರ ಹತ್ರ ಅದೆಲ್ಲ ಬರೆಸ್ಬೇಡಿ. ರೈಟ್ ಬೈ ಯುವರ್ ಸೆಲ್ಫ್ ಬಿಕಾಸ್ ಇಟ್ ಶುಡ್ ಬಿ ಅಥೆಂಟಿಕ್. This I think I have already discussed. Next one. This book, that assignment book, can be sent by post or courier, or you can also reach it to our office. But please confirm when you send it, it reached us. 4 years ಹಿಂದಿನವರೊಬ್ರು ನಾನು ಕಳಿಸಿದ್ದೆ ಅಂತ ಹೇಳ್ತಿದ್ದಾರೆ. ನಾನೇನ್ ಡಾಕ್ಯುಮೆಂಟ್ ತಗೊಂಡ್ರು ಸಿಗ್ಲಿಲ್ಲ. She wrote the examination last year. 4 years ago she enrolled and she submitted she is telling that she submitted the assignment, but there was no proof. With her also there was no proof. So she had to rewrite everything and submit it. So please do not do that. Once you send it, please confirm at our office that it has been reached. There is no provision for the revaluation of the assignments. Marks allotted by the examiners is final. Then assignments need to be submitted during the year of the admission itself. Assignment submitted later will not be considered for internal assessment. There are sometimes students are not able to write their exams for different reasons in the specific academic year. There is option to write the examination later, but your assignments, your internal assessment should be completed in the specific admitted academic year only. Hope you got this. ನೀವೇನು ಅಡ್ಮಿಷನ್ ಆಗಿದ್ದೀರಲ್ಲ, ಇದೇ ವರ್ಷನೇ ನಿಮ್ಮ ಅಸೈನ್ಮೆಂಟ್ ಗಳನ್ನ, ಇಂಟರ್ನಲ್ ಅಸೆಸ್ಮೆಂಟ್ ಅನ್ನ ಕಂಪ್ಲೀಟ್ ಮಾಡ್ಬೇಕು. ಯಾಕಂದ್ರೆ ಆ ಮಾರ್ಕ್ಸ್ ಒಂದ್ಸಲ ಎಂಟ್ರಿ ಆದ್ಮೇಲೆ ಮತ್ತೆ ಅದನ್ನ ಚೇಂಜ್ ಮಾಡಕ್ಕಾಗಲ್ಲ. ನೀವು ಎಕ್ಸಾಮಿನೇಷನ್ ಎಲ್ಲಿಯಾದ್ರೂ ಒಂದು ಬರ್ದಿಲ್ಲ, ನೆಕ್ಸ್ಟ್ ಇಯರ್ ಬರೀತೀನಿ, ಅಥವಾ ಈ ವರ್ಷ ಎಕ್ಸಾಮೇ ತಗೊಳಕ್ ಆಗ್ತಿಲ್ಲ, ನೆಕ್ಸ್ಟ್ ಇಯರ್ ತಗೊಳ್ತೀನಿ, ಕ್ಯಾನ್ ಡೂ. ಬಟ್ assignments cannot be redone. So please complete all your internal assessment tasks in this academic year only. Last date for submitting assignment, April 29th. No postponement, please. Note down the date. Before this, you have to complete all your tasks of theory as well as the practicals. Istrolage ella mugiskolbekagutte. Because your submission of the assignments includes your theory assignment as well as practical assignment. I told you, you have to come for 3 days, do your practicals and write the report, and that also should be submitted before April 29th. So plan your dates for the practical in such a way that you complete everything before this 29th of April. ಡೇಟ್ ಆದ್ಮೇಲೆ ಸಬ್ಮಿಟ್ ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ ಅಂತ ಯಾರು ಕೇಳಲ್ಲ ಅಂತ ಅನ್ಕೊಂಡಿದೀನಿ. ಮಾರ್ಕ್ಸ್ ಕಟ್ ಆಗುತ್ತೆ. ಎಸ್. Yes. Next. There will be exam orientation tentatively 29th of August 2026. So it will be held on one of the weekends. No registration for this exam orientation. Experts will talk about how to attend the exam and revise the practicals. It will be held online. Dates will be announced through WhatsApp. It will be confirmed anyhow through WhatsApp group. Final examination date is this. Of course, the final declaration of the date of the examination will be done only 45 days before the exam. And that should be done from the board, from Manipal Skill Development Center. The tentative dates which we have proposed to the board is this. There will be theory examination as well as practical examination. Generally, theory examination will commence from Thursday, Friday, Saturday, Sunday. The next Saturday, Sunday, you may have your practical examination. That is how it is planned generally. Theory examinations will be held in the study centers. They will give you the place for writing your theory exam at a time, but only the single schedule will be there for theory examination. Mangalore, Shimoga, Bangalore, and Mysore. In 4 places, theory examination will be held. All the students of all the centers will come here for the practicals. Practical will be of 1 day. Okay. For that, all the students will come here because it is one setup for the practical examination. Practical examination contains your demonstration as well as writing part. Therefore, it is planned here only. Next. So the last sentence, results are totally in the purview of the Board of Examination and Manasa has no say in this matter. Yeah. So internships. Internship can be done at Manasa or elsewhere, online or offline. Duration for the diploma courses, a minimum of 15 days, after which a certificate will be given. Only if you complete your internship, then only the certificates are issued. Any 15 days in the month of April, May, June, or July. Evaluated reports by the supervisor and a copy of the certificate duly signed by the supervisor issued by the recognized organization should be submitted to Manasa by post or courier before July 30th. After completing your internship, you will be submitting a report of the internship and it should be evaluated by the supervisor in that place. That should be submitted to Manasa and it will be sent to Manipal Skill Development Center. Along with that particular report which is evaluated, you have to get a certificate of internship from the organization. This is very valuable for your purpose also, for your future career. For the examination also, it is very important. Yes, please. Huh.
This unit.
Yes.
Oh, okay. Ma'am, for example, in the common paper 1, the understanding human behavior, there is a unit, first unit. At the end of each unit, there are some assignment questions. So, in our assignment, we are supposed to answer these questions plus the essay.
Yes.
That's the understanding, right,
Correct.
ma'am? Okay.
You can select the question which are given at the end of the unit.
The 3
or
questions.
we will also circulate list of the questions. From that also you can select.
Okay.
There's no restriction that you have to select the question from our list only. You can select the question from the study material also.
So my understanding is from the list of questions that you will send and the list of questions that's available
Anyone.
in that, we pick any one and
top.
then write the essay which is
Correct.
about 1,000
Perfect.
words.
Correct.
Okay. All right. Thank you, ma'am.
Yes. Any other question?
Timings of online session, ma'am, Saturday.
2 to 5.
Can it be altered?
Like what time?
Like after 4 or 5.
Little difficult because of the resource person's convenience and it is too long, no? 3 hours of session. That's why.
As we are working for professionals, it will be difficult for us. Means 6 days, half day we have to.
Little difficult because of the arrangements to be done and the resource person's convenience, all those things, madam. Okay. In the workplace itself, you please try to log in. Agbuda.
Theory papers are 4, right? So 40 marks are from internal assessment and 60 marks we need to write.
Correct.
So this 60 marks contains, I mean, it's a descriptive text or multiple choice questions.
Sir, this is a new pattern now. So they have already proposed to have MCQs also in the question paper. So there will be 3 kinds of questions. Few MCQs and the 2 other parts will be for the essay types.
Essay types.
Yes.
Okay.
In the old question papers, you will not find the MCQs. 3 marks questions are there, then the I think 5 marks questions and the 10 marks questions. That's how it is. There would be some changes regarding the question paper pattern, but most of the things are the same pattern.
Okay. And out of 60, we should score minimum how much? 40?
Of course, there is no minimum marks for passing at Manasa course. There is only 60% to get first class.
I mean, 40.
Yes,
Because-
40%, sir.
Yeah,
40%. See, your final result of each paper will be the combination of your score with the internal assessment and the examination, which is consolidatedly 40, which should be 40% to pass. Okay. But there are chances that they keep minimum for the internal assessment. They may keep minimum for the examination also.
That is how much.
So your effort, let it be such that you have minimum in each paper. If you are a person to look for the minimum, but I know.
Minimum out of 60 is 20, 30.
40% of 60. How much it is? 80 iddaga 28 ittu. 24.
24. Okay. Because we...
Sir? Enough to pass.
Why big?
Those who have attended today, either online or offline, that itself proves me that you are not a person aspiring for 40%.
We are writing after so long gap, right? Writing. Yeah. Okay. Thank you.
So I know lot of tasks are there with the very idea that the course should be academic and should help you to be competent enough to enter the field. So please abide by all the tasks, assignments, and the curriculum because they are really meaningful. Since 2003, we are able to keep the quality of the course just because of the students' involvement and the participation at each task. So let us abide by each task. We will also abide by our words and the responsibilities. I request each one of you to make yourself planned, scheduled, to give your time, energy, and interest, enthusiasm, everything with great sustainability till the completion of the course. Thank you so much. Now there will be a small orientation tour. You can join us. We'll take you to Manasadara first, then our Manasa Hospital where you can see the functioning. Of course, today is a Sunday, but some functioning is going on. Yes, sir. Thank you. Thank you so much. For Mysore students, those who are on online, Mysore students, the study center is Skanda. The address will be shared through your WhatsApp group. Of course, for the examination, the center would be different. We will let you know. Sir. Yes, sir. Thank you. Thank you so much. Sir. Yes, sir. For attending online, unmute. No, ಅವರು ಅನ್ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡು ಕೇಳ್ಬೋದಾ You can text your question through online. We are going through it. You can put it in the comment box. Please compulsorily, please take the reference of the study material. You can add other references also, but definitely not personal opinions. Without reference, the essays are not valid. No, we do not have Hassan Study Center. If you make more than 15 there, we will make a study center there, 15 students. We do not have. Please come to Shimoga, or you can choose Mysore or Bangalore. Do you like to have a group photo? Quick assemble. Madam, you wanted to ask something. You can break. 1 week plus 1 week ಮಾಡ್ಕೊಳ್ಬೋದು. ಆಫ್ ಮಾಡಬಹುದಾ? ಇದು ಆಫ್ ಮಾಡಬಹುದು ಮೈಕ್. Thank you all those who are joining online. Those who are here offline, we are taking a photograph, but we definitely miss you. We will have another photograph during our offline class. Thank you.